Good morning. Good morning. We are ready. We have quorum. So we are going to start in a few minutes the session of today, Wednesday, October the 2nd. Thank you. Madam President, when you're ready, we can start. Tenemos quórum, señora Presidenta.
Muy buenos días.
Good morning, everyone. We will start with item 2.1, third report of the Credentials Committee. And I'd like to call on the delegate of Canada, the chairman of the Credentials Committee, to present the third report of the Credentials Committee.
Third report of the Committee on Credentials. In accordance with Rule 31 of the Rules of Procedure of the Directing Council, the Committee on Credentials appointed at the first meeting held its third session on 2 October 2024 at 8:30 a.m. The committee examined the credentials delivered to the Director of the Pan American Sanitary Bureau in accordance with Rule 4 of the Rules of Procedure of the Directing Council. The credentials of the delegates of the member and participating states and associate members listed below were found to be in good order, and the committee therefore proposes that the Directing Council recognize their validity. Member and participating states: Antigua and Barbuda, Argentina, Bahamas, Barbados, Belize, Bolivia, Brazil, Canada, Chile, Colombia, Costa Rica, Cuba, Dominican Republic, Ecuador, El Salvador, France, Guatemala, Guyana, Haiti, Honduras, Jamaica, Mexico, Panama, Paraguay, Peru, St. Kitts and Nevis, St. Lucia, St. Vincent and the Grenadines, Trinidad and Tobago, United Kingdom, United States of America, Uruguay, associate members, Puerto Rico.
Muchas gracias.
Thank you very much, Canada. Is everyone in agreement?
Si no hay objeción,
If there is no objection, I declare the report approved. Thank you very much. Let us now move on to item 3.3, election of 3 member states to the Executive Committee on the expiration of the periods of office of Argentina, the plurinational state of Bolivia, and Jamaica. I would like to bring document CD 61/3 to the attention of the Council and report that the nominations of Brazil, Colombia, El Salvador, and Haiti were received. At this moment, I yield the floor to the plenary in case any member state would like to make a comment.
cedo la palabra.
I yield the floor to Haiti. Good morning, everyone. Madam Chair, in this context, 4 countries are in competition for 3 posts on the basis of consensus, and after a dialogue, Haiti has believed in promoting fundamental principles. We align ourselves with the principles of solidarity and spirit of Pan-Americanism, which are been historically Haiti's beliefs. In view of the fact that countries can present arguments to justify their presence of the Executive Committee, we would like to state that the committee commitment made has not been agreed to. But because of the need to establishing balance in our exchanges, we have taken a decision on behalf of the decision. We realize there will be no representative of CARICOM in 9 positions, but to follow the consensus that characterized our region in spite of the differences, in a spirit of Pan-Americanism that has always characterized Haiti since our independence in 1904, we have withdrawn our. We would like to propose our candidacy for 2025, 2026, and withdraw our nomination for this period.
Muchísimas gracias. Ay,
Thank you very much, Haiti, for having withdrawn your candidacy. I now call on the secretary to please read and present the item and the report on the rules and regulations pertaining to this point. Thank you very much, Madam Chair.
Under the Constitution, is composed of 9 members of the organization, which are elected by the conference or the council for overlapping periods of 3 years. This year, it is incumbent upon the council to elect 3 members to replace Argentina, Bolivia, and Jamaica, whose terms on the committee have expired. I also want to explain that although France, the Netherlands, and the United Kingdom have voting privileges, they are not eligible for membership on the Executive Committee under the Constitution and the Rules of Procedure. Associate members and observer states are not entitled to vote, nor they may be candidates for the Executive Committee. The only other countries not eligible for election this year are the 3 outgoing members of the Executive Committee, as mentioned, Argentina, Bolivia, and Jamaica, because a member is not eligible for re-election to the Executive Committee until 1 year has elapsed since the expiration of its terms of office. Also, the current members of the committee, that is, Canada, Chile, Ecuador, Guyana, United States of America, and Uruguay, are not eligible for election. If the number of candidates does not exceed the number of vacancies, Rule 51 of the Rules of Procedures applies. This rule states in relevant part, when the number of candidates for elective office does not exceed the number of offices to be filled, no ballot shall be required, and such candidates shall be declared elected. Rule 57 states, the term of office of the members elected to the committee shall begin immediately after their election and shall continue until their successors are elected in accordance with Article 15, Paragraph A of the Constitution. Thank you, Madam President.
muchas gracias, señor secretario.
Thank you very much, Mr. Secretary. I would like to inform the Council that since there are only 3 candidates pursuant to Article 51, Brazil, Colombia, and El Salvador have been elected to join the Executive Committee. I now would like to ask the rapporteur to present the proposed resolution formalizing the decision of the Council. Thank you very much, Madam Chair. Draft resolution strategy election of 3 member states for having been electing to because the states of Argentina and the polynomial states of Argentina and Jamaica have concluded. The 61st Directing Council, bearing in mind the provisions of Article 9.b and 15.a of the Constitution of the Pan-American Health Organization, PP2, considering that Brazil, Colombia, and El Salvador were elected to serve the Executive Committee upon expiration of the period of offices of Argentina, the plurinational state of Argentina, plurinational state of Bolivia and Jamaica, resolves to declare elected Brazil, Colombia, and El Salvador for membership on the Executive Committee for a period of 3 years. OP2, to thank Argentina, the plurinational state of Bolivia, and Jamaica for the services rendered to the organization during the past 3 years by their delegates on the Executive Committee. Thank you very much, Madam Chair. Thank you. If there is no objection, I declare the resolution adopted.
Ahora pasamos al punto 6.
Let's move on to 6.1, selection of 2 member states in the region of the Americas empowered to designate a person to serve on the Policy and Coordination Committee of the UNDP, UNICEF, WHO, World Bank, special programs of research, development, and research training in human reproduction. I'd like to draw the Council's attention to documents CD 61/17, and I now call on the Secretariat to introduce the item and report on the statutory provisions concerning this item.
Gracias, señora presidenta. The United Nations Special Program of Research, Development, and Research Training in Human Reproduction, known as the Human Reproduction Program, or HRP, is the main instrument within the United Nations system for research in human reproduction, bringing together policymakers, scientists, healthcare providers, consumers, and community representatives to identify and address priorities for research to improve sexual and reproductive health. HRP is based at the WHO headquarters. The HRP Policy and Coordination Committee is its governing body responsible for reviewing and approving HRP's plans of action, budget, strategic plans, annual financing statements, and periodic progress reports, among other functions. The HRP Policy and Coordination Committee includes 14 WHO member states elected for 3-year terms, according to the population. The region of the Americas has been allocated 2 members. In electing HRP committee members, due consideration should be given to the country's financial and/or technical support to HRP and its interests in family planning, research, and development in human reproduction, and fertility regulation as demonstrated by national policies. The terms of office of Nicaragua and Uruguay expire on 31st December 2024, and thus the Directing Council, in its capacity as the Regional Committee of WHO for the Americas, must elect 2 members to serve for the period 1st of January 2025 to 31st of December 2027 on the HRP Policy and Coordination Committee. Rule 51, as I mentioned earlier, of the Rules of Procedure of the Directing Council provides in relevant part when the number of candidates to be elected to the elective office does not exceed the number of offices to be filled, no ballot shall be required, and such candidates shall be declared elected. Thank you, Madam President.
Muchas gracias, señor secretario.
Thank you very much, Mr. Secretary. I would like to report to the Council that we have received the candidacies of Brazil and Peru. Given that there are 2 candidates for 2 vacant positions, and in accordance with Article 51 of the Rules of Procedures of the Directing Council, there is no need for a vote. Therefore, I declare Brazil and Peru selected to serve on the Policy and Coordination Committee of the UNDP, UNFPA, UNICEF, WHO and World Bank Special Program of Research Development and Research Training in Human Reproduction. I inform the Council that there is no need to adopt a resolution on this item. I inform the Council that the designation will appear as a decision in the final report. Let's now move on to the next item, 6.2, election of 3 members to the Advisory Committee of the Latin American and Caribbean Center on Health Sciences and Information, BIREME. I would like to bring to the attention of the Council document CD 6118 and call on the Secretariat to introduce the item and report on the regulatory provisions pertaining to this item.
The Latin American and Caribbean Center on Health Sciences Information, BIREME, is a specialized center of PAHO established in 1967. The center's objective is to contribute to health development for the populations of the region of the Americas, promoting cooperation among countries, the democratization of access to scientific and technical information, legislation, and the sharing of knowledge and evidence to support steady improvement of the health, education, and research systems. In accordance with the governance structure established by its statute, BIREME consists of 3 permanent bodies. First, an advisory committee. Second, a scientific committee. And third, a secretariat. The advisory committee is composed of 2 permanent members, one appointed by the government of Brazil and one by the director of PAHO, and 5 non-permanent members selected and named by the conference or the directing council of PAHO from among BIREME membership described in Article 4 of BIREME's statute. According to Article 6 of the statute, selection of the 5 non-permanent members should take into consideration geographical representation and be rotated every 3 years. However, the conference or the directing council of PAHO may indicate a shorter rotation period in cases where it's necessary to maintain balance among the members of the advisory committee. This directing council is asked to elect 3 non-permanent members to serve on the BIREME Advisory Committee on the expiration of the periods of Chile, Guatemala, and Trinidad and Tobago. As mentioned earlier, Rule 51 of the Rules of Procedure of the Directing Council provides in relevant part, when the number of candidates for elective office does not exceed the number of offices to be filled, no ballot shall be required, and such candidates shall be declared elected. Thank you, Madam President.
Muchísimas gracias.
Thank you very much, Distinguished Secretary. I would like to let the Council know that we've received the candidates of Colombia, Honduras, and Jamaica. Since there are 3 candidates for 3 vacant positions and in accordance with Article 51 of the Internal Regulations of the Directing Council, no voting will be necessary. Therefore, I declare Colombia, Honduras, and Jamaica elected to serve on the Advisory Committee of the Latin American and Caribbean Center on Health Sciences Information. Next, I'd like to ask the rapporteur to please introduce the proposed resolution to formalize this election. Thank you, Madam Chair. Proposed resolution on agenda item 6.2, election of 3 members to the Advisory Committee of the Latin American and Caribbean Center on Health Sciences Information, BIREME. The 61st Directing Council, PP1, bearing in mind that Article 6 of the Statute of the Latin American and Caribbean Center on Health Sciences Information, BIREME, establishes that the Advisory Committee of BIREME is to be comprised of 1 representative appointed by the Director of the Pan American Sanitary Bureau and 1 by the Government of Brazil as permanent members, and that the 5 non-permanent members are to be selected and named by the Directing Council or the Pan American Sanitary Conference of the Pan American Health Organization, from among the BRME membership, which at this time includes all PAHO member states, participating states, and associated states, taking geographical representation into account. PP2, recalling that Article 6 further states that the 5 non-permanent members of the BRME Advisory Committee should be rotated every 3 years, and that the Directing Council or the Pan-American Sanitary Conference of PAHO may indicate a shorter rotation period in cases where it is necessary to maintain balance amongst members of the Advisory Committee. PP3, considering that Colombia, Honduras, and Jamaica were elected to serve on the BRME Advisory Committee beginning January 1st, 2025, due to the completion of the term of Chile, Guatemala, and Trinidad and Tobago. Resolves. OP1, to declare Colombia, Honduras, and Jamaica elected as non-permanent members of BRME Advisory Committee for a 3-year term, 2025-2027. OP2, to thank Chile, Guatemala, and Trinidad and Tobago for the services provided to the organization by their delegates on the BRME Advisory Committee over the past 3 years. Thank you very much, Madam Chair. Thank you very much. Next, I open the floor to the plenary for discussion on the proposed resolution.
Al no haber objeción,
If there are no objections, I declare the resolution adopted.
bueno, ahora nos toca el punto 4.
And next, we move on to agenda item 4.2, the strategy and plan of action to decrease the burden of sepsis through an integrated approach of 2025-2029. This was left pending yesterday, so I'd like to call on Dr. Sylvain Alighieri, Director of the Prevention and Control and Communicable Diseases Prevention, Control, and Elimination of the Pan-American Sanitary Bureau, to please come to the head table. Thank you very much, Doctor, and we shall continue with the debate. And for that, I give the floor to Jamaica.
Thank you, Madam President. Jamaica commends PAHO on the development of a strategy and plan of action to decrease the burden of sepsis over the period 2025 to 2029 using an integrated approach. Sepsis is a major cause of concern in Jamaica, as it is the final common pathway to death for severe infectious disease that may arise out of different pathologies. All age groups are affected. Neonatal sepsis contributes to the high neonatal mortality rate that impedes us reaching the 2030 SDG target. Jamaica therefore welcomes a plan that looks at strengthening health systems to prevent sepsis and reduce the burden of the disease that begins with prevention. We recognize that we must turn to prevention in order to reduce overcrowding in our hospitals, as capacity in secondary care has limits and is expensive socially and economically. The 3 strategies that emphasize increasing awareness, reducing infections through vaccination, and improving IPC measures in home, community, and health care facilities, improving access to timely diagnosis, and ensuring quality, safe, and comprehensive care are areas that we have already started to work on. This strategic plan will therefore serve to harmonize and coordinate these efforts to accelerate us achieving better outcomes. Jamaica has introduced the birth dose hepatitis B and will expand the immunization schedule to include the pneumococcal vaccine to all children. We will continue to strengthen our efforts to reach the 95% target for all antigens. We're engaging in a WASH project with UNICEF to strengthen water, sanitation, and hygiene services in 349 healthcare facilities, schools, and 78 designated shelters for disaster. We have recommitted efforts to develop a national strategic plan for infection prevention and control. With respect to antimicrobial resistance, The Health Ministry is revitalizing a joint ministerial committee with Agriculture and Industry to draft the National Action Plan for AMR. Jamaica is therefore committed to implementing the strategy and plan of action. We look forward to PAHO's continued support in all areas. Thank you.
Muchas gracias.
Thank you very much, Jamaica. And now I give the floor to Brazil. Thank you very much, Madam Chair. Brazil would like to stress the critical relation between sepsis and AMR. We acknowledge that the new AMR of rapid diagnosis are essential in order to improve the results of the treatment to control AMR, and which is avoided in order to have an effective treatment of sepsis. And for that, we need a global plan on antimicrobial resistance according to WHO and the plan of action on antimicrobial resistance of PAHO. Besides this, equitable access to medicines and adequate treatment for sepsis ought to be fine-tuned following guidelines such as a campaign against sepsis, and to enhance regional production capabilities. Initiatives such as PPPs are crucial in order to ensure the availability of medicines and to promote the rational use of antimicrobials. Investments in research and the development of new therapies are also necessary. Brazil would like to fully support, as an observer, the strategy and plan of action to decrease the burden of sepsis through an integrated approach based on evidence that is aligned with Brazil's objectives and targets in order to improve promotion and treatment of sepsis, adding to international guidelines, which highlights the commitment shown by Brazil in having a significant reduction of the burden of sepsis, improve public health, and save lives. Last but not least, I would like to say that Brazil greets the approval of the political declaration, which is the result of the high-level meeting on antimicrobial resistance, which was held in New York during this last week. We stress the need for working in a coordinated fashion as a region in order to ensure effective implementation of the commitments undertaken. Thank you very much.
Muchas gracias.
Thank you very much, Brazil. And now I give the floor to Peru.
Muchas gracias.
Thank you very much, Madam President. The delegation of Peru would like to express its gratitude for the presentation of the strategy and plan of action to decrease the burden of sepsis through an integrated approach at 2025-2029, one of the main causes of morbidity and mortality in our region. Even the availability of statistical data on the incidence of sepsis in Peru is limited. We have decided that the hospital mortality rate because of this pathology varies between 25% and 40%. This problem affects in a disproportionate way vulnerable groups such as newborns, pregnant women, and older adults, committing and endangering not only the health of our population, but posing a significant challenge for the economic sustainability of our health system. It is within that context that Peru has shown firm commitment in dealing with this problem, as is seen by the enactment of the new law, which is the one that strengthens prevention and control of infections related to healthcare as a component of the national public health policy. This new law sets a comprehensive framework to have preparedness, prevention, and control of diseases related to healthcare, and includes strategies such as optimized integrated surveillance, prevention, control, multimodal strategies for the control of infections, strengthening of capacities in health professionals at all levels, amongst others. Besides, we have been implementing an intensive plan in order to recover our regular immunization schedule. Therefore, we believe that this strategy, as proposed, strengthens the attainment of our objectives by proposing a holistic strategy that covers from prevention to rehabilitation, being supported in cross-cutting actions such as community participation, the strengthening of the health system, and the decision-making based on the best available scientific evidence. We believe that the strategy proposes specific goals as measurable indicators that can be reachable by 2029. concentrating specifically on the protection of vulnerable groups. These goals are not only ambitious, but they're essential in order to improve the health results in our region. Therefore, the delegation of Peru offers its resolute support to this proposal with a conviction that an equitable and collaborative strategy will reduce mortality as related to sepsis, improve its management in the Americas, thus contributing to the health and well-being of our populations. We are very grateful for your attention.
Muchas gracias, Perú.
Thank you very much, Peru. And now I give the floor to Costa Rica.
Muchas gracias.
Thank you very much, Madam Chair. Costa Rica would like to thank the Secretariat for presenting this proposal on the strategy and plan of action to decrease the burden of sepsis through an integrated approach. It is within this context that we take advantage of this opportunity and the input provided by our technicians in Costa Rica to offer the following comment. The document points out to the need of a coordinated and multidisciplinary effort in health services, which can be achieved with greater awareness raising with the professional health community, better training for our experts, and knowing about the local burden of sepsis. However, the document does not have the specific tools in order to attain that objective. Therefore, it would be useful to have a detailed description on how to improve communication amongst all suppliers and providers of this distributed efficiently, and then to value where we can reinforce the human resource devoted to this work.
Puede fortalecerse también dando
We can also strengthen this, providing specific recommendations for health services such as inclusion
en las prácticas rutinarias, el desarrollo de
of infection control, the development of hand washing, and the creation of systems to monitor and assess the efforts for infection control with concrete recommendation. Hopefully, the best practices already implemented elsewhere.
destaca la importancia de una mayor inversión en investigación y desarrollo de diagnósticos, tratamientos.
It also stresses new treatments and preventive, innovative strategies for sepsis. This point could become even stronger, providing specific recommendation to health services on the way they have to deal with research and innovation, particularly maybe countries that are just starting in this. Among other things, it could be the promotion of cooperation of research on the development of new technologies and the support for the implementation of practices based on evidence, and why not provide support in a multi-centric research where through a protocol we can participate in measuring things as we're doing. And thus, if we move together, we walk together, we attain the target altogether. Let me tell
Las coberturas de vacunación en Costa Rica han
research coverage in Costa Rica has improved, giving more information to the population and recalling the benefits of preventing hospitalization, deaths, and diseases. Better communication was able to raise the coverage. We are already in the process of what the digital prescription is for AMR in order to give traceability to said treatments and to avoid with that bad prescription and resistance. In a nutshell, the holistic approach that is provided by this is a significant base, but we ought to expand this with more information on different actions and services in order to adopt and thus to cooperate with the attainment of the strategic objectives. Thank you.
Muchas gracias, Costa Rica. Ahora cedo la palabra.
Thank you very much, Costa Rica. Now I give the floor to Argentina. Thank you, Madam Chair. Good morning, everyone. Argentina would like to express its gratitude for this report. If we take a look at the development of this strategy and plan of action to strengthen the public health response to sepsis through an integrated approach that will include social awareness, community participation, improvement in the health system, and the strengthening of the decision-making based on evidence. Likewise, it is very important for the strategy and the plan of action to be cross-cutting, including all sectors, and involve vaccine prevention and access to water and hygiene, and infection control programs, as well as access to medical care and early diagnosis, timely diagnosis, with a disease where hours of delay in the diagnosis and access to treatment are equal to a lost life. We believe that it is key to emphasize the following: the hand-washing campaign as a pillar in order to prevent sepsis, the national vaccination calendar, which is free for the entire population, and even the coverage of the 3 vaccines mentioned in the document, regionalization, perinatal regionalization, and public maternity wards as a priority strategy. The raising awareness campaigns addressed to the community in order to further strengthen self-care. We agree that one of the greatest challenges is the economic burden linked to the detection and the treatment of sepsis, in particular in countries in Latin America, where inequalities and equitable access to resources and healthcare are even greater. In that regard, our country works in order to attain universal health coverage, and therefore we support the 3 lines: intersectoral coordination, improving the health sector, adopt the measures to the context of each context, and support these measures in practices based on evidence. We thank the Pan American Sanitary Bureau for the technical support provided to countries in order to mobilize the necessary additional resources in order to carry out the strategy and plan of action. Therefore, Argentina supports this strategy. Thank you very much.
Muchas gracias, Argentina.
Thank you very much, Argentina. And now I give the floor to Bolivia.
Muchas gracias.
Thank you very much, Madam Chair. For our country, we know of the underreporting of sepsis. To get to know how this impacts the population with prevalent pathologies such as malaria, TB, HIV, as well as other infections or infectious diseases preventable through vaccination, and the presence of these infections as they are linked to health systems with problems in reporting, which compels us to look after epidemiological surveillance in hospitals, as well as recreating a single information system through which we will make more transparent and more universal the access to information in order to have adequate planning. To get to know what the most affected populations are by sepsis, identifying this problem as a part of the care that is provided in health in vulnerable populations of difficult access, which is translated for us in the implementation of this single health system. The unique system, SUS, tried to strengthen primary health care, thus reaching with that universal access marginalized or vulnerable populations, as is the case of our native indigenous populations. We want to empower the population with universal coverage, taking into account aspects that are inherent in order to improve and look for our health in an intersectoral manner and enforcing medicine based on evidence. To achieve a multidisciplinary response with awareness raising, a coordinated response with the community as main pillars in order to be able to address this issue. The human resource is always insufficient in these remote areas where you can reach with training that is in person as well as remotely using technology such as telehealth that was implemented in our country. 340 municipalities having online and offline courses for different issues of importance and need, such as sepsis. Everything with one purpose, which is a timely detection and effective, efficient response by the health personnel, which is translated in reduction of morbidity and mortality. These are different strategies with an increase in the coverage in vaccination, a state policy in tenure of quality housing for vulnerable population.
Que al mejorar la calidad de vida se traduce pues en calidad de salud.
Policies that improve the quality of the life of these communities, the use of a strategy in health, such as integrated networks, are also facilitating and improving these concepts in avoiding and reducing mortality caused by sepsis. Thank you very much.
Muchas gracias a Bolivia.
Thank you very much, Bolivia. Now I give the floor to Honduras.
Gracias, Presidenta.
Thank you, Madam Chair. Honduras would like to extend warm appreciation to Pan American Health Organization, for the exhaustive document presented, which gives us clear directions to deal with the critical challenges of public health. The proposed policy reflects a deep commitment to the well-being of our most vulnerable populations, and makes us proud to say that Honduras has moved forward in strengthening its health services, specifically in the maternal and neonatal area. This is a base to provide quality care to our mothers and newborns. However, we acknowledge that there are still significant challenges facing us, particularly with regard to surveillance and analysis of sepsis cases. Sepsis continues to be a significant reason for mortality and morbidity, and that is why we are committed to strengthening the diagnosis mechanisms and improving response time. We applaud the strategy presented by PAHO, which not only guides us towards more effective management of this condition, but also strengthens the role of diagnostic means and the mechanisms for key rehabilitation to ensure comprehensive health. We also are dealing with a growing threat because of the antimicrobial resistance, which requires a decided coordinated action. We'd like to ask the Secretariat to continue supporting Honduras in implementing a multisectoral approach, which allows us to integrate the areas of health, environment, and development. We firmly believe that only through timely and coordinated action can we overcome these challenges. It's fundamental not only to have advanced diagnosis tools, but also to have robust surveillance systems which allow us to detect and deal with sepsis in an effective and efficient manner. Thank you. Thank you, Honduras. I now call on Guyana.
Thank you, Madam Chair. I would like to congratulate PAHO on this strategy and plan of action, which aims to reduce the burden of sepsis in the Americas region from 2025 to 2029. We fully support the three key strategic lines of action and proposed indicators for monitoring and evaluation. Guyana has been working on reducing the burden of sepsis. We have conducted awareness and education campaigns for healthcare workers and the general public. These campaigns emphasize the signs and symptoms of sepsis, the importance of early detection, and the potential for severe outcomes if left untreated. The education of healthcare professionals focuses on timely diagnosis and evidence-based management of sepsis to improve survival rates. We have also worked on improving our health systems by enhancing our ability to manage sepsis through capacity building. This includes providing resources for early detection of sepsis in hospitals and clinics. We have installed better laboratory facilities, improving access to life-saving treatments such as antibiotics, and enhancing critical care infrastructure such as ICUs. We are working on enhancing data collection and surveillance systems for sepsis. And we've also started to implement standardized clinical guidelines for prevention, early diagnosis, and treatment of sepsis. In the area of antimicrobial resistance, Guyana is proud to say that we have recently developed AMR strategy with the assistance of PAHO, and now very soon we'll start the implementation of that strategy. This strategy would promote responsible antibiotic use and aims to reduce the incidence of drug-resistant infections, which can lead to sepsis. Guyana is committed in reducing morbidity and mortality caused by sepsis. This commitment involves prioritizing education, strengthening healthcare systems, enhancing data collection, and addressing AMR. We believe that with these interventions, that it would help to reduce sepsis in Guyana and contribute to the broader goal of the region of the Americas. We look forward to a closer collaboration with PAHO. Thank you.
Muchas gracias.
Thank you very much, Guyana. I now call on Haiti. Thank you very much, Madam Chair. Sepsis is a major problem in Haiti, specifically in our health, because our health system is weak because of the problem of supplies and the problems of security. Often cases are not well managed, and it leads to sepsis. Management of sepsis, therefore, is crucial to improve the reduction of mortality in our regions where access to care is limited. The strengthening of health facilities would help prevent, diagnose, and prevent sepsis and improve results for patients, particularly in the rural areas that are remote, where medical resources are rare. The strategy and plan of action that has been proposed provides technical and strategic means for member states to strengthen their health systems in order to combat sepsis and provide earlier intervention. This begins with prevention through vaccination first, prevention and control of disease, and initiatives for improving water, better hygiene, and better access to good quality healthcare service, quick diagnosis, and effective treatment of sepsis. The battle against the inequalities in healthcare, particularly for the more vulnerable populations, such as the newborn, children, and women, is helpful. It's a multinational problem which requires better surveillance to improve the elimination of sepsis. We need to have better awareness problems for understanding sepsis. The resolution also means improving the health system in Haiti by stressing prevention, detection, early detection, and a quick response to any infection. In view of the climate change that has been increasing and leads to greater infections, this is a very relevant strategy for Haiti. Haiti congratulates PAHO for adopting this policy and calls on all to support this and the draft resolution. Thank you very much.
Muchas gracias, Haití.
Thank you, Haiti. On this item, there's a non-state agent that would like to make a statement. I call on the World Federation of Anesthesiologists.
Gracias, señora presidenta.
Thank you, Madam Chair. The World Federation, WFSA, welcomes this strategy and plan of action of PAHO in order to reduce the burden of sepsis in the region of the Americas 2025-2029. As has been pointed out, sepsis continues to be a significant cause of morbidity and mortality throughout the region, with experience that covers the OR, pre-op work, critical care, emergency care, and post-op care. Anesthesiologists are at the vanguard of efforts in order to combat sepsis. Anesthesiologists will play a vital role in the implementation of this plan of action. WFSA, our organization, stresses the importance of effective management of infections in the surgical site and the management and patient management as a core components of the plan of action against sepsis. For the plan of action against sepsis to be successful, the strengthening of anesthesia services and ensuring the participation of anesthesiologists in the design and implementation of this plan are essential. To effectively implement the strategy against sepsis, the WFSA requests the member states of PAHO, and we believe that it is necessary to expand education and information programs. We ought to invest in strengthening and beefing up the labor force of anesthesiologists, increasing the availability of training opportunities to disseminate the latest infection control techniques and the management of sepsis, to improve pre-op protocols. Member states ought to support the development and the implementation of peri-op control that includes adequate antibiotic prophylaxis for infections in the OR, sterile techniques, and the preparation of the patient. To implement strategies to manage the blood of the patient, the optimization of patient blood management, which reduces the use of transfusions, which increases the risk of infections and contributes to sepsis. To develop national guidelines on sepsis, anesthesiologists have to contribute to the development of national guidelines on prevention and treatment of sepsis, in particular in peri-op and surgical environments. The WFSA hopes to work closely with PAHO and its member states in order to support the implementation of this essential strategy. Thank you very much.
Muchas gracias a la Federación.
Thank you to the World Federation of Societies of Anesthesiologists. And now I give the floor to Dr. Alighieri to respond to these comments.
Gracias, señora Presidenta.
Thank you, Madam Chair. I would like to express my gratitude and acknowledge the contributions made by 17 delegations: Mexico, Uruguay, Paraguay, Cuba, Panama, Brazil, Peru, Costa Rica, Belize, the U.S., Bahamas, Jamaica, Guyana, Haiti, Argentina, Bolivia, Honduras, and the contributions made by the World Anesthesiologists Federation. It would be extremely ambitious if I were to attempt to summarize the very complete statements made by delegations. So I will simply try to touch on the overall cross-cutting issues as well as relevant points for this forum. First of all, the very close relation between the work plan and the resolution on sepsis, with the policies and the plans of action on antimicrobial resistance. The fight against this resistance, may these be national, regional, and global plans. It seems to me that this is a cross-cutting issue in all the statements made by all subregions. I would also wish to stress, just as many other delegations, the laboratory networks issue in order to ensure an early diagnosis and a typification of the patient. That is a key in aspects of national reference labs, as well as access to the lab at the primary care level, and in hospitals of a higher resolution, including in aspects that have to do with the laboratory platform, access to new technologies, and new products. This is also related to an early access to medicines with good quality control, and it highlights the importance of national and regional capabilities of production of medicines. A patient that is typified and characterized must have access to the medicine indicated in this case. I would also wish to highlight other aspects such as has been done by other delegations, prevention aspects, including water and sanitation, including hand washing campaigns, and the interconnection as we have it with antimicrobial resistance. The complete interconnection with the programs established and reinforced for infection control. I would also wish to take note of the questions and the issues brought up by the delegation of Costa Rica in connection with the promotion of research and communication amongst health providers in order to ensure an integrated response.
J'aimerais maintenant
And now, I would like to touch on the aspects brought up by the delegation of Haiti in terms of security and on the ground, and the aspects that have to do with access to supplies, to medicines as diagnostic kits, including in the rural areas. This is an important issue that was brought up by the delegation of Haiti. And they also mentioned prevention, hygiene, and access to vaccines.
comments from the Caribbean countries, I'd like to highlight also, as many countries of Latin America, the necessity to have an alignment with antimicrobial resistance plans. This is crucial. And some delegation highlighted also the needs for international collaboration and technical assistance between countries. And the importance of joint ministerial committees regarding antimicrobial resistance and the interconnection, of course, with antimicrobial resistance and the need for campaigns. So, Señora Presidenta.
Madam Chair, I believe I have reviewed with you the most important aspects of each comment. Thank you very much, Dr. Alieri, for having responded to the comments. Mr. Director, would you like to make a comment? Yes, Madam Chair. Thank you, and good morning to everyone. I'd like to thank the member states for their participation in the debate and for the prior discussions that led to the presentation of this draft resolution. It involved extensive participation during the meetings of the Executive Committee and during the consultations that took place. In addition to sharing with us the challenges that each of the countries have and the progress and advances that are being implemented in each of the countries, they made some very specific suggestions for the implementation of this strategy and plan of action. And I think that's important to note. It's a good indicator of the fact that this is an issue that we need to do better coordination when we provide technical cooperation in order to strengthen the national capacities of each country to respond to this, which is one of the major public health problems, sepsis, and is directly tied to antimicrobial resistance and the quality of care, of healthcare services, and adequate access to diagnosis and to antibiotics in the region, as well as to the social determinants which were mentioned by some, that is the access to water, sanitation, issues with communication, and the preparation and training of human resources in the area of healthcare. So I think this is going to be a very important resolution, which will help guide us in establishing this priority in the region, where I think we can make significant progress in trying to reduce this unacceptable burden of deaths caused by sepsis. So it's part of the effort to strengthen the healthcare systems and the quality of care, and it will become a significant priority for the work and technical cooperation provided by our organization. Thank you, Madam Chair.
Muchas gracias.
Thank you, Dr. Barbosa, for your comments. And I would like to ask the rapporteur to introduce the draft resolution. Thank you, Madam Chair. Proposed resolution, strategy and a plan of action to decrease the burden of sepsis through an integrated approach 2025-2029. The 61st Directing Council, PP1, having reviewed the strategy and plan of action to decrease the burden of sepsis through an integrated approach 2025-2029, document CDC/51, PP2, acknowledging the significant impact of sepsis on public health in the region of the Americas, which results in substantial morbidity, mortality, and socioeconomic burden, and which requires a coordinated multidisciplinary approach to effectively address its prevention, early detection, and clinical management. PP3, reaffirming the commitment to promote universal health coverage and strengthening health systems to improve the response to sepsis at all levels of care. PP4, emphasizing the critical role of research and innovation in advancing our understanding of sepsis pathophysiology, diagnostics, and therapeutics. PP5, bearing in mind the goals and targets of the 2030 Agenda for Sustainable Development and the Sustainable Health Agenda for the Americas 2018-2030, which call for reducing the impact of infectious diseases and promoting rational use of safe, effective, and affordable medicines, resolves OP1 to approve and implement the strategy and plan of action to decrease the burden of sepsis through an integrated approach 2025-2029, document CD 61/5. OP2, to urge all member states, considering their context, needs, vulnerabilities, and priorities, to A, elevate sepsis to a high priority public health issue and integrate comprehensive strategies for its prevention, early detection, and clinical management into national health policies and plans. B, implement national strategies guided by the objectives outlined in the strategy and plan of action and establish effective monitoring systems utilizing the recommended indicators. C, ensure the allocation of adequate resources for comprehensive sepsis prevention and clinical management of programs with special attention to high-risk populations encompassing quality care, training, research, and public awareness campaigns. D, encourage national collaboration among the health, education, civil society, academic, and finance sectors for a unified approach to sepsis management, while also fostering international cooperation with various countries and organizations to exchange best practices, resources, and innovations in sepsis prevention and treatment. E, call for increased investment in research and development for innovative diagnostic treatments and preventive strategies for sepsis, including novel antimicrobial agents, immunotherapies, and vaccines. OP3, to request the director to A, provide technical cooperation to member states with a view to facilitating knowledge exchange to strengthen capacities that will contribute to the implementation of the strategy and plan of action. B, foster collaboration amongst member states to enhance the execution of this plan of action, adapting it to various sub-regional and national contexts and priorities. C, bolster partnerships with civil society organizations and patient advocacy groups to raise awareness, mobilize communities, and include patients' perspectives in policy development and program implementations related to sepsis. D, report periodically to the governing bodies of the Pan American Health Organization on the progress made and challenges faced in implementing this strategy and plan of action through a midterm review in 2027 and a final report in 2030. Thank you, Madam Chair. Thank you very much, Madam Rapporteur. I now open the floor to the plenary to begin the discussion on the proposed resolution.
Claro.
If there are no objections, the President declares the resolution adopted.
Ahora pasamos al punto 4.
We now will move on to item 4.4, the Plan of Action for Strengthening Information Systems for Health 2024-2030. I would like to bring to the Council's attention document CD 61/7, and I invite Dr. Sebastián García Seiso, Director of the Department of Evidence and Intelligence for Action in Health of the Pan American Sanitary Bureau, to come to the head table.
Ahora le concedo.
I yield the floor to the representative of the Executive Committee to report on the item. Thank you very much, Madam Chair. The Executive Committee expressed support for the new plan of action and commended the Bureau for its efforts to provide strategic direction to strengthen governance, foster innovation in areas such as artificial intelligence, and ensure effective use of data. It was considered critical to accelerate the digital transformation of the health sector, to develop secure digital solutions, ensure information system interoperability, and enable real-time data exchange. The delegates highlighted the value of collaboration between member states, including to exchange knowledge, best practices, and lessons learned, to improve data collection, use, and analysis, and share experiences, in particular on the use of technology and artificial intelligence. Delegates also outlined various challenges to achieving the digital transformation of the health sector, including technological and financial limitations, profound regional inequalities, and legal considerations, such as regulations on artificial intelligence. The health sector's vulnerability to cybersecurity risks, which could jeopardize patient care and safety, was highlighted, and the need to protect patients' health data was emphasized. They underscored the need for policies to ensure that all sectors of society, in particular vulnerable groups, benefit equally from the digital transformation. The Executive Committee adopted Resolution CE 174R3, recommending that the Directing Council approve the Plan of Action for Strengthening Information Systems for Health 2024-2030. Thank you, Madam Chair. This concludes my report on this item. Thank you very much, Madam Representative of the Executive Committee, for their report. I now call on Dr. Garcia Seiso to present the item. Distinguished Chair of the First Directing Council and delegates of the Council, Mr. Director and colleagues, it's an honor to present this new plan of action to strengthen information systems for health 2024-2030, a key document for the development of the region in the context of a society that is more and more digital and connected, where there exists more and more data available. This is a plan that is the outcome of a collective effort involving all member states and key partners, and the structure reflects and is based on lessons learned and progress achieved during the 2019-2023 period through the strategy known as IES4H, because of its acronyms in English, and the final report will also be presented this year. Also, in the framework of the roadmap to change the digital sector in the Americas, which was adopted by the Directing Council in 2021. The drafting of this document is the outcome of a discussion at the 60th Directing Council in 2023, noting the importance of maintaining achievements made through the last plan and adopt innovative priorities in the post-pandemic context. The document was developed through a broad consultation process with all member states. It began in November of 2023 through the regional meeting Relaxes 4.0 in Sao Paulo, Brazil, where all the countries and territories of the Americas participated, as well as 16 key partners who support this initiative. Highlighting amongst these the Inter-American Development Bank, the World Bank, the Spanish Cooperation Agency, USAID, CDC, Bloomberg, Bible Strategies, and the Agency for Cooperation in Germany, GZ, and others. Also a virtual meeting in May of this year with member states and the comments that were made at the last meeting of the Executive Committee, for which we are grateful. As you know, The pandemic in 2019 has demonstrated the importance of changing the digital aspect of the health sector and the need to have robust data systems that are interconnected and interoperable. Information systems for health in our region face many challenges. The assessment made by PAHO in between 2016 and 2023 revealed that 42.8% of the countries in the region are at the lowest level of maturity, using mainly analog data, and urgently needing digitization. 34.7% are at level 2, introducing good practices, but still facing significant challenges in the integration and standardization of data. Only 18.4% of the countries reached level 3, with standardized systems and continuous improvements, and only 4% are at level 4, with integrated systems that conform to international standards. No country in the region has reached level 5, which is the highest level. It means complete integration and continuous innovation in the information systems for health. In this context, the present plan is based on development of national strategies to manage data in an effective manner, to take decisions that are evidence-based and adopt new digital health solutions presented as regional public goods with a good cost-effectiveness ratio, and improve standards, legislation, and human skills to accelerate the digital transformation of the health sector. It covers information systems such as those pertaining to vaccinations, epidemiological surveillance, transmissible and non-communicable diseases, amongst other priority areas. We hope that this plan will significantly improve the effectiveness, integration, and response capacity of health systems by giving priority to the first healthcare level as the base for strengthening our systems. The new plan is based on 4 strategic areas of action to strengthen the management and governance of information systems for health by ensuring ethical and safe decision-making, improving data management and information technology by promoting interoperability and access to accurate and timely data, strengthen the management of information and knowledge to ensure that decisions made in the area of health are based on high-quality data, and finally, encourage innovation and digital health by integrating emerging technologies such as artificial intelligence and telehealth to improve access and efficiency in healthcare. This plan not only seeks to improve the structure and technological capacities, but also to develop a solid regulatory framework that promotes the health and ethical use of data and ensure that health personnel have the necessary skills to benefit from digital solutions. The implementation of this plan requires a multi-sectoral approach and the collaboration of different interested parties, including the private sector, academia, and international organizations. We are committed to providing technical cooperation and continuous follow-up so as to ensure its success. Thank you very much.
Muchas gracias.
Thank you, Dr. Garcia Seiso. I now invite the Directing Council to please consider the information presented in the document, make the relevant comments, and consider the possibility of adopting the draft resolution that is presented in Annex A. I now call on the plenary to begin the debate on this document. The debate on the resolution will take place once the rapporteur has read the proposed resolution. I now call on Guyana.
Thank you, Madam Chair. I fully support the plan of action for strengthening health information systems from 2024 to 2030. This comprehensive and forward-thinking plan is essential and pivotal for building more resilient and responsive health system across our region, underscoring its significance and its impact. In the face of today's rapidly evolving healthcare landscape, the need for robust and integrated health information systems is not just pressing, it's urgent. By enhancing our capacity to collect, analyze, and to use health data effectively, we can improve decision-making at every level, ensuring that we can respond swiftly to health emergencies, monitor public health trends, and deliver better outcomes for all. Guyana has already taken steps to strengthen our health information systems. In 2023, we have implemented new legislation. It's called the Data Protection Legislation and its regulations. We are now completing a digital health strategy, which would be from 2025 to 2030, and this lays out a strategic direction for the country. We are also implementing a new integrated patient record system in which every user of the public healthcare system would be given a unique identifier, and all their record would be fully integrated. We are in the process of procuring a company, and we have funding to roll out this system. We have also implemented several disease-specific surveillance systems, such as the DHIS2. We have the PAHO flu digital syndromic system, and we have some other platforms that we've been working with. In terms of telehealth, we have been using telehealth to provide better quality of care to our primary health care units in very rural Guyana. And right now we have 51 health posts that are connected to telehealth, where we can do video conferencing and video consultations. And we also can monitor in real time things like ECG and ultrasound and so forth. And this system, we are planning to expand this so that all our health posts and health facilities in rural communities would be connected. We've also been using telemedicine to do telepathology, teleradiology, teleoncology, and also to do mental health consultations, especially for rural communities. And we have been able to train our healthcare workers to adopt and use these systems. Later this year, we plan to launch a very innovative program to train healthcare workers so that they can be upskilled to use the digital technology. And this is a special program that we have been working on with Mount Sinai, so we'll be able to train healthcare workers. As we look forward to 2030, this plan of action provides a very clear roadmap for strengthening our healthcare systems, building resilience, and ensuring that health information becomes a tool for empowerment and inclusion. We fully support this initiative and look forward to working with PAHO as we roll out our program in Guyana and across the region.
Muchas gracias.
Thank you very much, Guyana. Now I give the floor to Guatemala. Thank you very much, Madam Chair. For Guatemala to strengthen information systems and equitable access to health information is a priority. We've taken on the responsibility of modernizing our health system through digitalization and implementation of essential public health functions. Both are essential pillars for the resistance of our systems. I wish to stress that Guatemala has joined the Alliance for Public Goods, Open and Electronic Government in order to implement technological solutions which will enable us to improve the public digital infrastructure. We will modernize the information system and the administrative processes, and also to ensure the interoperability and the exchange of data in real time in order to have a better response to health systems, in particular when faced with health emergencies. Within the framework of this alliance, we will implement tools that will promote digital identification and solutions of digital payment, also to facilitate access to health services and regulatory activities, which will also contribute to having a more inclusive and equitable care. But digital transformation is not only limited to the procurement of technologies. Moreover, it is a transformation of a health system based on a primary health care model in network that takes care of the different levels of care. Besides, we are training the human resource, and a significant change in the institutional culture in order to attain sustainability and make the best of digital transformation. Just like all countries, we face significant challenges. The current infrastructure has significant gaps, particularly in rural areas and in communities of low resources that have been historically excluded. In order to deal with this, it is essential that the health system be based on primary health care and integrated health networks, as pointed out by Pajo. In Guatemala, we are committed to following this approach by highlighting inclusiveness and promotion. With this, Guatemala reaffirms its commitment with Pajo in order to continue working on digital transformation by strengthening institutional capacities and multi-sectoral participation. Our objective is clear: to have a more robust, equitable system to be prepared for future and present challenges. Thank you. Thank you, Guatemala. And now, we will have a coffee break, and I ask each one of you to keep your lights on, and we will come back at 11. We ask you to be here on time so that we can comply with the rest of the agenda. We're lagging behind, and now I give the floor to the Secretary. Thank you very much, Madam President.
For my participants, there are several interactive stands located outside of Room A. We would encourage all of those who haven't already done so to stop by during the break to learn more about the work being done by the organization throughout the region. Thank you.
And adolescents.
In a post-pandemic context, where we have seen setbacks in sexual and reproductive health indicators, including in the maternal health, the interventions of this project are more critical than ever to recuperate lost public health gains, reduce health disparities, and promote informed health decisions among women and adolescents.
By strengthening the capacities of more than 45,600 people, including healthcare providers, public servants, and community health workers, such as traditional midwives, the project has contributed to strengthening health systems from primary care and expanding access to sexual and reproductive health services in the 6 countries. The project has also supported the creation of about 100 technical guidelines to improve the quality of care and has developed innovative telehealth initiatives to optimize maternal and neonatal health outcomes. Taking a comprehensive approach and promoting gender equality, the project has fostered the empowerment of women and adolescents so they can make informed decisions about their well-being and actively participate in matters related to their sexual and reproductive health rights.
Evidence shows that investing in the sexual and reproductive health and rights of women and girls improves the quality and accessibility of comprehensive health care for everyone.
Additionally, considering cultural diversity, the Knowledge Dialogues methodology has been implemented by exchanging perspectives on issues such as teenage pregnancy and gender-based violence, encouraging communities to increasingly attend health centers. The project is carried out in coordination with ministries of health, civil society, and community leaders in the 6 countries, creating spaces for exchange, capacity building, and knowledge transfer. The alliance between the Government of Canada and PAHO is essential to continue efforts to improve the health of women and adolescents in situations of vulnerability. This collaboration aims not only to advance towards the achievement of the Sustainable Development Goals, but also to continue to positively impact the lives of women so that in the near future, all can exercise the sexual and reproductive health rights, leaving no one behind.
Global Affairs Canada is a key and long-standing partner. We share common priorities in promoting health equity, gender equality, and women's sexual and reproductive health and rights. Thanks to our alliance, we have been able to strengthen health systems to make them more accessible, sustainable, and resilient.
So AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary health care system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child is a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument have now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So.
Personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the participants involved as much as possible. So it's not like just giving, but they are giving, receiving, yes. Collaboration. Yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal, and I think all of these accomplishments were done as teams, and I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's right to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
En nuestra región, donde las distancias y la dificultad para el acceso a los servicios de salud se han transformado en una problemática frecuente, la telesalud se presenta como una solución innovadora y accesible. La telesalud combina la tecnología con los servicios de salud para llevar la atención a quien más lo necesita, sin importar su ubicación. Desde consultas virtuales hasta seguimiento de patologías de manera remota, estas herramientas están transformando el acceso a la salud. La Organización Panamericana de la Salud, OPS, está apoyando este cambio a través de su propuesta de telesalud. La OPS ofrece una plataforma todo en uno para el registro clínico electrónico y la realización de videoconsultas, que está disponible como bien público digital. Además, la OPS proporciona recursos educativos mediante estrategias de simulación que capacitan a los profesionales, permitiéndoles brindar atención de calidad. Esto incluye un telekit, que consiste en dispositivos médicos seleccionados para el seguimiento de patologías crónicas a distancia y una caja de herramientas con recursos para implementar programas de telesalud.
Súper buena, porque no se demoran en llamarla. Entonces la hora se la dan por el mismo teléfono. Entonces no es un tema que uno tenga que venir para acá como lo hacía uno antes, que levantarse temprano. Lo encuentro súper bueno. Pues me manejo mucho en esto internet, así que le dije a mi hija que me enseñara cómo era el tema y es súper fácil.
Más cómodo para uno, no estar saliendo de la casa, lo puede hacer a cualquier hora, yo que trabajo todo el día.
La telemedicina acerca a los profesionales con sus pacientes, cuidándolos en tiempo real, mejorando el manejo de su salud y acercándoles cuidados de calidad.
Minha formação acadêmica está na área da telesaúde. Minha profissão é na área da telesaúde. Isso aí, para mim, é como se fosse realizar um sonho que está acontecendo.
En conclusión, la telesalud está dando acceso a muchos pacientes. Con la OPS apoyando estas implementaciones, se están reduciendo brechas, mejorando la calidad de vida y proporcionando a cada persona la atención que merece. Es hora de sumarse.
Eu sou a Rafaela e eu ouvi dizer que o escritório da OPAS no Brasil está fazendo um monte de coisas legais para cuidar do meio ambiente e eu vim aqui ver de perto.
Oi, eu sou Matias. Será que a OPAS é verde mesmo? Oi, sou Liz, quero trabalhar aqui no futuro.
Oi, bem-vindos à OPAS, crianças!
Nós ainda temos containers maiores que também podem ser usados para papel, para papelão, ou seja, tudo aqui pode ser reciclado.
Tá vendo essas bicicletas aqui? Ó, isso aqui a gente fez para os colegas nossos aqui da OPAS que quiser pedalar, elas ficam aqui disponíveis para todo mundo.
Aqui na OPAS a gente não usa nada descartável, só copos e garrafas reutilizáveis. E olha só que legal, nosso mexedor é de bambu.
Nós também acabamos de instalar uns painéis para captar energia solar.
A OPAS também tem um sistema de irrigação e só uso o necessário.
Oi, Rafa, para finalizar, vou mostrar para vocês os 120 ipês amarelos que nós plantamos e que hoje estão pequenininhas, mas no futuro vão ficar grandes igual aquela lá atrás.
Nós estamos cuidando do planeta também aqui. Estamos cuidando para vocês.
Nosotros como Oficina de País en Nicaragua nos encaminamos a una oficina verde tomando en consideración el consumo de papel para nuestras impresoras. Tenemos una estadística que desde el 2019 fue la última vez que se compraron resmas de papel en una cantidad de 180 resmas. En el 2024 tenemos un saldo de 136 resmas. Eso indica de que solamente se han utilizado 44 resmas en 5 años, a razón de un promedio de 8.8 resmas por año en consumo. Esto también implica, si hay una reducción del consumo de papel, hay una reducción también de tóner para nuestras impresoras. La representación en Nicaragua se unió a la modalidad de trabajo en casa, lo que permitió una reducción de consumo de papelería y tóner en esta oficina. Como organización debemos de ser parte activa de la ecologización de nuestras instalaciones, adoptando políticas ambientalmente sostenibles con prácticas modernas de ahorro de energía, reducción de residuos y reciclaje.
Desde el equipo de OPS en Colombia estamos comprometidos con la sostenibilidad. La sostenibilidad para proteger el medio ambiente y sobre todo para cuidar de la salud de cada uno y cada una de nosotros, los habitantes en este hermoso planeta.
Desde el 2023, la representación en Colombia aplica dentro de la evaluación de eventos competitivos criterios de sostenibilidad.
Solicitamos a nuestros proveedores el uso de empaques biodegradables o de más de un uso, la alimentación saludable y el manejo de residuos al final de los eventos.
Promovemos desde la planificación del evento el uso de la tecnología en vez de la impresión de material. Esto con el fin de ayudar al medio ambiente y a la optimización de los recursos de la organización.
Hemos tenido muy presente la sostenibilidad, no solamente en términos de lo que ha sido toda la construcción para nuestras nuevas oficinas, sino también en cada una de nuestras actividades, pensando en cuáles son los mejores materiales, el poder reducir el uso del papel y, por supuesto, velando por esa salud de cada una y cada uno de los miembros del equipo del OPS en Colombia.
Los interruptores inteligentes nos ayudan a un ahorro más eficiente de la energía. Asimismo, contamos con UPS. Esto nos ayuda a hacer un ahorro entre el 20 y el 30% de nuestro consumo de todos los equipos que tenemos en la oficina.
El compromiso con la sostenibilidad es una tarea de todos. Es por eso que desde OPS Colombia queremos dar ese ejemplo y poder continuar en este trabajo.
Pour nous arriver à tout le monde même chance, nous travaillons avec un pile l'hôpital. Pour nous arriver faire promotion à l'école maternelle et soutenir maman qui a été seulement pendant 6 premiers mois de la vie de monde. Comme ça, nous gagnons l'hôpital tout du Nord qui déjà passé d'évaluation interne et qu'on y a capté une évaluation externe dans début mois de septembre pour nous arriver certifié comme hôpital ami des bébés. Ça veut dire un hôpital qui est ami des bébés côté tout personnel là depuis pour un directeur pour arriver joindre sécurité dans barrière tout le monde met ensemble pour faire toute femme qui est enceinte qui vient accoucher connaît que c'était seulement pour baïti moun pendant 6 premiers mois la ville.
L'initiative Hôpitaux Amis des bébés garantissent que les maternités dispensent des informations et du soutien continu aux mères en respectant aussi les besoins et les rythmes naturels des nouveau-nés.
Ensemble, ces actions contribuent à améliorer la santé et le bien-être des nourrissons en Haïti, offrant à chaque enfant un meilleur départ dans la vie grâce à l'allaitement maternel et contribuent à la réalisation des objectifs de développement durable.
sala de vacunas Padre Monchi, aquí en Foz de Iguazú, el equipo de evaluación externa, y hemos evaluado y analizado y conversado con los colegas y trabajadores de la salud del sistema del SUS.
La evaluación consiste de varias fases, la primera de las cuales es parte del país, en el cual utiliza un instrumento de autoevaluación, y posteriormente un equipo de expertos viaja al país, visita, conoce la realidad en territorio y de esa forma les permite identificar potenciales oportunidades de mejora, recomendaciones y también fortalezas que deben ser sostenidas a lo largo del tiempo y eventualmente compartidas con otros países de la região para fortalecer as capacidades não só a nível nacional, sino a nível regional.
A avaliação externa voluntária ela vem num momento muito importante para o Brasil. É um momento que o Programa Nacional de Imunizações ele passa por mudanças e reajuste, ele está tendo uma reorganização, uma reestruturação.
Lo importante de las evaluaciones que son un mecanismo que permite al país que la solicita poder tener una idea clara de cuál es su situación actual, no solo desde su propia autoevaluación que el país la hace, sino desde la visión de un evaluador externo, lo cual no solo les permite corregir aquellas situaciones en las cuales se pueden mejorar o confirmar que el camino es el correcto, que la situación está bien llevada adelante, de manera que es un ejercicio en el cual el país tiene todo para ganar.
We saw here a lot of aha moments. People, they have not seen like that with their own eyes. And so bringing these external perspectives and these opportunities for peer learning, it's great because they can actually see things with other eyes, bring fresh perspectives, and see what are the gaps that they have not thought through, and finally address those, because that will put the programs in a much better position in the future.
O programa de imunizações ele tem um grande desafio que é o sistema de informação. Tem um sistema de informação nominal com informações importantes do indivíduo, como também garantir os estoques e garantir que a vacina que está prevista no calendário nacional de vacinação, ele chegue até a população, seja a população mais distante, como também reorganizar a estrutura interna do programa, fazer com que toda a equipe técnica consiga trabalhar de uma forma efetiva, que essa equipe consiga produzir adequadamente e propor estratégias de vacinação para o país de uma maneira efetiva.
I'm very impressed with how the Ministry of Health has adapted to low coverage after COVID-19 and the initiatives to improve routine immunization coverage as well as to restore vaccine confidence in the population.
Brazil is a very large and diverse country, and they've made tremendous progress. And one of the main recommendations is really strengthening laboratory and epidemiologic surveillance in support of the disease elimination goals. I think there's a lot of information systems that are really fantastic, but improving the linkages between those, as well as some improvements related to cold chain vaccine stock management and infrastructure as well.
Lo que un país que acepta una evaluación está mostrando es que tiene capacidad autocrítica, que acepta ayuda externa, que no se queda con la única verdad que es la de ellos y que está dispuesta a seguir creciendo consiguiendo más información. Creo que los programas de inmunización tienen que convencer a sus autoridades de la importancia de mantener el intercambio con otros países y las evaluaciones.
todavía hay mucho trabajo. Yo creo que la recuperación se está viendo, pero jamás podemos dar por sentado que eso se va a convertir en algo automático. Creo que en esta última milla para llegar a ese 95% es donde todavía tenemos que emplearnos más, concentrarnos más, y por eso es que este tipo de ejercicios de evaluación, de ver cómo está el desempeño del programa de inmunizaciones, cobran una vital importancia, porque te permite justamente, o les permite a los países saber dónde está esa parte que le está apretando el zapato y cómo justamente salir adelante. Entonces, por eso es que son tan importantes ese tipo de ejercicios.
Brasil ha identificado muchas oportunidades de mejora que ya está implementando a través de este proceso. Brasil está demostrando que sí puede, que su política de salud en el Sistema Único de Salud con el programa de inmunización es una realidad para todos los brasileños y las personas que llegan a Brasil, sus fronteras y sus 5.570 municipios comprometidos con la salud de los brasileños y las brasileñas.
Los espacios subregionales son una oportunidad única para la cooperación entre países como una modalidad para la reducción de desigualdades y mejorar las condiciones de salud de sus poblaciones. Así, de esta manera, desde hace varios años, la organización puso en práctica la iniciativa de cooperación Sur-Sur para el desarrollo en salud, mejor conocido como CCHD. Y por medio de esta iniciativa, en el año 2023 se pusieron fondos semillas para financiar el proyecto de cooperación Sur-Sur para la detección temprana del cáncer infantil en los países andinos. Esto en una estrecha colaboración con el convenio Hipólito Unanue, el Horas-CONU.
Dentro de los logros más importantes, tenemos la elaboración conjunta y aprobación por los ministros de salud andinos de la hoja de ruta para mejorar la atención del cáncer en niños, niñas y adolescentes en la subregión andina al 2030.
Este proyecto de cooperación Sur-Sur, que incluyó el intercambio de conocimientos y experiencias entre los países de toda la región andina, ha contribuido a la creación de una política subregional, de diferentes estrategias y planes nacionales que abordan de una manera muy objetiva, muy clara y muy directa lo que es la detección y el diagnóstico temprano de cáncer infantil en todos estos países de la subregión.
Lo más importante es que existe una agenda común interinstitucional que permite sumar conocimientos y experiencias en pro de la niñez y la adolescencia, generando un impacto positivo significativo en la atención del cáncer infantil.
El video que vemos ahora nos presenta de una manera muy clara, con testimonios muy sentidos, con una muestra muy definitiva del beneficio que tiene la cooperación Sur-Sur para el desarrollo en salud.
Los niños son de interés superior. Los niños, desde la Convención Marco de Naciones Unidas de Derechos Humanos de Infancia y Adolescencia, son de interés prioritario y su salud también. Y por eso salvar una vida de un niño es fundamental para los gobiernos y para todos los actores.
En estos momentos en La Guajira, pues tenemos varias dificultades en el acceso a la salud en las comunidades indígenas, ya que muchas de estas comunidades son comunidades dispersas, que no se encuentran muy cerca al área urbana. Entonces, esa es la primera dificultad, el acceso y las barreras que se presentan para estas comunidades para obtener un servicio de salud. Y todos los determinantes que puedan disminuir la incidencia de esas enfermedades que están afectando a la población, principalmente indígena, como es el cáncer infantil.
Cuando yo llegué a la clínica me hicieron exámenes, me hicieron radiografía, todo eso, y después me salió que yo tenía una masa. Y después ya descubrieron que es lo que yo tenía. Tenía leucemia y florástica aguda. Es de esa maligna.
En ese momento cuando me dieron la noticia, eso fue duro, porque no me imaginé de que ella iba a tener eso, porque ella era una peladita sana, no tenía nada.
La OPS, desde la iniciativa de mejor atención para las enfermedades no transmisibles como el cáncer, busca fortalecer las competencias, el conocimiento de los equipos de atención primaria, y es en el marco de este enfoque de equidad, de lograr justamente afectación de los determinantes sociales, que se logra este proyecto de cooperación para fortalecer las competencias, el conocimiento de estas enfermedades del cáncer infantil en niños y adolescentes, tanto en profesionales de la salud, médicos, enfermeras y otros profesionales, asimismo también en gestores comunitarios y en toda la red de apoyo social.
Buenos días de nuevo, vamos a empezar ya con la sesión. Estamos bastante atrasados y son más de las 11 y casi 10, así que por favor, si tienen algún delegado que está abajo y pueden pedirles que suban o que se siente cada delegado en su silla, por favor. Muchas gracias.
A capacitar al personal que está cerca de esas comunidades, a los mismos líderes comunitarios, para que aprendan a identificar de manera temprana el cáncer infantil y así poder hacer un tratamiento rápido. Tenemos que fortalecer las redes de atención específicas para el manejo de esos pacientes.
Todavía hay pacientes que mueren por causas que pueden ser evitables. Por eso estamos acá, porque hacer los cursos de detección temprana le damos herramientas a los médicos para que ellos puedan detectarlo tempranamente, hacer un tratamiento oportuno y evitar así la muerte temprana en nuestros pacientes.
Hace poquito me dijeron que la masita que ella tiene se está reduciendo al 75%, ha reducido mucho.
Dejo que los cuiden.
Madam President, señora Presidenta.
Madam President, we're ready to commence.
Bueno,
in the interest of time, let's resume our debate, our discussion, mindful of the fact that there are many countries who have requested the floor. We would prevail upon everyone to please stick to the 2 minutes allotted for each speaker to ensure everyone has the opportunity to speak and not end up stretching this out further. I give the floor to Paraguay. Thank you very much, Madam Chair, Madam President. Paraguay takes note of this report, which focuses on strategies for the effective data management decision-making based on evidence, the option of new digital health solutions with seeking cost efficiency and human competencies to ensure that we can digitally transform the health sector. This plan of action provides very worthwhile contributions to the Ministry of Health in Paraguay. It's in line with the plans and policies that we have in health in our country, seeking to enhance the quality and the availability or accessibility of health data. Our country has made strides in this area in digitizing its healthcare system through the project Health Information System, thanks to the technical cooperation of the government of Taiwan. This system does not only automate patient care information, enhancing the quality of these processes, benefiting healthcare personnel as well as top-level administrators. Our system has proven to be effective, reducing waits and optimizing the time for doctors' visits and making it easier for doctors to access patient records, to facilitate the care they offer, as well as the prescribing of medicines. Now, one of the goals of our national government is for this system to actually work in all the different health services throughout the country. We are in agreement with the draft resolution as presented at this directing council, and we urge all member states to promote the implementation of those actions comprised in this draft resolution, and we would ask the director for technical cooperation to facilitate this transition. Thank you. Thank you, Paraguay. We give the floor to we welcome the Assistant Director. I give the floor to the Bahamas.
Thank you, Madam President. It was just after the first wave of the COVID-19 pandemic during the fall of 2020 that in-country stakeholders in the Bahamas, led by consultants from the Pan American Health Organization headquarters, undertook the maturity model assessment of the Information Systems for Health initiative. The impetus to do so was spurred by the realities brought on by challenges in appropriately managing persons with diabetes, cancer, and hypertension in an environment where there were restrictions in physical movement and where paper-based health records were inaccessible as they were locked behind doors of health facilities. This experience exacerbated already compromised health services delivery in some areas that was a result of the displacement of individuals and damage to health services infrastructures in the wake of the devastation caused by Hurricane Dorian a year earlier in 2019. The Bahamas once again expresses profound thanks and appreciation to PAHO and its partnership with the Inter-American Development Bank in prioritizing financing opportunities to strengthen the digitization of the health sector in member states that had lagged behind. This new focus and thrust gave life to decades-old unfunded plans and strategies for the strengthening of health systems across this region. It is against this backdrop that the Bahamas wholeheartedly endorses this subsequent iteration of a strategic plan for IS4H, as we have benefited from previous strategies and understand the impact these types of activities can have on strengthening the quality of health services provided in any one member state, while introducing the opportunity to explore the portability of medical records across countries, thereby further expanding access to specialized care from country to country as appropriate. The Bahamas commends the intentional effort to realign the strategic lines of action of the plan with the 4 domains of the maturity model matrix for IS4H in a way that allows countries to meaningfully pursue activities that would demonstrate an improvement or maturing of health information systems in member states in subsequent maturity model assessments. Bahamas looks forward to the additional information and communication technology technical support that this strategic plan will provide, and encourages PAHO to consider the engagement of more ICT consultants who are able to physically spend time in countries with limited technical expertise to support the efforts required to recap or to reap real dividends from the strategy. Thank you.
Muchas gracias.
Thank you, Bahamas. We give the floor now to the Dominican Republic. Good morning. Thank you, Madam President. The Dominican Republic recognizes the crucial juncture we find ourselves in regarding timely access to information systems for health. That provides us a platform to strengthen and develop, to make the system, to make health services information more available to the population. And this is a kickoff point for us to identify strategic approaches to tackle the gaps in our current system. Our country reiterates its commitment to bolster the management and governance of information systems, undertaking important actions such as putting together an organizational structure that is exclusive, making it possible to articulate the health management information and to create a governance structure on e-health by putting together the National Digital Health Committee and the Digital Health Strategy 2428, in which we address matters of the utmost importance, such as the regulatory framework, strategy and governance for digital transformation in health, the ABCs of digital health, and to strengthen the technological infrastructure of our information systems, ensuring their interoperability, as well as building that architecture, and also with ensuring cost efficiency in our system, ensuring that we have a good return on our investment, data governance, and strategic partnerships as well. The Dominican Republic agrees with the vision and the mechanisms called for in the region on information systems for health, called for in this document, and with the plan of action to strengthen information systems for health 2430. Thank you. Thank you, Dominican Republic. I give the floor now to Canada.
Thank you, Madam President. The COVID-19 pandemic has brought to the forefront the critical value of data and digital solutions in public health, and we applaud PAHO's efforts in providing strategic direction and advancing innovation and effective use of data to improve public health and healthcare as a public good. We are very supportive of the proposed plan of action for strengthening information systems for health and its resolution, and note that we are well aligned with the proposed indicators. We particularly appreciate that the document recognizes that interoperability is key for sharing standardized information and facilitating the electronic exchange of data and information to support healthcare delivery and patient care. Through Canada's Global Initiative for Vaccine Equity, CanGive, Canada supports efforts to reinforce information systems and data management in low and lower middle income countries. This includes investments to facilitate the collection of immunization data, as well as data integration into primary healthcare information systems. CanGive partners, PAHO, UNICEF, and the WHO are working to increase the quality, reliability, security, and timeliness of data collection to improve community engagement, reinforce health services, and better prepare for future health emergencies. The Plan of Action also considers critical aspects of health data and digital transformation, such as strengthened governance, data management, and fostering innovation, including AI. Canada is pleased to see that the Plan of Action includes stewardship and governance-related indicators, which is emerging as a modernized approach to data management and data governance. This approach is a departure from the custodian models of data sharing, which are focused on risk, towards models of stewardship with an increased focus on benefits of sharing. For example, in Canada, federal, provincial, and territorial governments are collaborating with national health data organizations, including Canadian Institute for Health Information, on establishing a framework for health data stewardship. We very much look forward to seeing how this important initiative progresses. Thank you.
Thank you, Canada. I give the floor now to Mexico. Thank you, Madam President. Mexico recognizes the work carried out by PAHO to carry this plan out, which is key to ensure resiliency of our systems. Given the changes in technology and the expansion of artificial intelligence, it has become very important for healthcare systems to have a strategic plan. We have to enhance the interoperability of systems and platforms such that this information can be person-focused and enabling the measuring of health information throughout the whole cycle of life, that it be safe, standardized, including the voice of users in a standardized way, including results reported by patients, that the information be open and that it close gaps, not make them wider, empowering people and communities, ensuring that they, or rather that systems add value. The interoperability should also allow for the inclusion of social determinants, social, demographic, and climatic information, as well as the built environment, to offer assistance to the efforts undertaken to address inequalities in health and climate and health challenges that arise in the region or emergencies in those areas. Mexico has as a goal the creation of a new intelligence and health standard governing the use of new technologies and data management, enabling us to predictively analyze information that would assist in decision-making in health, enhancing the efficiency of services, and to personalize patient care. And an example of what we've done in our country is to come up with a registry of people with hepatitis C, according to sectors, working with the community leaders and the academic sector for a number of years. This enables us to have a person-focused registry and in real time analyze information from providers down to decision makers, facilitating identifying those people who need strategies for health testing, such that we can actually, through networks, offer primary health care. Now, regarding the international classification of diseases for electronic health registries, Mexico has implemented its registration of birth certificates that currently is being rolled out. That is creating the statistic death certificate registry, as well as disability registry, which makes it possible for us to contribute to the analysis of information and to generate action plans geared toward strengthening health programs throughout the region. Thank you.
Muchas gracias, México. Ahora sí.
Thank you, Mexico. I give the floor to Cuba.
Gracias, señora.
Thank you, Madam President. Cuba has continued to work on the 4 strategic lines designed in the action plan to strengthen vital statistics, making strides in terms of strengthening information systems, records, and vital records. As we know, the COVID-19 pandemic was a challenge for statistics, and they played a key role in the Cuban model for health management, epidemiological surveillance, organization of health services, and science and innovation were key to provide a timely response to the information needs for decision-making in a time of crisis. Strategic Line 1, having to do with strengthening vital statistics systems in the country, shows ongoing development and fine-tuning. Annually, an update is done of the subsystem for statistic information that is complementary in health, and it includes vital statistics with involvement of both providers and users. And with this information, we have a registry of information representing 100% of the health facilities. And this is a strength for vital statistics and digital transformation within the Cuban health system. We continue to develop the strategy of governance and data management, including things having to do with vital statistics in Cuba. In the period under analysis, laws were enacted and resolutions were put into place, and they have a direct impact on statistics, including, amongst other things, a law on protecting personal data, also a law from 2022, and regulations for protection of personal data. That is Resolution 58 of 2022 from the Ministry of Communications at Cuba. Strengthening management capability, analysis of vital statistics as the third strategic line shows progress in training and education of professionals and health technicians. That is essential so as to learn about analysis of statistic information. Part of this strategy calls on ongoing training for morbidity and mortality indicators. Now, strengthening the primary health system in Colombia includes family medicine, and we're a benchmark for the region. We use a public health instrument at this level of care. The use of vital statistics contributes to identifying challenges in the communities within the framework of social health determinants, making it possible to come up with a plan of measures to change the problems identified. Also, strengthening, exchanging best practices having to do with vital statistics is the fourth line of strategic action, and also it shows progress in the country. Cuba belongs to the network to strengthen health systems with active participation in fora and virtual meetings. The medical registry in the Public Health Ministry is working on an ongoing basis with international organizations. Cuba needs to move ahead implementing the standards of the 11th review of the ICD and implementing electronic health records. And we have to work on infrastructure, mobilization of resources through technical cooperation for the health system and resources that are domestic in nature. Thank you. I thank you, Cuba. And with that, I call on Antigua and Barbuda.
Madam President of the Directing Council, Director and Executive Management of PAHO, distinguished delegates, good day to all. Antigua and Barbuda notes the resolution on strengthening the information systems for health and gives support to same, particularly on matters C and E related to building the necessary infrastructure for health and data management frameworks and ensuring that human resources have the necessary competencies to effectively implement digital health solutions. The COVID-19 pandemic underscored the critical need for all countries to strengthen their health data and information systems. The health sector has expressed a growing interest in promising developments of the area of health information systems. It is recognized that health data standardization, efficient information systems, and training of people to manage and use the data are key in the support of the pandemic prevention, preparedness, and response. The Ministry of Health of Antigua and Barbuda plans to institute a comprehensive policy framework to promote innovation of and access to a national electronic health record system, which will link primary health care and secondary and tertiary care centers. In Antigua and Barbuda, there is a need for resources to be directed at adequate training of all healthcare workers and the availability of a supporting infrastructure for hard as well as electronic health data at all points of care. It is priority to build capacity for an interoperable health information system. My country has begun digitalization of files, which will support access to and retrieval of patient records and improvement of treatment times. Full implementation of the electronic health record system will present challenges. However, with effective monitoring and evaluation at each stage, these challenges are not insurmountable. Antigua and Barbuda requests the continued technical support of PAHO, as was observed during the 4th United Nations Small Island Developing States Conference held in Antigua in May 2024. PAHO collaborated with the Ministry of Health in the setup of the Emergency Medical Teams Type 1, which had a digitalized electronic health record system and all levels of staff trained for its utilization. Antigua and Barbuda is greatly appreciative to PAHO for the progress made under your guidance in advancing information systems for health. Thank you.
Thank you, Antigua and Barbuda. I now recognize Honduras. Thank you, Madam President. Honduras agrees with the proposed resolution, Plan of Action for Strengthening Information Systems for Health 2024-2030. In this context, we have begun implementation using the roadmap for the transformation of systems 2024-2030. As a member country, we request differentiated care, identifying specific activities so we can continue to receive cooperation and technical assistance. It is essential to improve interoperability of systems by adopting interoperational methods and establishing standards for the different information systems so that data and clinical documents can be exchanged. We are supporting a comprehensive digital reform in the Ministry of Health. We are improving data infrastructure across the country through an ambitious connectivity program. We are guaranteeing interconnection of health facilities with the central level, facilitating implementation of technological tools like the logistic administration of medicines and logistic elements, and also having an electronic health record. This is not only going to optimize our internal processes, it will also improve the quality and accessibility of the healthcare services for the population, positioning Honduras as a benchmark in digital health. Thank you. Thank you, Honduras. Thank you. We appreciate the information presented, and we also appreciate the Plan of Action for Strengthening Information Systems for Health 2024-2030. That is CD 61/7. In the region of the Americas, important strides have been made to improve information systems for health and also to digitize health data. With the current action plan, we will work towards complying with 6 important mandates of the Pan American Health Organization. Strengthening information for systems is very important for Peru. Under the leadership of the Ministry of Health, we are involved in several initiatives, all within the framework of the existing framework and with a view to 2030, so that we can have a collaborative, ethic, cross-cutting, interoperable system with a comprehensive registry. The document can contribute to achieving national objectives and objectives in the region of the Americas. The strategic lines are in keeping with the guidelines of the policy leading to digital transformation and the policy of the Ministry of Health, which includes strengthening the ecosystem of digital health and its governance, deploying at the national level the electronic clinical history and telehealth, optimizing availability and reliability of information for its use in the analysis and in decision-making at different levels, and promoting development and technological incorporation in the health field. We take note of what is pointed out in the document, and we support the proposed resolution that is before us for our consideration. Thank you. Thank you, Peru. With that, I recognize Jamaica.
Thank you, Madam President. Jamaica welcomes the Plan of Action, which provides a guide for our digital transformation journey in the health sector. Areas of progress for Jamaica include advancing the development of policies for interoperability and identity management and the definition of a unique health identifier to enable a secure shared health record. In addition, we are adopting a collection of open digital health standards in alignment with the architecture for a health information exchange. Jamaica is proud to have become the 45th member of SNOMED International in 2023 and was the first among the Caribbean member states. During July 2024, the Jamaica edition of SNOMED CT was established. At the same time, the first use case for ICD-11 implementation is likely to be applied to cause of death coding for vital statistics. Madam President, while digital health technologies offer significant benefits, they also present challenges, including patient safety issues, such as the misidentification of patients and medication errors. The critical nature of this challenge has not gone unnoticed, and therefore Jamaica requests the support of PAHO for the development of a framework and tools for digital patient safety with due consideration for the regulatory aspects, clinical governance, and the potential for the use of artificial intelligence to address these risks and make technology in health more patient-centric and therefore safer. Madam President, the Plan of Action sets the stage for participation in the Pan-American Highway for Digital Health, which will enable cross-border data exchange, and requires advocacy at the highest levels. We thank PAHO for continued technical cooperation support to strengthen IS4H and give our full support to the Plan of Action for 2024-2030. We wish to also register our endorsement of the proposed resolution for adoption at the 61st Directing Council. Thank you.
Thank you, Jamaica. I now recognize Uruguay. Thank you very much, Madam President. Uruguay appreciates and supports this information, the action plan to strengthen health 2024-2030. This is a key tool to take action in the area of public health. The objective of this action plan points to strengthening this component. Strengthening information systems is a challenge across the region, where we share the need to make technology a support mechanism and a good ally. We need interoperable platforms taking existing information, allowing us to diagram actions based on the information we have so as to be able to apply predictive models. The development of new tools has to go hand in hand with a new regulatory framework so as to ensure adequate management of data, governance of information, its confidentiality. This process has to go hand in hand with developing training plans for those involved in the health sector regarding its management. We want to say that Uruguay is working on developing and implementing an interoperable surveillance platform that will receive information from several databases, thus improving information for surveillance and subsequent decision-making. Once we finalize that model, we will be sharing it with the other countries of the region. We hope that the strategic lines of action suggested by the document become a new roadmap so that member states can implement concrete actions that will strengthen public health so that the results can be observed in the short and medium term. Thank you. I thank you, Uruguay. I now give the floor to El Salvador. Thank you, Madam President. El Salvador, since 2020, began a digital revolution where we started from zero and developed a specialized system to create a clinical history for the whole country. And there we ran into two problems. The first, the lack of connectivity amongst all of the healthcare facilities. There are 160 facilities that are providing the first level of care. And second, we did not have trained staff to develop this type of skill or to develop this type of technology. At the same time, this was a challenge that was taken on under President Bukele by the minister. And there we found that this was to improve the quality of care, the quality of life for all Salvadorans. And that is how this integrated system was created. It's called CIS. It is our software, 100% Salvadoran, created by the minds and the hands in El Salvador. And at the same time, we set up an academy within the same facility to train physicians to use this technology, supporting its development. And all of the staff, all levels were trained. So this system promptly serves all of those involved in the Ministry of Health in El Salvador. This has facilitated care, and in addition to that, it has made it easier to transfer information amongst different health centers, providing connectivity thanks to optic fiber across the country. So this is one more step towards digital transformation, and we're working with strategic partners like the Pan American Health Organization. Recently, we did SysMed, which is part of our emergency care in hospitals, and this has been a plus for the country. And it's something that we have worked on jointly. This was an enriching experience for both partners. At the same time, we opened the doors of our country so that our sister nations, our neighbors, all of us here at this meeting can learn from our experience. We would gladly share our experience, the lessons that we have learned step by step, and we are also on the verge of beginning to develop applications and using AI for different elements having to do with digital transformation. Thank you. Thank you, El Salvador. I now give the floor to Aruba. As we know, COVID left indelible marks on the health of our peoples, but also it taught us lessons. One lesson was acceleration of developing digital solutions to promote progress in the information systems for health and digitizing data. We consider it very necessary to move quickly to do a digital transformation of the health sector, especially in terms of real-time data, open digital platforms, and adaptive platforms. At the same time, we agree with other countries from the sub-region of South America to improve recovery analysis, the use of quality data, to develop policies, and to improve the health performance in our country. So we have to not only review existing policies, regulations for digital transformation, but we have to share experiences regarding different initiatives, strategies in terms of the use of technologies and AI in the health. The ultimate objective is for us to define strategies, standards, to have interoperable, interconnected systems, and have best practices in the use of data so that we can make optimal decisions in terms of optimal health coverage, universal coverage. So we have the initiatives of open data, big data. And in that connection, Argentina is working with other countries in the implementation of the summary of the patient to assure regional interoperability and minimal data in the clinical history. It is important that all of this be done to assure the digital transformation, and also we have to use new technologies and artificial intelligence in the area of health. Lastly, we highlight the importance of having AI models that are predictive and promoting an exchange of knowledge, technology, know-how, so as to establish a sizing of the problems within the countries. We put at the disposal of the region our experience to date. We are fully aligned and we support the proposed resolution. Thank you. Thank you, Argentina. The interpreter corrects herself. It was not Aruba, it is Argentina that just spoke. The United States is recognized.
Comes the new plan of action for strengthening information systems for health and congratulates PAHO and member states for the achievements under the previous plan, which have placed the region as a leader in global digital health space. Digital technologies can be a critical accelerator of progress towards global health priorities and broader socioeconomic development when invested and managed strategically. We recognize that investment in digital systems can best deliver value when designed to meet health systems needs, take a person-centered approach, leverage standards to enable interoperability, and support country and regional digital health enabling environments. We reiterate the need to implement inclusive, secure, rights-respecting, and interoperable systems to improve access to and responsiveness to the health system. We also reiterate the need to facilitate country actions to address persistent equity gaps and new challenges like the impacts of climate change on the most vulnerable. We recognize PAHO's leadership in this complex space, which has changed and evolved since the COVID-19 pandemic, and its responsiveness to the needs of countries. We understand the cost to implement the action plan for this biennium 24 to 25 are going to be covered, but Dr. Garcia, we want to know if the financial implications for the next biennium from 2025 to 2026 are known. We'd like to know that. We also acknowledge PAHO's strategic and fruitful partnership with the Inter-American Development Bank, which is supporting countries to align and advance national digital strategies. In a region that is facing unprecedented population movement, we applaud their collaborative and innovative initiatives like the Pan American Highway for Digital Health, which will enhance digital collaboration across borders. Muchas gracias.
Muchas gracias.
Thank you, United States of America. I now give the floor to Haiti. We congratulate the Pan American Health Organization for this plan to strengthen information systems for health 2024-2030. This is important to strengthen the health systems in Haiti by facilitating its use at all levels of disaggregated health information so as to make decisions within the Haitian health system. The interoperability, the integration of data, the key element in this document, the development of a health infrastructure, reinforcing the capacity to improve data quality, all of these are very important elements, and thus we maintain our strategy. We congratulate the Bureau on the contribution it has made and the contributions received. Haiti has progressed in terms of applying these principles and will soon organize an open session on the use of technology in the health system so as to share with the authors what is happening in Haiti despite the difficulties we face. This system is being used at the second level, and we will continue to work with on the process of incorporating different databases. Haiti has always been in favor of assessing its health system, and in this way, the country will be part of the Sustained Development Plan with a robust numeric infrastructure as called for by the plan, thus modernizing health systems and also reducing the inequality in access to health services in both rural and urban areas. So we take note of the proposed resolution and support it. Thank you. I thank you, Haiti, and I now give the floor to Panama. Good morning, Madam President, distinguished colleagues, delegates. The Republic of Panama wants to thank the Pan American Health Organization for all of its efforts aiming at the implementation of the action plan for strengthening information systems for health 2024-2030 and for developing the 2024-2030 action plan, and Panama agrees fully with that plan. In our country and in other countries of the region, we have many systems and platforms that have been developed as time has gone by. But they do have limitations in terms of interoperability and the ability to detect health challenges so as to respond to them. We are convinced that this action plan 2024-2030 will be essential to improve decision-making and increase efficiency and quality of health services. Panama has made important strides in terms of digital transformation, establishing the interagency agency led by the Ministry of Health, and also we have a diagnosis of readiness of our health information systems. So we hope that by implementing this plan, we will increase effectiveness and the responsiveness of our health services by giving priority to the first level of care. This action plan is in keeping with the recommendations made by member states of the Pan American Health Organization in the regional event on digital transformation in the health sector. That was held in Panama in November of 2022, and also reflects the conclusions of the Latin American Caribbean Regional Network for the Strengthening of Information Systems that was held in Sao Paulo, Brazil in November of 2023. Panama has joined in support of the actions of PAHO to do a digital transformation of the information systems in the region, including implementation of the Pan American Path for Digital Health. We want to thank the Pan American Health Organization for establishing this pathway, leading us to more advanced health systems that will be interconnected. All of this with a view to supporting policies, decisions that are evidence-based, and so as to be able to use digital technology, AI, telehealth, and the platforms for electronic health records. That is why we are in full agreement with the proposed resolution that has been presented. Thank you. Thank you, Panama. I now give the floor to Brazil.
Madam President, Brazil supports the plan of action. It's very broad proposal to expand the health sector, and it presents crucial challenges such as financial and technological aspects, the regulation of artificial intelligence, and digital literacy, as well as governance and digital health, information management systems, innovation, which are pillars for equity and access to health. We recognize the adoption of some of the suggestions made by Brazil, such as the principle of equity in the indicators, as well as connectivity as social determinants, as essential elements for national public health policies that would ensure equitable access to digital health. We also think that it is key, that is a line of action for the adoption of measures to ensure the ethical use of emerging technologies, innovative technologies, to ensure equitable access and non-discriminatory use of these technologies. Furthermore, should we garner consensus on this, we would like to put on the record the following recommendations for indicators as a contribution to the efforts to implement this, as that will follow. Interoperable electronic health registries at different levels of health services throughout our region, digital health platforms for users, artificial intelligence solutions to be implemented, and also to ascertain the quality, integrity of the data that are provided, and trained health care professionals knowledgeable about digital health, and also solutions based on data for public health decision making. I would underscore that no less important would be than indicators and goals would be the cooperation that brings us together to exchange and disseminate good practices and pass forward across the region. This is why I reiterate what I said from the outset of my presentation, which is that we do support this plan of action.
Muchas gracias, Brasil.
Thank you, Brazil. I give the floor to Ecuador.
Gracias, señor presidente. Atendiendo.
Now, the plan of action to strengthen information systems for health 2024-2030, I would like to say that the strategic lines proposed by PAHO in this document is something our country supports, because it ensures digital health by strengthening governance and data management, as well as stepping up the gathering of germane information. Ecuador has made strides in strengthening governance and management of data in our information systems for health and the use of interoperable standards. The country has pushed forward the adoption of data protection laws that doesn't just involve health, but other sectors of the economy. In the case of the health sector, given that the patient is the owner of information, this becomes an ethical challenge for the system. These guidelines, which need to be thoroughly defined through policies of governance. Ecuador is currently developing a single record system for the clinical history of patients throughout our network. And currently, 24% of primary healthcare centers are a part of this, but we seek to include hospitals. In short, this will enable us to ensure that this information is held at these sites, and this will help in decision-making in the health sector. In fact, we find ourselves at a time in which data has become a crucial input for decision-making. Now, along with the technological developments in Ecuador, we have the challenge of ensuring that we have skilled personnel in digital health and the use of digital information and all the different attendant programs. For these reasons, we support this draft resolution, and the necessary financial budgetary endowments have to take into account the situation of each country. Thank you, Ecuador. I give the floor to the UK.
Thank you. The UK territories would like to thank PAHO for the plan of action under this agenda item. Strong information systems for health are key to promoting an increasingly more integrated global health architecture that ultimately benefits each country. Significant progress has been made, including within the UK territories, with Montserrat and Anguilla recently introducing electronic patient record systems. The BVI has also implemented health information systems in its public health facilities and is in the process of implementing the District Health Information System 2 with support from PAHO, for which we'd like to express our thanks. We support the 4 strategic lines of action proposed within the plan. However, as we know, the development of stronger information systems for digital health and their implementation requires considerable financial resources, especially when new systems need to be fully established. This proves to be particularly challenging in small island developing states, where the available resources and funding need to be deployed to respond to more short-term, immediate needs such as health emergencies or the daily functioning of primary healthcare facilities. We therefore welcome efforts to support pooled procurement of health information systems in delivery of this plan. We would also welcome further acknowledgement of the context and challenges faced in implementing, including specific accommodations for SIDS when considering reporting duties and performance indicators. Thank you.
I thank the United Kingdom. I give the floor to Colombia. Thank you, Madam President. Colombia fully supports the resolution to adopt the Plan of Action 2430, enabling us to strengthen digital health and will enable us to create better conditions to achieve the guarantee of the fundamental right to health in countries and the region. Colombia has made progress in connectivity, closing the digital gap, and based on that, we have developed public policy to guide and to ensure the maturity of our information system. We should underscore the support given by PAHO, as well as in providing, at the same time that IDB and the World Bank has offered technical assistance and financial assistance and other agencies, enabling us to come up with a sustainable and comprehensive information system. We are building a unified public information system, ensuring universal coverage and access and interoperability across all health sectors with clinical medical records and clinical records that are interoperable across the board. Other strides have been made in a number of subject matters, including information associated to epidemiological surveillance, vital statistics, and individual records as far as services provided, and also a nominal list of pregnant women to reduce maternal deaths. Our information system for primary health care, through which 10,000 interdisciplinary medical teams are working together for preventive health purposes and ensuring this effective transition in a number of fields where we still have challenge, but we still have a lot to do. It's a huge challenge to address the fragmentation and inefficiencies of our system and the dearth of results, and the ongoing, and thanks to the ongoing support of PAHO and the countries of the region, we are moving forward. Thank you.
Gracias, Colombia. Ahora.
Thank you, Colombia. Belize is recognized.
Thank you, Madam President. Belize recognizes the critical importance of robust health information systems in enhancing our ability to respond to health challenges, improve patient care, and optimize resource use. As highlighted, many countries in our region face significant challenges with interoperability and data management, and Belize is no exception. We acknowledge the strategic lines of action outlined in the Plan of Action, which focus on governance, data management, knowledge facilitation, and fostering innovation. These areas are vital in building efficient, accurate, and secure health information systems. Belize is committed to advancing these strategies to achieve more integrated and interconnected health systems. In our country, the Belize Health Information System plays a crucial role by linking our Ministry of Health with public hospitals, laboratories, and clinics. This system ensures that patient information is readily accessible across medical visits, facilitating continuity of care. However, we also recognize the need to address fragmentation, particularly with the coexistence of the National Health Insurance Registration of Clinical Activities web-based application. To this end, we have developed the Clinical Data Exchange Platform, CDEP, which ensures interoperability between these systems and aligns with the international standards such as ICD-11. This advancement also integrates health data with our civil registration system and the Social Security Board, further enhancing data sharing and decision-making capabilities. Belize is committed to reducing health data fragmentation and ensuring informed policy planning and health status monitoring. We fully support the approval of the Plan of Action and the accompanying resolution. We are dedicated to the efficient and sustainable use of the CDEP, and we will strive to include comprehensive data on health promotion, prevention, clinical and curative activities. This comprehensive data collection will empower policymakers to improve access to health care, particularly for those living in vulnerable conditions. In conclusion, Madam President, Belize is committed to aligning with the regional efforts to strengthen our health information systems. We look forward to collaborating with other member states and stakeholders to achieve our shared goals of enhanced health system capacity and improve health outcomes for all. Thank you.
Thank you, Belize. We have two non-state agents that have requested the floor. I give the floor now to the World Association of Cardiology.
Commends the World Health Organization and its member states for their plan of action for strengthening information systems for health 2024-2030. The COVID-19 pandemic highlighted the key role of health data in understanding disease spread, identifying vulnerable populations, assessing needs, and evaluating clinical as well as public health interventions. Robust data and information serve as a foundation for evidence-based decision-making, effective health strategy, and resilient as well as responsive health system. Nonetheless, insufficient coordination and alignment have led to fragmented data and efforts in the Americas region and globally. In response, World Heart Federation has developed its World Heart Observatory, a knowledge hub that curates and visualizes data on cardiovascular conditions, risk factors, and health systems, transforming health data into actionable knowledge for policymakers, researchers, clinicians, implementers, health advocates, and people with lived experience. Digital health interventions such as telehealth, mobile apps, wearable device, and electronic decision support tools, among others, also hold immense potential to improve access and outcomes, as well as reduce costs. The World Heart Federation Roadmap for Digital Health in Cardiology outlines the strategies and can be adapted at the regional and national levels to overcome barriers and leverage digital tools to improve cardiovascular prevention, management, and care. World Heart Federation urges member states to adopt and implement the processed resolution supported by strong leadership, governance, and policies to ensure data harmonization and interoperability regionally and globally. Thank you.
Muchas gracias.
I thank the World Cardiology Association. Now I give the floor to the International Federation of Medical Students, Association of Medical Students. Thank you, Madam President and distinguished delegates. The International Federation of Associations of Medical School Students plays an important role in promoting equity in health and the participation of medical students in such initiatives worldwide, stressing the importance of collaboration among students of our 133 national member organizations to address the most pressing health problems in the Americas. One of the biggest challenges we face are inefficient health information systems, keeping us from addressing inequalities, disparities in health provision through education, creating healthy habits, and responding to emerging health problems as well as information. Now, we firmly support the plan of action to strengthen information systems for health. Unfortunately, more than 42% of countries of the region have yet to have taken the first steps toward adopting health information systems, and that's why we prevail upon governments and those charged with national public health systems to develop health messages that are comprehensive by first understanding what the needs are and what the obstacles faced by certain social groups are, to step up efforts to meet the goals of this plan of action, to implement health information systems in keeping with society's needs, adapted to people with disabilities, linguistic minorities, and people who are geographically isolated, among others, for them to fully enjoy their right to health with full knowledge, giving their consent, exhaustive mechanisms for monitoring, and to hold accountable any misinformation spread, and also to promote health and to increase funds to reach these goals and to standardize health messages and to bolster educational competencies of health providers, that they be readily understandable, explaining what health problems are, and that different populations can understand those messages. Now, resilient healthcare systems that are capable of effectively addressing the different health needs of populations is essential. For this, we have to standardize and ensure our systems are interoperable. Thank you. I thank the International Federation of the Associations of Medical Students. I give the floor to Dr. Garcia Saiso to respond to those comments. Thank you very much, Madam President. And I thank everyone for all of your remarks and for your support for this initiative. Of course, the information we've received from Guyana, Guatemala, Paraguay, the Bahamas, the Dominican Republic, Canada, Mexico, Cuba, Antigua and Barbuda, Honduras, Peru, Jamaica, Uruguay, El Salvador, Argentina, the US, Panama, Brazil, Ecuador, the UK, Colombia, Belize, our two non-state actors who also provide information. We thank you all. Now, the progress that has been made in each and every one of the countries reflects the reality that this plan of action takes into account, and this means that now we can make available to you a document that not only holds up this region as leader worldwide in this subject matter, but enables us to bring together and to align, rather, our technical capabilities around the specific needs of each one of the local countries. Now, how do we come up with an initiative that whose name underscores information systems for health? Because usually when we talk about information systems, we don't often talk about such a broad scope as is health that goes far beyond what we often think of being health-related centers. This, the IS4H initiative over the last couple of years, for example, is part of what is countenance in this new plan of action. The interoperability is another important factor where we see much heterogeneity among systems, and we see there are subsystems of information in all healthcare systems that don't necessarily interact with what we strive for here. They operate in isolation. They don't, therefore, feed into the necessary information we need to make decisions about epidemiological surveillance or immunization. And those who make decisions don't always have the necessary information to immediately act and to provide the best services to health services to people who need them, even though they do report to higher level systems of the overall system. So integration calls for much more resources to be made available to facilitate decision-making at the highest levels. We heard people speak of equity as a key element to the development, and that's why we seek to speed up this process to ensure digital transformation in health and decision-making, where we have to be very careful for the digital gap that does exist, that is real, to ensure that that does not actually become aggravated, worsened. And we need to use these tools and services precisely to close those equity gaps that still exist. Regarding the question about financing for this proposal, we must recognize that this is not something that we are doing in a void, a bubble here. It's not being done in an isolated way. This is something that's done hand in hand with many partners, in which we have the Inter-American Development Bank, for example, with whom we share in this undertaking, building this Pan-American route toward digital health, and the World Bank, as well as other very important institutions such as USAID, who have helped us in this initiative from the outset, and all of whom continue to be very important players. The plan of action falls under our biannual 24-25 working plan to strengthen the overall system of the subnational, national systems and mobilizing, galvanizing resources in the future to ensure that we not only have them available now, but that this becomes an ongoing effort in our countries and a part of the technical assistance we offer. Standing up technology is a good part of this. Governance and technology won't get us very far if we don't build skills. That's why all areas of health and training and health have to be brought on board, and all healthcare personnel already working in our institutions have to be brought in to this. This is an ongoing challenge that we face. We've spoken of digital literacy of our populations, which is another very important topic, to ensure that benefits not be something enjoyed only by some, but by all. There were concrete comments made by way of what needs to be done to implement this plan of action, what guidance needs to be made available so that we can ultimately have robust systems by 2030 rather, and that we have effective metrics to ensure that we adhere to this path that we have, this course we've drawn for ourselves. I'm very grateful for the opportunity to have made these comments, and we stand by at the Secretariat available to offer any technical assistance we can, and all the experience that we gain here and henceforth will help us to strengthen our efforts as we go down this path. Thank you, Dr. Garcia Saiso. Mr. Director, do you have anything you would like to say? Thank you, Madam President. I would like to express thanks to the member states for taking part in this debate, which made it possible for us to craft this plan of action. The region of the Americas has made much progress when we compare our region to other regions in the world in strengthening information systems, ensuring the quality of data, the availability of data. You can look at the dashboard. We have more than 100 indicators of countries with disaggregated information broken down by regions and subregions. But as some of you have said, without a doubt, the pandemic showed us how important it is to continue forging ahead. There are some countries that had to stand up on an emergency basis information system, because the populace wanted to know on a daily basis what the status of COVID was, and if COVID was spreading, if the transmission was up, down, and this showed us, without a doubt, that much more needs to be done to further bolster and develop such systems than what we had before COVID. Now, on digital transformation in the health sector, during the pandemic, the use of digital health platforms was the only way we found to ensure that people with chronic diseases and mental health diseases would have some access to healthcare services at the height of transmission, in which the brick-and-mortar clinics were closed, emergency rooms and so forth, and intensive care units were less readily accessible. So this comes at a very important time, because it is building on progress made, and after having taken stock of our current needs. You spoke of them: interoperability, data availability, digital literacy, and telehealth. And I do think that this is going to have a positive impact on many topics throughout the region. Immunization is a case in point. As you know, many of the immunization programs that we have in the region, despite all the progress made, are still 3 decades behind the curve because the registries that we have for vaccination is not by person, it's rather the number of doses that have been administered, and it's still on paper, hard copy, and that does not help health ministries, health authorities at the local level, when you have decentralized systems, to know who actually has been vaccinated and who has not been vaccinated, so that then we can seek out those people who haven't been vaccinated and to make use of all the other tools. Geographic information systems could be brought to bear such that we can find the unvaccinated, define the barriers and overcome them. If we don't carry out this change as quickly as possible, I think we are going to have a hard time reaching the 95% of vaccination with the third dose of diphtheria, tetanus, which is our goal, and the electronic registries that would help us bridge the gap between primary, secondary, tertiary care, and all the benefits that could come with this effort once brought to fruition. Now, while other actors have this concern top of mind, Mr. Garcia Saiso has mentioned the countries in the region who have already managed to mobilize $1.2 billion of loans, both from the IDB and the World Bank and CAF, that is backing a project in El Salvador. This is a time of convergence, coalescence of these priorities that can redound to benefit to the countries as they overhaul their strategies and bring about this change as quickly as possible. And traditional partners, for example, that we've had, USAID being a case in point, CDC, and now a German partner. I met with the Ministry of Foreign Relations last year in Berlin last year to talk about the need for further support for Latin America and the Caribbean. And so we are working on raising these funds, mobilizing these funds. This, along with all the other efforts that we are carrying out to ensure that we are on sound financial footing, that there be, during this biennium, sufficient human resources. Now, at the my opening presentation, I talked about sub-regional efforts underway for digital transformation. So we're going to have a sub-regional advisor in Central America, another in the Caribbean, another in South America, to work with our countries so that we can strengthen our information systems and to ensure more effective digital transformation. So I think the groundwork has been laid. And so the approval of this plan of action by member states is going to enable us over the next 6 years to make greater strides based on the positive experiences that you have already shared here about what you've done, what you are planning to do. So this is a critical moment in which now, moving forward, we can coordinate our efforts better than ever. This is a strategic initiative to strengthen health systems in the region. Thank you very much, Madam President.
Muchas gracias, Dr. Barbosa, por sus comentarios.
Thank you, Dr. Barbosa, for your comments. And now I would ask the rapporteur to please read the proposed resolution. Thank you very much, Madam President. Proposed resolution, Plan of Action for Strengthening Information Systems for Health 2024-2030. The 61st Directing Council, PP1, having reviewed the Plan of Action for Strengthening Information Systems for Health 2024-2030, document CD 61/7. 2, recognizing the urgent need to continue strengthening information systems for health and to advance the digital transformation of the health sector as key elements of support for universal, equitable, and resilient health systems. PP3, considering that action by member states is required to strengthen leadership, stewardship, and governance through a renewed emphasis on digital transformation. PP4, noting that institutional capacities to enable the implementation of interoperable information systems for health must be strengthened, given that these systems are a central component of the primary healthcare approach. Resolves. Operational paragraph 1, to approve the plan of action for strengthening information systems for health 2024-2030, document CD 61/7. OP2, to urge all member states, considering their context, needs, vulnerabilities, and priorities, to A, promote the implementation of the lines of action contained in the plan of action for strengthening information systems for health 2024-2030. B, strengthen the management and governance of information systems for health within the framework of the digital transformation of government initiatives. C, build the necessary infrastructure for supporting the implementation of national and subnational information systems for health and data management frameworks. D, establish regulatory frameworks for enhancing the management of health-related data platforms and digital health solutions. E, ensure that human resources have the necessary competencies to effectively implement digital health solutions at all levels of care. Operational paragraph 3, to request the director to A, provide technical cooperation to member states to strengthen capacities that contribute to the implementation of the plan of action and the achievement of its objectives. B, report periodically to the governing bodies of the Pan American Health Organization on the progress made and challenges faced in the implementation of the plan of action through a midterm review in 2027 and a final report in 2031. Thank you very much, Madam President. Thank you. Thank you very much, Rapporteur. I now offer the floor to the plenary to begin the discussion on this proposed resolution. If there are no objections, this resolution is adopted.
Bueno,
Very well. We are now going to break for lunch, and we come back at 2:30 sharp. And then we will do 8-2, 8-3, 8-1, 4-5, 4-8, and 4-9. And also, I want to request your staying here until 19 hours.
About the briefing session on cervical cancer elimination, advancing the call to action in the Americas in room B. A light lunch will be provided for delegates joining the briefing session. Thank you.
Muchas gracias, señor director.
Thank you very much. And if there is time, we will go to 4.6, 4.7, 5.4, and 5.5. So if we want to finish on time, I would ask you to be shorter in your statements. Thank you.
Y el cáncer. Y obsérvalos. No deje de observarlo. Y aunque sea un niño, yo soy un vencedor. Yo vivo feliz porque tengo a Dios. Y aunque sea un niño, yo soy.
Ella le preguntan que qué quiere ser y ella dice, no, yo quiero ser doctora.
Desde el 2021, la Organización Panamericana de la Salud pone en marcha el proyecto Mejorando la Salud de las Mujeres y las Adolescentes en Situación de Vulnerabilidad en Bolivia, Colombia, Ecuador, Guyana, Honduras y Perú, con el apoyo financiero del Gobierno de Canadá para abordar algunos de los desafíos más apremiantes relacionados con la salud de las mujeres y las adolescentes.
In a post-pandemic context, where we have seen setbacks in sexual and reproductive health indicators, including the maternal health, the interventions of this project are more critical than ever to recuperate lost public health gains, reduce health disparities, and promote informed health decisions among women and adolescents.
Fortaleciendo las capacidades de más de 45.600 personas, incluyendo proveedores de salud, servidores públicos y trabajadores de salud comunitarios, como las parteras tradicionales, el proyecto ha contribuido a fortalecer los sistemas de salud desde la atención primaria y a expandir el acceso a los servicios de salud sexual y reproductiva en los 6 países. También ha apoyado la creación de alrededor de 100 orientaciones técnicas para mejorar la calidad de la atención y ha desarrollado iniciativas innovadoras de telesalud para optimizar los resultados de salud materna y neonatal. Partiendo de un abordaje integral y promoviendo la igualdad de género, el proyecto ha fomentado el empoderamiento de las mujeres y adolescentes para que puedan tomar decisiones informadas sobre su bienestar y participen activamente en aspectos relacionados con sus derechos de salud sexual y reproductiva.
Evidence shows that investing in the sexual and reproductive health and rights of women and girls improves the quality and accessibility of comprehensive health care for everyone.
Además, considerando la diversidad cultural, se ha implementado la metodología de diálogos de saberes, promoviendo que las comunidades se acerquen cada vez más a los centros de salud a través del intercambio de visiones sobre temas como el embarazo adolescente y las violencias de género. El proyecto se lleva adelante de manera coordinada con los ministerios de salud, la sociedad civil y líderes y lideresas comunitarias en los 6 países, haciendo posibles espacios de intercambio, capacitación y transferencia de conocimientos. La alianza entre el Gobierno de Canadá y la OPS es fundamental para continuar los esfuerzos de mejorar la salud de las mujeres y las adolescentes en situaciones de vulnerabilidad, con miras no solo de avanzar hacia el cumplimiento de los objetivos de desarrollo sostenible, sino para continuar impactando positivamente la vida de las mujeres y que en un futuro cercano
that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument have now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So.
Personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the individual, the participants involved as much as possible. So it's not like just giving, but they are giving, receiving,
Yes.
Collaboration. Yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal, and I think all of these accomplishments were done as teams, and I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's right to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
En nuestra región, donde las distancias y la dificultad para el acceso a los servicios de salud se han transformado en una problemática frecuente, la telesalud se presenta como una solución innovadora y accesible. La telesalud combina la tecnología con los servicios de salud para llevar la atención a quien más lo necesita, sin importar su ubicación. Desde consultas virtuales hasta seguimiento de patologías de manera remota, estas herramientas están transformando el acceso a la salud. La Organización Panamericana de la Salud, OPS, está apoyando este cambio a través de su propuesta de telesalud. La OPS ofrece una plataforma todo en uno para el registro clínico electrónico y la realización de videoconsultas, que está disponible como bien público digital. Además, la OPS proporciona recursos educativos mediante estrategias de simulación que capacitan a los profesionales, permitiéndoles brindar atención de calidad. Esto incluye un telekit, que consiste en dispositivos médicos seleccionados para el seguimiento de patologías crónicas a distancia,
Since 2021, the Pan American Health Organization, PAHO, has been implementing the Improved Health of Women and Adolescent Girls in Situations of Vulnerability project in Bolivia, Colombia, Ecuador, Guyana, Honduras, and Peru. With financial support from the Government of Canada, this project addresses some of the most pressing challenges related to the health of women and adolescents.
In a post-pandemic context, where we have seen setbacks in sexual and reproductive health indicators, including the maternal health, the interventions of this project are more critical than ever to recuperate lost public health gains, reduce health disparities, and promote informed health decisions among women and adolescents.
By strengthening the capacities of more than 45,600 people, including healthcare providers, public servants, and community health workers, such as traditional midwives, the project has contributed to strengthening health systems from primary care and expanding access to sexual and reproductive health services in the 6 countries. The project has also supported the creation of about 100 technical guidelines to improve the quality of care and has developed innovative telehealth initiatives to optimize maternal and neonatal health outcomes. Taking a comprehensive approach and promoting gender equality, the project has fostered the empowerment of women and adolescents so they can make informed decisions about their well-being and actively participate in matters related to their sexual and reproductive health rights.
Evidence shows that investing in the sexual and reproductive health and rights of women and girls improves the quality and accessibility of comprehensive health care for everyone.
Additionally, considering cultural diversity, the Knowledge Dialogues methodology has been implemented by exchanging perspectives on issues such as teenage pregnancy and gender-based violence, encouraging communities to increasingly attend health centers. The project is carried out in coordination with ministries of health, civil society, and community leaders in the 6 countries, creating spaces for exchange, capacity building, and knowledge transfer. The alliance between the Government of Canada and PAHO is essential to continue efforts to improve the health of women and adolescents in situations of vulnerability. This collaboration aims not only to advance towards the achievement of the Sustainable Development Goals, but also to continue to positively impact the lives of women so that in the near future, all can exercise the sexual and reproductive health rights, leaving no one behind.
Global Affairs Canada is a key and long-standing partner. We share common priorities in promoting health equity, gender equality, and women's sexual and reproductive health and rights. Thanks to our alliance, we have been able to strengthen health systems to make them more accessible, sustainable, and resilient.
So AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary health care system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child. It's a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really we're able to accomplish this just with our team that we have here at National Public Health Lab. It was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributes moved away from sending our samples abroad. Having that instrument have now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So
Personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the participants involved as much as possible. So it's not like just giving, but they are giving, receiving,
Yes.
Collaboration. Yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal, and I think all of these accomplishments were done as teams, and I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's rights to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
En nuestra región, donde las distancias y la dificultad para el acceso a los servicios de salud se han transformado en una problemática frecuente, la telesalud se presenta como una solución innovadora y accesible. La telesalud combina la tecnología con los servicios de salud para llevar la atención a quien más lo necesita, sin importar su ubicación. Desde consultas virtuales hasta seguimiento de patologías de manera remota, estas herramientas están transformando el acceso a la salud. La Organización Panamericana de la Salud, OPS, está apoyando este cambio a través de su propuesta de telesalud. La OPS ofrece una plataforma todo en uno para el registro clínico electrónico y la realización de videoconsultas, que está disponible como bien público digital. Además, la OPS proporciona recursos educativos mediante estrategias de simulación que capacitan a los profesionales, permitiéndoles brindar atención de calidad. Esto incluye un telekit, que consiste en dispositivos médicos seleccionados para el seguimiento de patologías crónicas a distancia, y una caja de herramientas con recursos para implementar programas de telesalud.
súper buena, porque no se demoran en llamarla. Entonces la hora se la dan por el mismo teléfono. Entonces no es un tema que uno tenga que venir para acá como lo hacía uno antes, que levantarse temprano. Lo encuentro súper bueno. Pues me manejo mucho en esto internet, así que le dije a mi hija que me enseñara cómo era el tema y es súper fácil.
Más cómodo para uno, no estar saliendo de la casa, lo puede hacer a cualquier hora, yo que trabajo todo el día.
La telemedicina acerca a los profesionales con sus pacientes, cuidándolos en tiempo real, mejorando el manejo de su salud e acercándoles cuidados de calidad.
Minha formação acadêmica está na área da telesaúde. Minha profissão é na área de telesaúde. Isso aí, para mim, é como se fosse realizar um sonho que está acontecendo.
En conclusión, la telesalud está dando acceso a muchos pacientes. Con la OPS apoyando estas implementaciones, se están reduciendo brechas, mejorando la calidad de vida y proporcionando a cada persona la atención que merece. Es hora de sumarse.
Oi, eu sou a Rafaela e eu ouvi dizer que o escritório da OPAS no Brasil está fazendo um monte de coisas legais para cuidar do meio ambiente e eu vim aqui ver de perto.
Oi, eu sou Matias. Será que a OPAS é verde mesmo? Oi, sou Liz, quero trabalhar aqui no futuro.
Oi, bem-vindos à OPAS, crianças!
Nós ainda temos containers maiores que também podem ser usados para papel, para papelão, ou seja, tudo aqui pode ser reciclado.
Tá vendo essas bicicletas aqui? Ó, isso aqui a gente fez para os colegas nossos aqui da OPAS que quiser pedalar, elas ficam aqui disponíveis para todo mundo.
Aqui na OPAS a gente não usa nada descartável, só copos e garrafas reutilizáveis. E olha só que legal, nosso mexedor é de bambu.
Nós também acabamos de instalar uns painéis para captar energia solar.
A OPAS também tem um sistema de irrigação e só usa o necessário.
Oi, Rafa, para finalizar, vou mostrar para vocês os 120 ipês amarelos que nós plantamos e que hoje estão pequenininhas, mas no futuro vão ficar grandes igual aquela lá atrás.
Nós estamos cuidando do planeta também aqui. Estamos cuidando para vocês.
Nosotros como Oficina de País en Nicaragua nos encaminamos a una oficina verde tomando en consideración el consumo de papel para nuestras impresoras. Tenemos una estadística que desde el 2019 fue la última vez que se compraron resmas de papel en una cantidad de 180 resmas. En el 2024 tenemos un saldo de 136 resmas. Eso indica de que solamente se han utilizado 44 resmas en 5 años, a razón de un promedio de 8.8 resmas por año en consumo. Esto también implica, si hay una reducción del consumo de papel, hay una reducción también de tóner para nuestras impresoras. La representación en Nicaragua se unió a la modalidad de trabajo en casa, lo que permitió una reducción de consumo de papelería y tóner en esta oficina. Como organización debemos de ser parte activa de la ecologización de nuestras instalaciones, adoptando políticas ambientalmente sostenibles con prácticas modernas de ahorro de energía, reducción de residuos y reciclaje.
Desde el equipo de OPS en Colombia estamos comprometidos con la sostenibilidad. La sostenibilidad para proteger el medio ambiente y sobre todo para cuidar de la salud de cada uno y cada una de nosotros, los habitantes en este hermoso planeta.
Desde el 2023, la representación en Colombia aplica dentro de la evaluación de eventos competitivos criterios de sostenibilidad.
Solicitamos a nuestros proveedores el uso de empaques biodegradables o de más de un uso, la alimentación saludable y el manejo de residuos al final de los eventos.
Promovemos desde la planificación del evento el uso de la tecnología en vez de la impresión de material. Esto con el fin de ayudar al medio ambiente y a la optimización de los recursos de la organización.
Hemos tenido muy presente la sostenibilidad, no solamente en términos de lo que ha sido toda la construcción para nuestras nuevas oficinas, sino también en cada una de nuestras actividades, pensando en cuáles son los mejores materiales, el poder reducir el uso del papel y, por supuesto, velando por esa salud de cada una y cada uno de los miembros del equipo del OPS en Colombia.
Los interruptores inteligentes nos ayudan a un ahorro más eficiente de la energía. Asimismo, contamos con UPS. Esto nos ayuda a hacer un ahorro entre el 20 y el 30% de nuestro consumo de todos los equipos que tenemos en la oficina.
El compromiso con la sostenibilidad es una tarea de todos. Es por eso que desde OPS Colombia queremos dar ese ejemplo y poder continuar en este trabajo.
Anissa, pour nous arriver à tout le monde même chance, nous travaillons avec un pile l'hôpital. Pour nous arriver faire promotion à l'étoile maternelle et soutenir maman qui a bay tété seulement pendant 6 premiers mois de la vie de petit monde. Comme ça, nous gagnons l'hôpital Trou du Nord qui déjà passé 2 évaluations internes et qu'on y a capté une évaluation externe dans début mois de septembre pour nous arriver certifié comme hôpital ami des bébés. Ça veut dire un hôpital qui est ami des bébés côté tout personnel là depuis prend directeur pour arriver joindre sécurité dans barrière, tout le monde met ensemble pour faire toute femme qui est enceinte qui vient accoucher connaît que c'était seulement pour bailler petit monde pendant 6 premiers mois la ville.
L'initiative Hôpitaux Amis des bébés garantissent que les maternités dispensent des informations et du soutien continu aux mères en respectant aussi les besoins et les rythmes naturels des nouveau-nés.
Ensemble, ces actions contribuent à améliorer la santé et le bien-être des nourrissons en Haïti, offrant à chaque enfant un meilleur départ dans la vie grâce à l'allaitement maternel et contribuent à la réalisation des objectifs de développement durable.
Hoy visitamos esta sala de vacunas Padre Monchi, aquí en Foz de Iguazú, el equipo de evaluación externa, y hemos evaluado y analizado y conversado con los colegas y trabajadores de la salud del sistema del SUS.
La evaluación consiste de varias fases, la primera de las cuales es parte del país, en el cual utiliza un instrumento de autoevaluación, y posteriormente un equipo de expertos viaja al país, visita, conoce la realidad en territorio y de esa forma les permite identificar potenciales oportunidades de mejora, recomendaciones y también fortalezas que deben ser sostenidas a lo largo del tiempo y eventualmente compartidas con otros países de la región para fortalecer las capacidades no solo a nivel nacional, sino a nivel regional.
A avaliação externa voluntária ela vem num momento muito importante para o Brasil. É um momento que o Programa Nacional de Imunizações ele passa por mudanças e reajuste, ele está tendo uma reorganização, uma reestruturação.
Lo importante de las evaluaciones es que son un mecanismo que permite al país que la solicita poder tener una idea clara de cuál es su situación actual, no solo desde su propia autoevaluación que el país la hace, sino desde la visión de un evaluador externo, lo cual no solo les permite corregir aquellas situaciones en las cuales se pueden mejorar o confirmar que el camino es el correcto, que la situación está bien llevada adelante, de manera que es un ejercicio en el cual el país tiene todo para ganar.
We saw here a lot of aha moments. People, they have not seen like that with their own eyes. And so bringing these external perspectives and these opportunities for peer learning, it's great because they can actually see things with other eyes, bring fresh perspectives, and see what are the gaps that they have not thought through, and finally address those because that will put the programs in a much better position in the future.
O Programa de Imunizações ele tem um grande desafio que é o sistema de informação. Tem um sistema de informação nominal com informações importantes do indivíduo, como também garantir os estoques e garantir que a vacina que está prevista no calendário nacional de vacinação, ele chegue até a população, seja a população mais distante, como também reorganizar a estrutura interna do programa, fazer com que toda a equipe técnica consiga trabalhar de uma forma efetiva, que essa equipe consiga produzir adequadamente e propor estratégias de vacinação para o país de uma maneira efetiva.
I'm very impressed with how the Ministry of Health has adapted to low coverage after COVID-19 and the initiatives to improve routine immunization coverage as well as to restore vaccine confidence in the population.
Brazil is a very large and diverse country, and they've made tremendous progress. And one of the main recommendations is really strengthening laboratory and epidemiologic surveillance in support of the disease elimination goals. I think there's a lot of information systems that are really fantastic, but improving the linkages between those, as well as some improvements related to cold chain vaccine stock management and infrastructure as well.
Lo que un país que acepta una evaluación está mostrando es que tiene capacidad autocrítica, que acepta ayuda externa, que no se queda con la única verdad que es la de ellos y que está dispuesta a seguir creciendo consiguiendo más información. Creo que los programas de inmunización tienen que convencer a sus autoridades de la importancia de mantener el intercambio con otros países y las evaluaciones.
Todavía hay mucho trabajo. Yo creo que la recuperación se está viendo, pero jamás podemos dar por sentado que eso se va a convertir en algo automático. Creo que en esta última milla para llegar a ese 95% donde todavía tenemos que emplearnos más, concentrarnos más, y por eso es que este tipo de ejercicios de evaluación, de ver cómo está el desempeño del programa de inmunizaciones, cobran una vital importancia, porque te permite justamente, o les permite a los países saber dónde está esa parte que le está apretando el zapato y cómo justamente salir adelante. Entonces, por eso es que son tan importantes ese tipo de ejercicios.
Brasil ha identificado muchas oportunidades de mejora que ya está implementando a través de este proceso. Brasil está demostrando que sí puede, que su política de salud en el Sistema Único de Salud con el programa de inmunización es una realidad para todos los brasileños y las personas que llegan a Brasil, sus fronteras y sus 5.570 municipios comprometidos con la salud de los brasileños y las brasileñas.
Los espacios subregionales son una oportunidad única para la cooperación entre países como una modalidad para la reducción de desigualdades y mejorar las condiciones de salud de sus poblaciones. Así, de esta manera, desde hace varios años, la organización puso en práctica la Iniciativa de Cooperación Sur-Sur para el Desarrollo en Salud, mejor conocido como CCHD. Y por medio de esta iniciativa, en el año 2023 se pusieron fondos semillas para financiar el proyecto de Cooperación Sur-Sur para la detección temprana del cáncer infantil en los países andinos. Esto en una estrecha colaboración con el convenio Hipólito Unanue, el Horas-CONU.
Dentro de los logros más importantes, tenemos la elaboración conjunta y aprobación por los ministros de salud andinos de la hoja de ruta para mejorar la atención del cáncer en niños, niñas y adolescentes en la subregión andina al 2030.
Este proyecto de cooperación sur-sur, que incluyó el intercambio de conocimientos y experiencias entre los países de toda la región andina, ha contribuido a la creación de una política subregional, de diferentes estrategias y planes nacionales que abordan de una manera muy objetiva, muy clara y muy directa lo que es la detección y el diagnóstico temprano de cáncer infantil en todos estos países de la subregión.
Lo más importante es que existe una agenda común interinstitucional que permite sumar conocimientos y experiencias en pro de la niñez y la adolescencia, generando un impacto positivo significativo en la atención del cáncer infantil.
El video que vemos ahora nos presenta de una manera muy clara, con testimonios muy sentidos, con una muestra muy definitiva del beneficio que tiene la cooperación sur-sur para el desarrollo en salud.
Los niños son de interés superior. Los niños, desde la Convención Marco de Naciones Unidas de Derechos Humanos de Infancia y Adolescencia, son de interés prioritario y su salud también. Y por eso salvar una vida de un niño es fundamental para los gobiernos y para todos los actores.
En estos momentos en La Guajira, pues tenemos varias dificultades en el acceso a la salud en las comunidades indígenas, ya que muchas de estas comunidades son comunidades dispersas, que no se encuentran muy cerca al área urbana. Entonces, esa es la primera dificultad, el acceso y las barreras que se presentan para estas comunidades para obtener un servicio de salud. Y todos los determinantes que puedan disminuir la incidencia de esas enfermedades que están afectando a la población, principalmente indígena, como es el cáncer infantil.
Cuando yo llegué a la clínica me hicieron exámenes, me hicieron radiografía, todo eso, y después me salió que yo tenía una masa. Y después ya descubrieron que lo que yo tenía leucemia y fibroblastica aguda. Es de esa maligna.
En ese momento cuando me dieron la noticia, eso fue duro, porque no me imaginé de que ella iba a tener eso, porque ella era una peladita sana, no tenía nada.
La OPS, desde la iniciativa de mejor atención para las enfermedades no transmisibles como el cáncer, busca fortalecer las competencias, el conocimiento de los equipos de atención primaria, y es en el marco de este enfoque de equidad, de lograr justamente afectación de los determinantes sociales, que se logra este proyecto de cooperación para fortalecer las competencias, el conocimiento de estas enfermedades del cáncer infantil en niños y adolescentes, tanto en profesionales de la salud, médicos, enfermeras y otros profesionales, asimismo también en gestores comunitarios y en toda la red de apoyo social y administrativo que se requiere para lograr un tratamiento de oportunidad, detección oportuna y también de calidad.
Para La Guajira tenemos una población bastante dispersa, una población con unos determinantes sociales muy críticos, en donde definitivamente tenemos que entrar a capacitar al personal que está cerca de esas comunidades, a los mismos líderes comunitarios, para que aprendan a identificar de manera temprana el cáncer infantil y así poder hacer un tratamiento rápido. Tenemos que fortalecer las redes de atención específicas para el manejo de esos pacientes.
Todavía hay pacientes que mueren por causas que pueden ser evitables. Por eso estamos acá, porque hacer los cursos de detección temprana le damos herramientas a los médicos para que ellos puedan detectarlo tempranamente, hacer un tratamiento oportuno y evitar así la muerte temprana en nuestros pacientes.
Hace poquito me dijeron que la masita que ella tiene se está reduciendo al 75%, ha reducido mucho.
Dejo que los cuiden mucho porque está dando mucho la leucemia y el cáncer. Y obsérvalos, no deje de observarlo.
Y aunque sea un niño, yo soy un vencedor. Yo vivo feliz porque tengo a yo. Y aunque sea un niño, yo soy...
Ella le preguntan qué se quiere ser y ella dice, no, yo quiero ser doctora.
Desde el 2021, la Organización Panamericana de la Salud pone en marcha el proyecto Mejorando la Salud de las Mujeres y las Adolescentes en Situación de Vulnerabilidad en Bolivia, Colombia, Ecuador, Guyana, Honduras y Perú, con el apoyo financiero del Gobierno de Canadá para abordar algunos de los desafíos más apremiantes relacionados con la salud de las mujeres y las adolescentes.
In a post-pandemic context, where we have seen setbacks in sexual and reproductive health indicators, including the maternal health, the interventions of this project are more critical than ever to recuperate lost public health gains, reduce health disparities, and promote informed health decisions among women and adolescents.
Fortaleciendo las capacidades de más de 45.600 personas, incluyendo proveedores de salud, servidores públicos y trabajadores de salud comunitarios, como las parteras tradicionales, el proyecto ha contribuido a fortalecer los sistemas de salud desde la atención primaria y a expandir el acceso a los servicios de salud sexual y reproductiva en los 6 países. También ha apoyado la creación de alrededor de 100 orientaciones técnicas para mejorar la calidad de la atención y ha desarrollado iniciativas innovadoras de telesalud para optimizar los resultados de salud materna y neonatal. Partiendo de un abordaje integral y promoviendo la igualdad de género, el proyecto ha fomentado el empoderamiento de las mujeres y adolescentes para que puedan tomar decisiones informadas sobre su bienestar y participen activamente en aspectos relacionados con sus derechos de salud sexual y reproductiva.
Evidence shows that investing in the sexual and reproductive health and rights of women and girls improves the quality and accessibility of comprehensive health care for everyone.
Además, considerando la diversidad cultural, se ha implementado la metodología de diálogos de saberes, promoviendo que las comunidades se acerquen cada vez más a los centros de salud a través del intercambio de visiones sobre temas como el embarazo adolescente y las violencias de género. El proyecto se lleva adelante de manera coordinada con los ministerios de salud, la sociedad civil y líderes y lideresas comunitarias en los 6 países, haciendo posibles espacios de intercambio, capacitación y transferencia de conocimientos. La alianza entre el Gobierno de Canadá y la OPS es fundamental para continuar los esfuerzos de mejorar la salud de las mujeres y las adolescentes en situaciones de vulnerabilidad, con miras no solo de avanzar hacia el cumplimiento de los Objetivos de Desarrollo Sostenible, sino para continuar impactando positivamente en la vida de las mujeres y que en un futuro cercano, sin dejar a nadie atrás, todas puedan ejercer su derecho de salud sexual y reproductiva.
Global Affairs Canada is a key and long-standing partner. We share common priorities in promoting health equity, gender equality, and women's sexual and reproductive health and rights. Thanks to our alliance, we have been able to strengthen health systems to make them more accessible, sustainable, and resilient.
pile cas de complications obstétricales chez les grandes multiparts. C'est des complications que tu as éviter si tu as une campagne très large, si tu as une connaissance beaucoup plus accessible par rapport à la question de santé maternelle et reproductive.
Di yo planin nan pa an, tout moun ap kouri di planin
en pile bagay là, m'tap di yo plan n'a pas, y a un pile femme qui a pensé, il y a un problème. Mais moi même pendant que je informé dans tout, les m'bat ko rentrer en dedans, je pensé c'était un problème mais pendant que je viens entrer, moi pas il pas rien.
PAHO WHO support to the Ministry of Public Health and Population in the field of reproductive health in Haiti is made possible through the Universal Health Coverage Partnership. It's a core component of WHO's special program on primary health care. It aims to strengthen the leadership of ministers of health in building equitable, resilient, and efficient health systems on our primary health care approach. PAHO WHO technical cooperation is not limited to trainings and the provision of contraceptive devices. It also aims to create an environment where every woman can make informed decisions about her reproductive health. Improving women's access to family planning and long-acting contraceptive methods is essential to ensuring their autonomy and well-being.
La Semana de Vacunación en las Américas se ha convertido en el movimiento más grande de la región en favor de la vacunación desde hace 22 años. Con más de 40 países y territorios participantes y la generosa contribución de socios y donantes, hemos logrado un hito extraordinario. Más de 1.15 billones de personas vacunadas y la eliminación de 6 enfermedades en nuestra región. Cada año, los profesionales de la salud llegan a los lugares más remotos para unirse a miles de personas que celebran la seguridad y la protección que traen las vacunas a sus vidas. Los esfuerzos de los países por recuperar las coberturas de vacunación durante la Semana de Vacunación en las Américas ponen de manifiesto su determinación para construir comunidades más fuertes y saludables. Este es el momento para asegurar un mañana más seguro para todos. La inversión y el fortalecimiento de los programas de inmunización debe continuar para proteger a las poblaciones de las amenazas latentes. La vacunación es un compromiso por el bienestar y la salud de las Américas. Actuemos ahora y protejamos el futuro de todos.
we introduced the Jerónimo Venegas Strategic Reserve for Health Emergencies and Disasters of the Pan American Health Organization, located at the United Nations Humanitarian Response Depot in the Regional Logistics Center in Panama. The reserve has been established as part of a regional operational mechanism that supports countries in emergency situations by sending supplies when needed, providing a rapid, coordinated, and effective response. This is achieved thanks to the coordination among different teams, needs assessment, integration of logistics systems, and the connection of special emergency administrative processes. The technical and operational management of the reserve is under the responsibility of the Department of Health Emergencies of the Pan American Health Organization, in close coordination with technical areas and support entities at the regional level. The benefits of this mechanism include reducing delivery times, decreasing the risks of delays, ensuring safe storage, compliance with quality standards, and an integral vision of health service delivery. The reserve has provided support in situations such as floods, earthquakes, volcanic eruptions, tropical storms, hurricanes, disease outbreaks, and prolonged emergencies in the region. In addition, there is an identified and updated inventory through technical analysis based on lessons learned and experience from previous events. With this, the Jerónimo Venegas Strategic Reserve for Health Emergencies and Disasters demonstrates that, in the face of emergency situations in our region, it is a fundamental mechanism of support for affected countries to protect the most vulnerable and save lives.
La Alianza por la Atención Primaria de Salud en las Américas, lanzada en diciembre de 2023 por la Organización Panamericana de la Salud, el Banco Interamericano de Desarrollo y el Banco Mundial, tiene como objetivo fortalecer los sistemas de salud de la región basados en la atención primaria, para que sean resilientes y equitativos, y avanzar hacia la salud universal. Bajo el liderazgo de los Ministerios de Salud y la colaboración entre la OPS, el BID y el Banco Mundial, la Alianza promueve una acción coordinada que oriente y articule las inversiones en la salud, aproveche las innovaciones y acelere la transformación de los sistemas para mejorar el acceso y reducir las inequidades.
Desde el lanzamiento de la Alianza por la Atención Primaria de Salud, hemos visto un enorme interés por parte de los países de América Latina y Caribe. Estamos trabajando con 10 países para aumentar el compromiso y financiamiento en la atención primaria de salud, bajo el liderazgo de los Ministerios de Salud y con nuestros socios de la Alianza, mejorando la planificación estratégica y la asignación de recursos. Ya sea para mejorar la salud materna e infantil, prevenir y gestionar las enfermedades transmisibles, ou mejorar a atenção e tratamento de enfermidades não transmissíveis, a Aliança está apoiando a los países para que inviertam, inovem e implementem melhor, basando-se na estratégia de atenção primária de saúde. Como hemos visto no diálogo sobre financiamento da saúde organizado para el Caribe, a Aliança pode unir a los setores de saúde e finanças em torno de uma renda comum, melhorar a saúde para todos.
La Alianza está liderando intervenciones integradas y planes de acción en 10 países de Latinoamérica y el Caribe, y ha apoyado el diálogo entre salud y finanza en 8 países del Caribe. Los esfuerzos conjuntos también están enfocados en el desarrollo de 4 bienes públicos regionales.
Desde el Banco Mundial y trabajando en alianza con el BID y la OPS, estamos comprometidos en apoyar a los países a través de financiamiento, asistencia técnica y ampliando el conocimiento. Hemos formado, por ejemplo, la Comisión Lancet de las Américas, que nos ayudará a entender mejor cómo proveer una atención primaria más efectiva y que llegue a todos. Celebramos el compromiso político de varios países de la región en apostar por la atención primaria de salud como un vehículo transformador y fundamental para alcanzar la cobertura universal y cumplir nuestra meta para el 2030 de ofrecer servicios sanitarios asequibles y de alta calidad a más de 1.500 millones de personas en el mundo.
En el BID, nuestro compromiso con la salud de América Latina y el Caribe es constante. La atención primaria es una prioridad y la estamos llevando al siglo XXI. Una atención primaria moderna es fundamental para abordar los retos de salud de nuestra región, como las enfermedades crónicas y la salud mental. Además, es crucial para enfrentar desafíos globales como el cambio climático y futuras epidemias. Nuestra alianza con la OPS y el Banco Mundial fortalece aún más este compromiso. Juntos y bajo el liderazgo de los países, estamos creando un futuro donde cada persona en nuestra región tenga acceso a sistemas de salud digitales y resilientes.
Con un enfoque participativo y centrado en la acción en los países, se ha avanzado en alianzas estratégicas a nivel nacional, impulsadas por las autoridades, basándose en sus necesidades y prioridades de salud.
Con esta alianza haremos que la atención primaria sea más fuerte en cada rincón de la República Dominicana. Trabajaremos para que nadie se quede atrás. Además, promoveremos una mayor coherencia entre las iniciativas regionales de la APS para hacer que la atención médica sea más ágil, con menos fragmentación, mejor acceso y sobre todo más equidad. Invertir en la atención primaria es invertir en un futuro más justo y sostenible. La salud es un derecho de todos. Juntos estamos construyendo un sistema de salud más fuerte para un futuro donde todos estemos incluidos.
El enfoque absoluto de la Secretaría de Estado en la atención primaria en salud es absoluto. Hemos necesitado socios valiosísimos para poder hacer realidad ese enfoque que nos permita llegar a más personas y a mayor territorio. A pesar de las diferencias o de las dificultades que podamos tener en ese alineamiento, que hay que reconocer no es fácil, son más los puntos de encuentro que los de desencuentro. Y eso nos ha permitido como país grandes mejoras y mejores cosas que vendrán. Estamos optimistas, estamos esperanzados, estamos agradecidos, pero sobre todo comprometidos. La atención primaria es la clave para tener países saludables y productivos.
La alianza continuará trabajando para fortalecer los sistemas de salud en la región, basados en la atención primaria, para ampliar la cobertura y garantizar el acceso universal a la salud, para todas las personas, en todas partes.
La resistencia antimicrobiana es cuando no tomas tu medicina a su debido tiempo y a su debida hora, y eso hace que tengas una resistencia en tu cuerpo.
Los microorganismos para evolucionar necesitan determinados mecanismos que les permitan seguir viviendo. Los antibióticos, los antiparasitarios, que las hemos utilizado como medidas terapéuticas, hacen que ellos, para poder seguir sobreviviendo, desarrollen mecanismos de defensa y mecanismos que se llaman de resistencia.
La resistencia antimicrobiana es un proceso natural, pero que la actividad humana la ha acelerado a través del consumo excesivo de los antibióticos, tanto para tratar enfermedades como también para la alimentación en los animales.
Se vuelve un problema porque las enfermedades que antes se podían combatir más fácilmente, hoy nos encontramos con que no está pasando así, ¿no?
Es un problema médico porque muchos pacientes, uno les da un determinado tratamiento y ese tratamiento no funciona. Entonces tenemos que buscar líneas de antimicrobianos más elaboradas y a veces no funciona ninguna. Pero también tenemos que pensar que es un problema de la salud planetaria, porque los antibióticos no solamente llegan a nosotros por una prescripción médica, por una automedicación, sino que también vienen en alimentos.
Lo mismo que pasa en la agricultura, gran uso de plaguicidas, lo que vemos con los sistemas ganaderos
aún muchas veces los de pequeña escala, es que están altamente hacinados los animales en base a alimentos que no son propios y fundamentalmente con gran cantidad de antibióticos. Cada vez más antibióticos porque la resistencia recrea esto, más necesidad. Por un lado, punto de vista económico, más caro. Por otro lado, esos antibióticos terminan en el suelo, terminan en el agua y después terminan en nosotros los seres humanos.
Tiene que ver con que se ha perdido ese sentido de equilibrio. Ya no puedo protegerme. Y esa desprotección hace que sienta otra vez, entramos a ese círculo de violencia, de desprotección, de sentirme atacado, entonces tener que volverme en un depredador.
Tenemos que pensar un paradigma productivo diferente, cómo hacemos para que nuestros animales tengan salud. No pensar en la enfermedad y poner un antibiótico, sino qué hacemos para que no necesitemos antibióticos.
Por eso directamente, si queremos hablar también de la resistencia a los antimicrobianos y cómo vamos a paliar esto, cómo vamos a detener esto, pues hay que volver necesariamente al origen, que es volver a cuidar a nuestra madre tierra.
Es importante hablar de comunidades empoderadas. Siempre que nosotros mencionamos una sola salud, tenemos que comenzar de abajo hacia arriba. Porque abajo están las sabidurías, están los conocimientos.
Porque es la gente de abajo, de las comunidades que han sido también formadas en ese sentido, ¿verdad? Para que tengan información suficiente para saber cómo es el problema y para proponer soluciones. Y es importante que se haga desde abajo, desde los liderazgos comunitarios, porque son quienes están sufriendo los efectos de toda esta condición.
Todo eso hace una sola salud. Los médicos solos, esto no es un problema de salud, esto es un problema que involucra médicos, veterinarios, agrónomos, comunidad.
Y dentro de la comunidad hay actores sociales que son fundamentales, ¿no? Y entre ellos, en el área educativa, los docentes, los promotores de salud, promotores comunitarios, tienen un rol fundamental en lo que tiene que ver con la formación, con la transmisión de conocimientos, de maneras diversas, diferentes, creativas, artísticas.
Es un esfuerzo grande, hay que trabajar con productores, consumidores, con los tomadores de decisión, con los comunicadores y nos queda un largo camino.
Desde las comunidades tendríamos que hacer un llamado bastante fuerte a los gobiernos, ir a la posibilidad de retomar cambios profundos.
Porque se necesita que los estados tomen acción a través de sus autoridades y la gente tiene que presionar a sus gobernantes para que ese proceso se dé.
Muchas veces los tomadores de decisión piensan siempre en incrementar la producción, ¿no? Incrementar la producción parece, digamos, este monocultivo mental. Necesitamos producir más, necesitamos exportar más, necesitamos producir más alimentos, necesitamos ganar más plata.
Lo que yo le diría a los líderes de los países es que ellos son decisores y nosotros necesitamos que nos escuchen como comunidad, como profesionales, como ellos mismos también, ¿no? Porque ellos están involucrados en este problema.
Me parece que los adultos y sobre todo los líderes tenemos siempre una deuda hacia las infancias y que tiene que ver con respetar lo que está en la Declaración de los Derechos del Niño, el derecho a la participación, a la libre expresión en todas aquellas temáticas que a ellos los afectan.
Si cuidamos a la madre tierra, cuidamos el aire, los alimentos, los ríos y también a las bacterias.
Quiero mirarlo a los ojos, a los tomadores de decisión, para que podamos comprender las problemáticas que estamos transitando.
Habría que impulsar políticas públicas a favor de la gente, políticas públicas a favor de las comunidades.
Tomemos en cuenta esta problemática, esta gran problemática del abuso en el uso justamente de los antibióticos que está generando resistencia.
Me gustaría que las autoridades hagan campañas de salud para el buen uso de los antibióticos.
Este es un llamado por el derecho humano a la salud y la vida.
Los enfoques para abordar la RAM,
basados en la participación social y la colaboración global,
son la clave para encontrar soluciones efectivas.
Unidos en la diversidad,
mantenemos nuestro compromiso en esta causa global.
En la Asamblea General de las Naciones Unidas 2024.
Hay mucho por ver aquí. Se ha trabajado mucho por generar un impulso en el incremento de la calidad de vida de las personas.
En un mundo
mundo con menos enfermedades transmisibles, más personas tienen la oportunidad de construir vidas mejores, más saludables y seguras. Pero el impulso no puede detenerse aquí.
La pandemia de COVID-19 nos ha demostrado que mientras las enfermedades transmisibles sigan propagándose, nuestra calidad de vida está en peligro. Todos estamos en riesgo hasta que estemos seguros.
Por eso, la iniciativa de eliminación de la OPS se ha propuesto eliminar más de 30 enfermedades transmisibles y afecciones relacionadas para el 2030.
Para lograrlo, debemos asegurarnos de que todos en las Américas tengan acceso a vacunas y atención médica de calidad, que incluya diagnóstico y tratamiento oportunos, instalaciones de higiene, agua y saneamiento.
Esto no es un sueño, es un derecho y una responsabilidad de todos. Todos deberíamos tener igualdad de oportunidades para disfrutar de una vida saludable y plena. Hay mucho por ver aquí. Trabajemos juntos por un futuro libre de enfermedades para todos.
La Semana de Vacunación en las Américas se ha convertido en el movimiento más grande de la región en favor de la vacunación desde hace 22 años. Con más de 40 países y territorios participantes y la generosa contribución de socios y donantes, hemos logrado un hito extraordinario. Más de 1.15 billones de personas vacunadas y la eliminación de 6 enfermedades en nuestra región. Cada año, los profesionales de la salud llegan a los lugares más remotos para unirse a miles de personas que celebran la seguridad y la protección que traen las vacunas a sus vidas. Los esfuerzos de los países por recuperar las coberturas de vacunación durante la Semana de Vacunación en las Américas ponen de manifiesto su determinación para construir comunidades más fuertes y saludables. Este es el momento para asegurar un mañana más seguro para todos. La inversión y el fortalecimiento de los programas de inmunización debe continuar para proteger a las poblaciones de las amenazas latentes. La vacunación es un compromiso por el bienestar y la salud de las Américas. Actuemos ahora y protejamos el futuro de todos.
Más de 50 profesionales de la salud de 29 países de América Latina y el Caribe se reunieron en la ciudad de Panamá para un taller de 3 días, organizado por la Organización Panamericana de la Salud, OPS, en colaboración con el Centro Nacional de Capacitación y Educación en Patógenos Emergentes Especiales, NETEC.
Creo que es una excelente oportunidad por reunir como equipo bastante multidisciplinario para abordar una parte quizá que lo que la preparación en general a la emergencia, más sobre todo también a que lo que puede ser epidemia, pandemia, que muchas veces creo en los últimos años no hemos considerado suficiente. Hablamos mucho de que lo que puede ser los planes de preparación, hablamos mucho de la vigilancia, hablamos mucho de los servicios de laboratorio, y son seguramente muy importantes en el ámbito de lo que la seguridad sanitaria. Sin embargo, muchas veces nos olvidamos que al inicio de la pandemia, siempre, de una epidemia, siempre hay un brote, ¿no? Hay siempre la emergencia o la importación de un patógeno y tenemos oportunidades en ese momento también, en esta primera 100 millas, en estas primeras 4 semanas, ¿no? De realmente poder interrumpir la transmisión justamente al inicio de cuando se está generando.
Los participantes aprendieron las directrices revisadas para el transporte seguro de pacientes con enfermedades infecciosas, garantizando una mejor preparación para futuros brotes.
The partnership between NETAC and CAPO is critically important. When we talk about communication, coordination, and collaboration, we have to be able to work together. We have to have succinct and synergistic plans. So this workshop has really given us the opportunity to partner together and continue that collaboration and be able to foster future collaborations as well.
importancia de estos talleres donde reunimos personal asistencial, expertos en temas de manejo clínico, control de infecciones y evacuación médica, y además el personal logístico, es importante porque nos permite darle una visión integral a las operaciones de emergencia. Las operaciones de emergencia van desde lo técnico hasta lo logístico y operativo. Y la manera de garantizar que podamos brindar el mejor servicio a las comunidades es tener personal entrenado, no solo en su campo, sino que pueda ser interoperable con los demás, para poder tener un sistema congruente que se permita monitorear, que pueda llenar las brechas en cuanto a conocimiento o necesidades de otro tipo, y pueda garantizar esa última milla que permite que la gente que sabe qué tiene que hacer tenga los elementos necesarios para operar y garantizar la intervención ante un brote o un brote de alguna enfermedad o algún evento de origen natural o de cualquier otro origen.
Enriquecedor. Maravillosa.
It is very informative and I think very practical. Very often we get information, but when you put both of those together, it just makes the entire concepts very much more meaningful. So I think it's beautiful the way it has been designed and for learning purposes as well.
Sensacional. La verdad es como lo definiría. Mucho aprendizaje, mucho enriquecimiento cultural por parte de todos los compañeros. Nos da como una perspectiva más amplia para llevar a nuestros países de cómo se hace en el resto de las Américas, y básicamente el curso con todos los temas que se tocaron yo lo pudiera catalogar como sensacional.
Excelente, muy integrador, con muy buena combinación de la teoría y la práctica, muy bueno.
Interesante, y lo más novedoso es la integración de toda Latinoamérica y el Caribe.
Interesante, innovador y con muy buenos puntos y temas a tocar.
Académico y pedagógico.
Me parece muy enriquecedor esos espacios, sobre todo el saber cómo se maneja en otros países, el escuchar cómo se da el manejo de la vigilancia de los pacientes, de la parte clínica, y pues todo lo que la Organización Panamericana de Salud nos ofreció. Me pareció muy atractivo las herramientas que utilizaron.
Los participantes mejoraron el uso de equipos de protección personal y protocolos de descontaminación, y recibieron las últimas guías para tratar la influenza grave, incluidas demostraciones de expertos de la red Sarinet de Brasil, Chile y Colombia. Este taller proporcionó actualizaciones clave, formación práctica y oportunidades de crear redes de contacto, fortaleciendo la capacidad de los profesionales de salud de la región para responder mejor a los brotes de enfermedades infecciosas.
Check 1, 2. Yep. Check 1, 2. 1, 2. Great.
Since 2021, the Pan American Health Organization, PAHO, has been implementing the Improved Health of Women and Adolescent Girls in Situations of Vulnerability project in Bolivia, Colombia, Ecuador, Guyana, Honduras, and Peru. With financial support from the Government of Canada, this project addresses some of the most pressing challenges related to the health of women and adolescents.
In a post-pandemic context, where we have seen setbacks in sexual and reproductive health indicators, including the maternal health, the interventions of this project are more critical than ever to recuperate lost public health gains, reduce health disparities, and promote informed health decisions among women and adolescents.
By strengthening the capacities of more than 45,600 people, including healthcare providers, public servants, and community health workers, such as traditional midwives, the project has contributed to strengthening health systems from primary care and expanding access to sexual and reproductive health services in the 6 countries. The project has also supported the creation of about 100 technical guidelines to improve the quality of care and has developed innovative telehealth initiatives to optimize maternal and neonatal health outcomes. Taking a comprehensive approach and promoting gender equality, the project has fostered the empowerment of women and adolescents so they can make informed decisions about their well-being and actively participate in matters related to their sexual and reproductive health rights.
Evidence shows that investing in the sexual and reproductive health and rights of women and girls improves the quality and accessibility of comprehensive health care for everyone.
Additionally, considering cultural diversity, the Knowledge Dialogues methodology has been implemented by exchanging perspectives on issues such as teenage pregnancy and gender-based violence, encouraging communities to increasingly attend health centers. The project is carried out in coordination with ministries of health, civil society, and community leaders in the 6 countries, creating spaces for exchange, capacity building, and knowledge transfer. The alliance between the Government of Canada and PAHO is essential to continue efforts to improve the health of women and adolescents in situations of vulnerability. This collaboration aims not only to advance towards the achievement of the Sustainable Development Goals, but also to continue to positively impact the lives of women so that in the near future, all can exercise the sexual and reproductive health rights, leaving no one behind.
Global Affairs Canada is a key and long-standing partner. We share common priorities in promoting health equity, gender equality, and women's sexual and reproductive health and rights. Thanks to our alliance, we have been able to strengthen health systems to make them more accessible, sustainable, and resilient.
So AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop
the transmission of HIV from a mother to a child. It's a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument now
and partners involved, and also to get the individual, the participants involved as much as possible. So it's not like just giving, but they are giving, receiving.
Good afternoon. Good afternoon. We are ready to start the meeting now. So, Madam President, we have quorum and we can start.
Bueno, muy buenas tardes.
Good afternoon, everyone. Let us reconvene and let's move on to agenda item 8.2, report on strategic issues between PAHO and WHO. I bring you to the attention of Council document CD 61/INF/2. This document will be presented by several speakers. And to this end, I invite Mr. Ronnie Massa, Director of the Department of Planning, Budget, and Evaluation of the Pan American Sanitary Bureau, to please come up to the head table. Also, I invite Dr. Miguel Bournier da Silveira, Legal Counsel of the Pan American Health Organization, and Mr. Derek Walton, Legal Counsel of the World Health Organization, to come to the head table. And they are already sitting here. And now let me give the floor to the representative of the Executive Committee to report on this agenda item. Thank you very much, Madam Chair. The Executive Committee reviewed the report on strategic issues between PAHO and WHO at its session in June. The committee expressed appreciation to the Bureau for facilitating participation by PAHO member states in global processes, including the negotiations within the Intergovernmental Negotiating Body, the INB, on a new pandemic instrument and the working group on the amendments to the international health regulations. The committee also applauded the Bureau's role in promoting coordination and consensus building on the issues under discussion. The Bureau was urged to continue providing such support during the ongoing negotiations of the Intergovernmental Negotiating Body. Delegates also commended the Bureau's efforts to ensure that regional perspectives are reflected in the 14th General Program of Work of WHO and in the WHO investment round discussions. A delegate recalled that the issue of regulation of digital marketing of breast milk substitutes had been raised during the 77th World Health Assembly and invited all member states of the region to work together to reach consensus on a draft resolution on that topic to be put forward during the 78th World Health Assembly in May 2025. Thank you, Madam Chair. Thus, I conclude my report on this agenda item. Thank you very much, a distinguished representative of the Executive Committee. And now I call on Mr. Massa to present the report. Next, I will yield the floor to Dr. Bernier and to Mr. Walton to present the section on the regional consultation regarding the proposal and appointment of the regional directors. The debate will be open to the plenary once we have heard all the presentations. You have the floor, Mr. Massa.
Gracias.
Thank you, Madam Chair. Good afternoon.
Madam President, honorable ministers, director, assistant director, distinguished delegates, colleagues, I'm pleased to start the introduction of this item with the main report that is before you on the strategic issues between PAHO and WHO. And I'm pleased to acknowledge also the presence of our WHO colleagues here, our legal counsel, but also the Director of Resource Mobilization, Daniel, and Imri Holo, Director of Planning, Budget, and Resource Management, with whom we work very closely. This report provides an update on high strategic issues and opportunities related to PAHO's engagement with WHO on leadership, governance, and accountability, and transparency issues, which you have prioritized over the years since we've started presenting this report in 2017. It also includes an annex on on the regional consultation on the nomination and appointment of the WHO regional directors, which will be presented by my colleagues, the legal counsels of PAHO and WHO, as mentioned by the President. I would like to first thank our Executive Committee member states for their input and guidance on the discussion we had on this report in June. And in line with the purpose of this report and the recommendations of member states, I will highlight some key topics that require continuous engagement, relevant updates, and results from our strategic engagement with our colleagues in WHO headquarters and across the regions, and of course with your member states. One, the Intergovernmental Negotiating Body, INB or Pandemic Accord, the IHR review amendments, strategic planning and program budget and financing matters. The report also includes a summary on the ongoing investment round towards a more sustainable, financed and resilient WHO, for which there was an update and a briefing session yesterday here in the same room. As applicable, the report refers to other documents containing additional details that are presented in this Directing Council or in prior governing bodies meetings with regards to the implications for member states of global policy developments. Regarding the INB and IHR reviews, we, the OPAHO team, and the member states have continued to play an active role in shaping the future of WHO's governance and the global health emergency architecture. The PAHO Secretariat has been supporting the member states directly, working with capitals and through delegations in Geneva, and holding regional sessions prior to the global session so that you, our member states, have the latest information and can meaningfully contribute to such discussions. In these various strategic fora, which are of course of utmost importance for global but also regional and country public health agendas. The outcome of these consultations served to guide the development of the WHO Pandemic Accord to advance towards it, as well as the IHR amendments that are currently under discussion and that you were briefed on just a couple of days back in the same room. So the briefing that was held here on Monday highlighted the importance, again, of our regional solidarity and the continuous engagement for meaningful contribution from all member states, as it will have implications for all of us across the region and across countries and the people we serve. Our teams are committed to continue supporting member states on the Pandemic Accord negotiations. We will continue to coordinate with our colleagues in Geneva to facilitate your participation in the global sessions and addressing those challenges that my colleague, Dr. Ciro Ugarte, had presented to you as well on Monday. Regarding the General Program of Work and Program Budget, during the period of this report, we did significant work to develop the proposed General Program of Work together with you and across regions and under the leadership of our colleagues, Dr. Tedros, the DG, and colleagues in headquarters in Geneva. This led to the approval by consensus and support from all member states of the General Program of Work 14th in May at the World Health Assembly. In this region, I'm happy to note that we had a regional consultation and we focused particularly on Caribbean member states and the small island development states to ensure that their voice can also be heard, as oftentimes they face challenges in participating in the global sessions. We also had the opportunity to brief you at the Group of the Americas sessions that we held both in January at the Executive Board and in May before the World Health Assembly. We ensured that through that, your contribution was reflected in that strategic visionary document, General Program of Work 14, including the special circumstances that our small island development states face. And of course, the priorities of our member states across the region. Our region contributed to a more results-oriented and priorities-focused General Program of Work, and the lessons from the GPW 14 development process are in turn informing the development of the new PAHO strategic plan. So there is the learning and exchanging experience that we have from the global processes, but also from across the regions. The draft program budget for 26-27 for the biennium 26-27. The first to be fully developed on the General Program of Work 14 will be consulted with you later today in the subsequent agenda item. This will be presented by my colleague, Mr. Holo. It builds on the results-based approach and experience of priority setting. It reflects a transparent prioritization process of WHO outcomes driven by evidence. We are pleased to note that the region's experience in programmatic prioritization has been useful to this end, and we continue to improve by sharing and learning together. The proposed program budget will include an update on the impact measurement. Again, an important point that you have made, that we need to show measurable impact in countries in particular. We'll have the opportunity to review and contribute as we continue to work with our colleagues across the regions to ensure that you will have a complete results framework for your review in the governing bodies of WHO later next year. This will allow us to continue building on the results culture and increase accountability, and also sharing practices, including the joint assessment of the results that we do in this region. Regarding program budget financing, again, thanks to your continued collaboration and engagement and advocacy, I am pleased to report that we have received increased financing for the region for the program budget that we closed and that you reviewed yesterday in the results report that we presented to you. This is in line with the call for more equitable distribution of WHO funds across regions. As of 31 December, the region had received a total of $182 million, $26 million more than the previous biennium, including more flexible funds and thematic funds that allow the region to respond to the priorities identified with your member states and to continue advancing the country's and regional public health priorities. Again, thanks to the collaboration from our colleagues in the headquarters who are always looking to see whenever there's flexible funds that we get the fair share for the region and the priorities of member states. With regards to the current program budget, 24-25, I'm also pleased to note that $149 million in flexible funds have been committed by the Director General to the region, which include $29 million more than the previous biennium, of which $20 million are to strengthen core predictable country presence. Again, this is in part the result of the increased quota contributions from member states that our region also supported, and we're thankful to member states for approving this increase that allows us to also redirect more funds towards the countries, but also the priorities that we identify with you. As of 31 August this year, the region had received $146 million, or 49% of the approved program budget in base programs. In absolute terms, this represents $60 million more than at the same time in the last biennium. And we continue to see also increased allocations of voluntary contributions, especially of thematic funds, where the WHO colleagues in the headquarters have more flexibility for distribution to the regions. Your team here, the Secretariat, will continue to collaborate and engage with our colleagues in WHO, Geneva, and across the regions, sharing our lessons, experiences, and necessary information to ensure that, as Dr. Jarbas has committed to the Director General and colleagues, for increased transparency, information of PAHO to be fully available regarding budget, HR, and any other information that is needed for the global governance of WHO. We will continue to also facilitate the necessary information and briefings so you, or member states, or countries across the region can benefit from the debate, but also contribute to the global health agenda matters that are of most importance to you and our peoples. Thank you again for your attention. I'll be happy to address questions or provide additional information required by you or the distinguished delegates. Thank you, Madam President.
Muchas gracias, señor.
Thank you very much, Mr. Massa, for this report. And now I yield the floor to Dr. Bernier and to Mr. Walton so that they can report on this agenda item.
Muchas gracias, señora presidenta.
Thank you very much, Madam President. I will now make my presentation as a legal counsel to PAHO. The Executive Board of WHO requested the WHO Director General to hold informal consultations with each region on measures to enhance transparency, accountability, and integrity in the nomination and appointment processes for WHO regional directors. The consultation document that appears in Annex 1 for today's document was prepared by WHO for this purpose. PAHO holds a dual legal identity. First, as an international organization specialized on health within the Inter-American system, and secondly, as the regional office for the Americas of the World Health Organization. The Directing Council, acting as a regional committee for the Americas, is invited to share its views on the potential measures outlined in Annex 1. Following these consultations, a summary document will be presented to the WHO Executive Board. Any recommendation made by the WHO Executive Board will be then sent to each region, where it will be up to each region to decide whether to adopt them. At this time, I will turn the floor over to Mr. Derek Walton, WHO Legal Counsel, to present the document prepared by the WHO.
Thank you very much. Madam President, distinguished delegates, dear colleagues, Director or Deputy Director. Good afternoon. For those of you who don't know me, my name is Derek Walton and I am the legal counsel for WHO. And I've been asked this afternoon to spend a few minutes introducing to you the consultation that's currently going on across WHO about the way that we nominate and appoint regional directors. And before I get into the nitty-gritty, perhaps I better just acknowledge what Miguel has already explained, that there's an added layer of, well, I won't call it complexity, and perhaps an added layer of interest in this region because the head of the organization here is not simply a regional director at WHO, but at the same time wears a second hat, the hat of director of PAHO. And so when looking at this issue from your perspective, you need to keep that very much in mind. So we need to ensure that the two processes for electing both the regional director and the director of PAHO keep aligned as much as possible to avoid different difficulties arising, but at the same time, we're very conscious that you have your very own interests and concerns related to that. So we'll need to keep that in mind as we go through this whole exercise. But let me tell you a little bit about what the exercise is. It started about a year ago during the last round of regional director elections in WHO. There were some suggestions made during those elections for ways in which the system could be improved. And the Executive Board considered this issue when it met for its annual retreat last year. And as a result of that, it commissioned a paper from the Secretariat, which was considered by the board earlier this year. And as a result of that, they commissioned further consultations, both at the global and the regional level, to find out if there was an appetite for making adjustments to the way regional directors are appointed. And as you can see from the slide on the board, we're at the point in the process where there's already been a global consultation earlier this year in April. On the back of that, the Secretariat was asked to draft a consultation document, and there is a link to that in the papers that you already have that sets out what I'm going to speak about now in very much more detail. And we are now at the stage where the regional committees are being consulted. And this is absolutely crucial because the last word rests with you, the regions. You decide whether you're going to implement any changes at all. So you need to be happy with what's being discussed. And this is why we're coming to the regions now to seek your views before we go any further. After we've been to all 6 regions, early next year will be another round of informal consultations at a global level in Geneva, and then the matter will be considered by the Executive Board. Now, one of the options is that the Executive Board may come up with a document, either minimum standards or good practice, I don't know what it will look like, something of that nature. And if it does, then that will come back to you, the regional committees, this time next year, and it will be your decision as to what, if anything, you decide to implement here. So that's the overall process. As to content, well, we've been guided by the informal consultations that we already held earlier this year, and 6 or so main areas have emerged as being worthy of further consideration. I've listed on the board, and I'll just very quickly go through them. I'm going to do this at a very high level, so you'll need to look at the documents if you want to get more detail, or you can ask me questions, but I'll just give you a quick flavor. So the first area is criteria. At the moment, most regions, including this one, have 6 or 7 fairly high-level criteria as to what you're looking for in a regional director. The question has been asked, do you want to put something more specific in there? For other senior appointments in WHO, we have minimum academic qualifications, we have minimum years of experience in certain areas of leadership and management. Do you want to have those more measurable factors which can be quantified put into the criteria? So that's the first area that's sort of up for grabs, as it were. The second area, and this will be particularly interesting, I think, for you in this region, because you are the only region out of the 6 that doesn't have a specific code of conduct for the regulation of the election process. All 5 other regions do have a code of conduct, and I've set out on the screen the areas that it covers. You do cover some of these areas in different documents, but you don't have a specific code of conduct governing in particular the electoral campaign and activities. And there is such a document for the other regions. One of the things that's being looked at is adding to that, to add things around disclosure of conflicts of interest, whether we should undertake due diligence reviews, including background and reference checks for candidates. Should we include a provision on sexual misconduct and other abusive conduct, as we do in most other recruitments? Should we strengthen the disclosure requirements for campaign activity? So there are a number of areas that are being looked at to strengthen the code of conduct. Obviously, if you were to go down this route, you would need to actually introduce a code of conduct. So that's one area that it would be interesting to hear your views on. Another big idea that's being knocked around is the idea of an evaluation group. And this is filling a gap in the current process regarding the assessment of qualifications. At the moment, we have a system where there are criteria for who can be a regional director. You have proposals made with the CVs and all the documents submitted, and then you, the member states, decide how you want to vote in the regions and in the executive board. What doesn't happen at an organized level is a sort of an objective assessment of the merits of the different candidates. It does happen in one region at the moment. Europe has an evaluation group that does this, and Africa has done this as well in the past. And this is one way that you could introduce an element of objective assessment to the selection of candidates. If you went down this route, you'd have a lot of questions you'd need to answer. I've put some of them on the board. Who would be in the group? What would its working methods be? What exactly would it do? But the general idea would be that you would have a group, presumably a subgroup of member states who don't have candidates involved in the election, who would review the submitted documents and provide an objective assessment on an advisory basis to member states. That doesn't mean that you would suddenly stop taking political interests into account when you're casting your votes. I'm sure that wouldn't be the case, but it would give you an extra piece of information on which to decide how to cast your votes. So that's the idea of an evaluation group. The next is an area I think you already do very well on. This is interaction with the candidates. I think you already have a live candidates forum. We've been introducing those in the last year on an ad hoc basis in those regions that don't have them. So I think in the last rounds of elections, all of them have held live candidates forums. The idea is to sort of formalize that process as part of the consultation. If people think if you think it's been useful. And there's also questions about whether interviews of candidates should take place, and if so, should they be in public. I think you are one of 2 regions that doesn't actually interview your candidates at the meeting where you elect your head of the organization, but most of the others do. One of the issues that's raised is if you have those interviews, should they be public for the sake of transparency? And then the last area, this is a very specific question that rose during the consultations, and it's, should somebody have the ability to reopen the call for candidates? If you find that the list of candidates is, for example, very short or not very diverse, should somebody have the option of saying we should re-advertise to get additional candidates for the list? If so, who? Would it be the regional committee? Would it be the evaluation group? And on what ground would that be something that would be contemplated? Now, I should say these are all just ideas that have been floated. They're not proposals as such. Certainly the Secretariat isn't backing any of them, and it's really for you to take these as food for thought, ideas to think about. And we'd really be very grateful to get your feedback on these ideas, but we'd also be interested to hear any other ideas. It's not a closed list. These were all the things that emerged out of the informal consultations. A few other ideas were raised but dropped, but there's still time if you have other ideas you'd like to add to raise them now. So I'm going to stop talking so that you can now give us your feedback, and I'd be very happy to answer any questions as far as I'm able. I'd also, as I say, refer you to the written document, which I think you'll find covers these issues in rather more detail than I've been able to in the last few minutes. Thank you very much.
Muchas gracias.
Thank you, Drs. Bernier and Mr. Walton, for your report. I now invite the Directing Council to take note of this report and provide any comments it deems pertinent. I open the floor to the plenary to begin the discussion.
Cedo la palabra a...
I call on Canada.
Thank you, Madam President. Canada thanks the Secretariat for this updated report. PAHO's ongoing collaboration and communication with WHO is of utmost importance, and we are encouraged to learn about important work happening at the global level for which our region's contributions are critical. This includes ongoing efforts to strengthen pandemic prevention, preparedness, and response. Regarding the review of the process for election of regional directors, we want to stress that we are proud of our region's process and appreciate that the WHO document underscores that the region retains autonomy over how we select our nominee. In light of this, we recommend that the WHO Executive Board carefully consider language like, quote, proposing measures to ensure minimum standards, as using ensure suggests the board believes it is in a position to override regional decisions on adopting any such measures. There are 2 proposals Canada would be open to considering in discussion with fellow member states, as they have potential to reinforce consistency, transparency, and fairness in our elections. These are elaborating on existing criteria for candidates to provide further guidance to member states in their assessments, and the development of a code of conduct that clearly outlines responsibilities of member states and candidates, measures related to the code outlining expectations for member states and candidates to disclose campaign activities, and clarifying regional parameters around campaign activities, including travel, to ensure a level playing field between candidates. Canada will continue to follow this discussion closely, particularly given PAHO's unique status. Thank you.
Muchas gracias.
Thank you very much, Canada. I now call on Panama. Thank you very much. We'd like to begin by thanking you for the document presented and the contributions made by the legal advisors about the process to select the regional representative to WHO. Basically, we have one question for the legal advisors. As Canada has said, the region has a specific process for selecting the candidates, and it would be difficult for us to accept to change the rules of the game when the member states by election have chosen our own director general. So I'd like to have a clarification on that point. Thank you. Thank you very much, Panama. I now call on Brazil. Thank you very much, Madam Chair. Brazil would like to thank you for the report. We'd like to congratulate the reporter for have more equitable financing of WHO in the region. The region of the Americas was the most unequal in the world and was severely affected by the pandemic and has not yet received the appropriate financing, which is much below the other regional offices. Fortunately, it seems that the appeals made by PAHO and the United States have been at least partially heard, because WHO made an allocation of $29 million more for the Americas region for 2024-2025, more than in the past biennium. We also like to thank the Secretariat for the efforts made with WHO to ensure that the next biennium reflects the vision of the member states of our region, in addition to contributing to the national and regional experiences of the Americas. Madam Chair, during the World Health Assembly, Brazil proposed the topic of digital marketing to follow up on breast milk and the marketing of replacements for breast milk. The WHO report of the digital marketing on milk replacement has become the main source of promotion for these products at the global level, and digital marketing has shown us the power of advertising and other forms of advertising for these kinds of products. In Brazil, we'd like to thank Bolivia, Colombia, Dominican Republic, El Salvador, Guatemala, Honduras, Jamaica, Mexico, Nicaragua, Peru, and Uruguay for the support extended to all countries in the region to join us in reaching agreement on a resolution on this topic at the next World Health Assembly, which will take place next year. Madam Chair, Brazil acknowledges the active role our office plays by facilitating coordination between member states and preparing the main negotiation processes at WHO for establishing a global response. The Intergovernmental Negotiating Body, the Pandemic Agreement, and the Working Group on RSI, for which the Pan American Health Organization has been very productive in sharing information and obtaining convergence and agreement by all of us, in spite of the differences of our countries. We were able to obtain more detailed report on what each country understands this means and reach specific agreement in our text. We believe that the first provisions agreed to in May at the amendments will contribute to the INB process, and we urge PAHO to continue playing this role to ensure that we are able to contribute in an effective and significant way to this. As to the introduction of ideas on how to select the regional directors, Brazil, as well as the colleague who preceded me, has complete confidence in the existing rules of the region and our ability to submit proposals that can improve, within, of course, the limits of our autonomy and our history of more than 120 years of experience in our organization. So thank you very much. Thank you, Brazil. I now call on the Bahamas.
Thank you, Madam President. The Bahamas extends its gratitude for the comprehensive report on strategic issues between PAHO and WHO, highlighting key challenges faced by both organizations in the Americas. We acknowledge the efforts to improve coordination and the value of regional meetings and information sessions, which have kept member states informed and prepared to actively participate in global negotiations. The Bahamas commends PAHO's leadership in pandemic preparedness and response. Through its role in the intergovernmental negotiating body and the working group on amendments to the international health regulations, PAHO has ensured that member states, including the Bahamas, are equipped with the knowledge and tools necessary for effective health emergency responses. PAHO's implementation of pandemic preparedness projects funded by the Pandemic Fund further underscores its commitment to strengthening health systems in the Americas. We also appreciate PAHO's key role in driving strategic planning and sustainable financing efforts. Through active coordination and engagement with member states, including dedicated sessions for Caribbean states, PAHO ensured that diverse perspectives influence the finalization of the General Program of Work 14, aligning this framework with PAHO's Strategic Plan 2026 through 2031. PAHO's focus on promoting equity, transparency, and fair resource allocation within WHO's investment rounds has been invaluable in addressing regional needs. The Bahamas welcomes the continued prioritization of country presence and expresses appreciation for WHO's approval of $20 million to enhance country offices in the Americas for 2024 to 2025, including the funding of 41 new positions that will enhance technical capacity. We advocate for member states to actively participate in the recruitment process to ensure that selections align with local priorities. The Bahamas notes the report. I thank you.
Muchas gracias, Bahamas.
Thank you, Bahamas. I now call on the United States of America.
Thank you, Madam Chair. Good afternoon, colleagues. The United States thanks the Secretariat for the report on the strategic collaborations between PAHO and WHO. We really value PAHO's initiative in working with member states to foster consensus on key issues, particularly concerning the working groups on amendments to the international health regulations and the ongoing intergovernmental negotiating body on the pandemic agreement. These efforts have been highly beneficial in facilitating dialogue and addressing concerns among delegations, and importantly, for identifying shared views we can advocate for as a region. We look forward to continued effective coordination and leadership from PAHO as INB discussions advance in their next phases. We also welcome PAHO's support to smaller delegations in particular. We're very fortunate to have a larger delegation, but I can tell you, having 3 a.m. INB sessions this week is pretty brutal. The bags under my eyes are evidence of this. But we also wanted to applaud PAHO for ensuring that regional perspectives are effectively incorporated into WHO's 14th General Program of Work and the WHO investment round discussions. All of these have been mentioned by other colleagues as well. We think both of these two initiatives we just mentioned are really crucial for member states. The United States encourages continuing the close collaboration between PAHO and WHO to ensure our region's priorities and perspectives are reflected in WHO discussions of strategic issues, and we recognize PAHO's leadership in this regard. Lastly, we appreciate the opportunity to share our feedback on the nomination and appointment of regional directors. And we know that in the interest of time, our full answers to the questions in the documents will be shared with the Secretariat in writing. And we'll look to you all to tell us if that's to our dear friend from WHO Legal, our friends from PAHO Legal, some combination. We'll let you tell us on that, please. I think in general for us, we believe each region should have flexibility in emphasizing the qualifications most relevant for their region. We do see merit in having common baseline criteria for all RD positions that leverages existing WHO criteria for similar level positions. And we view this as a means to foster consistency across WHO. We also support publicly broadcasting live candidates forums, as PAHO has done. We've advocated to other regions about how beneficial we think this is, and we were really pleased to see the other regions doing that in this latest round. While we support publicly broadcasting the candidate forum, we do not support broadcasting the interviews that take place during some of the regional committee meetings. We think those should remain private among the member states. And lastly, we see value in harmonized election-focused codes of conduct. And as was noted, we note that PAHO is the only region without one. That said, we do not support requiring the creation of oversight mechanisms or evaluation groups. And we appreciate that some regions do use these, and we welcome that, but we don't think it should be imposed on all regions as a requirement. We believe both of these approaches are costly, time-consuming, and unwieldy. And I will close there. Again, Mr. Chair, we'd also mention that if other delegations happen to be interested in the ideas that we're sharing with the Secretariat, we're happy to share with other member states as well. So please just let my delegation know. Thank you.
Muchas gracias.
Thank you very much, United States. And I now call on Mexico. Thank you very much, Madam Chair. Mexico would like to thank the Secretariat for the presentation of this report and takes note of the update of the information PAHO provides member states on topics of interest, on the relationship and link that exists between both organizations, and allows us to increase the participation of our region to strengthen World Health governance. In this regard, our delegation requests that in addition to the report, a strategic analysis be provided to for the coordination of the transformation processes that are taking place at the World Health Organization, because these will have an impact in the functioning and governance of the Pan American Health Organization, and therefore on the countries that are members of the Americas region. For example, that we are grateful for and the support provided by PAHO on the instrument on pandemics. The delegation of Mexico would like to have a vision on specific articles on supply chains, exchange of samples, and regulatory aspects. These topics, which are strategic, and are ones in which our region has worked very hard in the last few years, will be affected by the guidelines ordered by the agreement. We understand that such an ambitious program as this is difficult to give details, but it would be very valuable to have a diagnosis and a projection of the implications for the region of the Americas, as well as have provide the regional input PAHO can provide as a member state. It's not just an opinion of the Pan American Health Organization, because we understand that we are the regional office of WHO, but to provide information on the possible impact this would have on regional technical cooperation based on the adoption of the instrument. As to the 14th General Work Program of WHO 2025-2028, and the drafting of the program budget for WHO 2026-27, the section of the budget allocated to the region does acknowledge an increase of resources, and we appreciate that, but we still feel that the resources that should correspond to the Americas have not been allocated according to the methodology agreed on. So there is no equity compared to the budget of other regions. Likewise, we would like to urge that the resources from the contributions made to PAHO in the 2024 agreement should be executed according to national priorities, following the principles of transparency, efficiency, effectiveness, and accountability. The available financing should be taken into account when drafting the new strategic plan for the organization for the 2026-2031 period. It is important for member states to see to understand the contribution made by the region to the global effort for a better health. But also, given the nature of PAHO, we don't want to lose fact on emphasizing the priorities of the Americas region. it's important to note that programs without a budget are rhetorical ones. That's why we feel it's very important to have the guidance and vision of PAHO on both areas. Finally, we agree with those countries that have preceded us. In the case of the region of the Americas, given the dual nature of PAHO, it would be important for member states to analyze the legal implications of what is being proposed by the World Health Organization and make a decision which the region is the most adequate for it. Thank you. Thank you, Mexico. I now call on the speakers to respond to the comments made.
Gracias, señora presidenta. Si me permite, voy.
Thank you, Madam Chair. If you allow me, I will start with the topics pertaining to planning, financing, and the general issues of governance. I shall switch to English.
So first of all, thank to the member states who provided with your comments, your recommendations, but also your encouragement. We share the pain with you of being early morning with my team and others from across the organization, not just the enabling teams, but also the technical teams who are there every time we're having a strategic management or technical discussion. And we're there because we believe that it's important to invest that time as well. And our colleagues, I'm sure, who are here with us and those who are listening on live stream are paying attention to this. We constantly also coordinate with them and try to do our best, as it includes coordinating with 6 regions and different time zones. But we do make that case on your behalf as well. First, the commitment to continue coordinating with you. It is indeed a pleasure to coordinate with you or delegations, the focal points across the region, ensuring that every country or sub-region has the opportunity to contribute to these very important and topics that do affect, of course, and have implications, as you've highlighted, to all our countries, regardless of where we are, the size of country. I'd like to highlight on the general program of work. Indeed, we are looking at the lessons as well on that and how we can continue to build on the alignment. As we said, we contribute to our own experiences, but we also learn from the global process. And I will update later on as we present an update on the strategic plan and concretely what we are doing with that regard. With regards to the program budget, we continue to work with you. Equitable distribution continues to be a topic of interest, and we hear you, and I'm sure our colleagues will also update on the options and possibilities that are there as sustainable financing continues to be looked into. As you know, the financing has to do also with the flexibility of the funds. And if those funds are flexible, the region can continue, of course, to expect an increased allocation. Because we have said in this forum and in several briefings to our member states, it's not necessarily about the size of the budget is important, the space. It's more so the real funding that we can direct to countries. And a commitment here from our Director Jarvis is that the majority of the funds are channeled to the countries, committed to that country focus and making a difference at country level. The other point I think is important to highlight to you that this additional funds we got from it's a result of the increased contribution, in assessed contributions, sorry. The 20 million that is for core country capacity allowed us, as noted in the report, to fund 41 positions, of which 39 are new. All of them except for 2 are technical. And again, our prioritization again to focus on addressing technical capacity, enhancing technical capacity, along with the priorities that your member states have identified in the program budget. I'm pleased to share with you here that thanks to the collaborative efforts from our colleagues in management and the country offices and our technical colleagues, all 39 new positions are about to be completed. We are the most advanced, I can say, region in terms of filling those positions, and we will soon have all of them. We will ensure that those resources continue to be used with the efficiency, transparency, and accountability they merit. They are valuable resources. Flexible funds, as the director mentioned yesterday, our most valuable resources, and when we get them, we make sure we invest them well, and we remain accountable for them. We take note of the suggestions, just to highlight here that in addition to on transformation, we continue to participate on the task force. There is a WHO task force on transformation. We participate as part of that group, and we continue to collaborate there. One of the recent discussions we have had is on our PAHO Forward initiative. Under the Director Jarva's leadership, we have this PAHO Forward initiative, which we are also sharing our experience and best practices. And to note again, on the report, in the annexes, we try to capture as much as we can, but in the different agenda items, we do cover what is relevant for the region and what has implications. But we take note and we'll see what is feasible without overcomplicating the report that we have for you. With that, I'll say our team here, Secretariat, remains committed to continue working with you, to coordinating and ensuring that your voice is heard and that we continue to contribute to WHO's agenda. Thank you.
Thank you, Member States, for all the comments. Perhaps a little bit of clarification from the PAHO side. So on what already exists in the region, right? So in relation to the criteria for, sorry, I'm talking about the election of regional directors. And there is this double legal nature of PAHO, and I'll address the question from Panama as well. So there are very clear criteria for the selection of candidates, including technical aspects, leadership, management, and in relation to rules, there are rules from 2006 for the election of the director, and I understand this was the first region to do so. These rules have aspects on code of conduct, including the PAHO code of conduct will continue to apply to any staff member that applies to or becomes a candidate for the position of director. And in the past, I mentioned 3 PAHO directors that they were former staff members. So on the code of conduct as well, the rules require all candidates, internal and external, to sign, to make declarations of conflict of interest. So this aspect is also already covered in our current rules for the election of the director. Now, for the comment made by Canada, the current rules do not require any disclosure for campaign activities. In relation to interactions with candidates, you all know the PAHO has, I think, a very active live candidates forum and also opportunity for member states to interview all candidates. Now, in relation to the points made by Panama, Mexico, and Brazil, paso ahora español.
I will now switch to Spanish. Mainly for this region, it does apply to all. There's no doubt that it affects the autonomy of the region. Anything that's decided by WHO is a recommendation to be reviewed and then decided upon by PAHO. There is nothing that will be imposed on the region in terms of changes to the election of directors. And as to Panama's specific question about the rules of the game, nothing changes in terms of the current director. If this would apply to a future election, the next election, but in terms of the mandate of the current director, it makes no changes whatsoever.
The aspect of the comments from the U.S., perhaps Derek, you can confirm, but I think extending into both is always a good option. If you have any written comments, we welcome that very much. And thank you you already highlighted the Live Candidates Forum and the aspects of broadcasting, what it can be broadcasted or not. I think I'll stop here and pass the floor to Derek. Thank you.
Thank you very much, and thank you very much for that feedback, which is extremely helpful for us. I very much appreciate it. I mean, as a Secretariat, I'm not supposed to express an opinion, but if you would allow me just to express the opinion that I very much agree that you do already have a process in this region that you can be proud of. I think it's certainly not the case that this exercise is being put in place because there are deficiencies in the existing process. Certainly in this region, that's not the case. What we are as an organization is one that always seeks to learn and improve. So even after the last competitive Director General election, a formal evaluation of the process was carried out to see what improvements might be made. The current exercise is really much lighter than that. It's simply an opportunity for all 6 regions to look at what you have in place, to see whether any improvements can be made, but more importantly, to share that good practice. And some of the things that I've been hearing today about you already having the declaration of interest provision, but none of the other regions have, and things like that, a good practice that we can share. And one of the things that I'm hoping might come out of this, that there could be some exchange of good practice at the global level, that then the regions can decide what they want to pick up and what they want to leave. So I would again underline what has been said, that this is very much a conversation to look at ideas, but it's all for you to decide as the region. At the end of the day, this time next year, you have complete autonomy as to whether to take any or nothing on board. And I would very much agree to the answer to the US's question. Why don't you send it to both of us? And it's easier. If you send it to just one of us, we will share it. But if you or anyone else would like to send any specific feedback for my attention, please send it to legal@who.int. Thank you very much.
Muchas gracias.
Thank you very much, Mr. Massa, Dr. Bernier, and Mr. Walton for responding to the comment. Distinguished Director, do you have any comments?
Yes, Madam President. First, I want to thank our colleagues from WHO Geneva that came to our regional committee meeting to present these very important topics. That's always a very good session to discuss how we can improve the relationship between PAHO and WHO due to our double condition. At the same time, the regional office of WHO for the Americas, and we are very proud and very happy to be part of WHO, but also at the same time to have our condition as an independent organization that belongs to the Organization of the American System, like our rich brother, the Inter-American Development Bank, and other agencies. First, I want to recognize that we are making progress to get a more equitable distribution of the budget. I think that is important. I want to thank our member states, because of course, that is important to recognize that we have a different situation in our region. Our countries know that we have a very strong country presence. Our country office, they are not the diplomatic representation of PAHO. We have a technical team there that works on a daily basis with the Ministry of Health advancing the agenda. We have technical capacity here to provide technical cooperation. I told Tedros there when we were discussing once, and Tedros said, no, but you have a double budget. And I said, but Tedros, my dear friend and brother, let me tell you, I save a lot of money to Geneva, because in other regions, when they need technical cooperation on a specific topic, immunization, maternal health, elimination of malaria, non-communicable diseases, they call Geneva. We don't call Geneva. We only call Geneva in, I don't know, it's a very exceptional issue. Of course, that we welcome when our colleagues of Geneva want to come to our region, to go to a country, we are always happy to go together, demonstrating that we are the same organization. But to keep this capacity is very important for PAHO. And personally, I think that this could be a model to move, to identify better what are the roles and responsibilities of the 3 levels of the organization. So I'm very happy, and I recognize Tedros' leadership to strengthen the core capacity presence of WHO, because this will make a difference, to have country offices that that can deliver real technical cooperation, and also how we can start strengthening the regional office to be more better equipped to provide technical cooperation and to have Geneva with I think that the noble and the standards, the guidance, the regulations that only a global organization can provide. So I think, of course, this is not one thing that you can move from one year to the other year, but if you can have this as the direction that we will move, it's important. So I do believe that what we have here in the region could serve an example, an inspiration in this process of transforming WHO to have a WHO more efficient, a WHO that has a stronger presence at the country level. So first I want to thank our colleagues in Geneva. We are having a very productive conversation. This reflects in the increase that we are receiving in the proposal. I also want to thank our member states that are very strong advocates for a more equitable distribution. It is also important that the commitment that all member states made to increase the 20%, and I think that it was very important. We had a negotiation with the headquarters and all the regions. I am very happy that all the positions are new positions. We are not using 1 cent to replace the source of payment of current staff. All of them are new positions, and all of them are technical positions, as Ronnie Maza said, with the exception of 2. One is the deputy PWR in Venezuela, because due to the size of our country office in Venezuela, related to the complex situation that you have in Venezuela, we have a very strong and a large office there to provide technical cooperation, working with the Ministry of Health, working with the local governments, working with civil society and NGOs. And we are, as you know, operating in Venezuela in a emergency response mode. So for this reason, we established the deputy PWR representative position in Venezuela, and the other one is a logistic operative that we are based in Central America, also to support the emergency response. All the others are related to preparedness and response, elimination of communicable diseases, non-communicable disease and mental health, digital transformation that I mentioned this morning, and others. So we established a task force, because I think that when member states approve something, we need to expedite the process. So we established a task force, and we have already finalized all the selection process for the 49 positions. Some of the advisors that were selected are already arriving in the countries. All of them will arrive in October and some in November. So until the end of the year, the countries in the region, starting with the most vulnerable countries that we have in our region, are receiving advisors that will really strengthen our technical cooperation capacity. So I think that I really want to thank our member states for approving the increase, the 20% increase, and I think that to tell you that we are providing the best possible use for these resources, and the new resources will follow the same approach. About the election of about the INB, we had a very good informative session. Again, we think that was very important to have those 4 face-to-face meetings, and despite the fact that the face-to-face meeting inviting Minister of Health, Minister of Foreign Affairs, mission in Geneva and mission in Washington cost a lot of money for us, but I think that's important, and we are already trying to identify when is the best moment to have the next one. So maybe when we have a draft that can be discussed, because many countries, they don't have a strong mission in Geneva. Sometimes they don't receive the information, they don't feel that they are really participating in the process. And this is so important, the things that we are discussing, the change in the international health regulation, the new instrument / treaty / accord that you are discussing, I think that are so important to provide a better preparation for the world, that every country needs to feel comfortable that they are receiving all the information that they need to make their sovereign decisions about these topics. And it was, as a very positive side effect, we had already 18, I think, regional statements, and we haven't had the regional statements since 2018 in the Americas. So I think that I'm very happy to see the Americas coming together again. Of course, with some disagreements on some topics, this is part of the process, but building consensus on very relevant topics. So I think that I really congratulate you, our member states, for this cooperation, for this solidarity, for trying to overcome differences sometimes, but coming together. I think that this will be very important. Finally, about the election of the regional director, I think that I cannot say anything because I am, I'm joking. I think that this is important. The discussion was open. And it's good to have what are the best practices that you have in every region, and to improve the processes, as our legal counsel has already mentioned. We have in the Americas the forum, and I think that's important. The forum is during after the executive committee meeting in the year that we have the sanitary conference, and it's broadcasted for everyone that wants to watch. I think that this is important because so the candidates can explain what they think, what are their proposals. The member states make questions, so it's like an interview, and everybody is listening to what the candidates are saying. So I think that these and other experiences that may be in other regions that it could be considered, of course, for each one of the regions in order to have to improve. The final decision will be always made by member states, but I think that if we can improve the processes to provide more transparency, to provide, I think, that better understanding about the roles, about all the things that are required to be a regional director. I think that, of course, this is a very important discussion, and the many member states here presented some very good contributions. Muchas gracias, Señora Presidenta.
Thank you very much, Madam President. Thank you, Dr. Barbosa. I would like to inform the Council that the discussions will be noted in the final report.
Continuamos.
Let us move on to agenda item 8.3, regional consultation on the program budget of the World Health Organization 2026-2027. I bring to the attention of Council document CD 61/INF/3, and I invite Mr. Imre Hollow, Director of the Department of Planning, Resource Coordination, and Performance Monitoring of the World Health Organization, to please come to the head table to introduce this agenda item.
Thank you very much, Madam Chair. Dear Regional Director, dear guests, my name is Imre Hollo, and I'm from Geneva. I always say I'm the Roni of Geneva, so I'm in charge of budget and planning in headquarters. And I would like to present you the draft proposed program budget 26-27. Maybe I would start with what's new with the program budget. So, as you know, that this is the first time, or this is the first program budget that is entirely based on the general program of work, the 14th general program of work, as you had heard before. So this means that the results framework and is basically the core structure of the program budget that was approved and accepted by the member states earlier this year. When we built the draft that you have in front of you, we also looked at lessons learned from GPW 13. We looked at recommendations from independent evaluations. We tried to focus on areas of improvement, and we wanted to make sure that the integrity and results chain of results-based management are kept. We also improved the transparency of the program budget, or we hope that we have done that. And this is continuing to be based on prioritization by member states. And you will see that the results of the first round of the prioritization. There's a very strong alignment, obviously, with the strategic objectives of GPW 14. We wanted to improve the alignment between the priorities and the budget. And what is very important, and this is something what we have learned from this region, is the importance of the measurement of results. And then I will talk about that a little bit later, that we are also trying to introduce something that we learned here, which is the joint assessment that you have been now so familiar with. We're trying to replicate that and start it globally. It's not going to be easy. We're starting slow, but that's something that is one of the new elements of the program budget, and that is actually emanating from this region. We also would like to improve trust and confidence, and we understand that the program budget is also a very important tool in that. We would like to improve transparency in resource allocation, and I'm glad that there was already a discussion about resource allocation, and I know this is always an evergreen subject, the resource allocation for the AMRO part of WHO and how it is done. And then, as I said, we would like to improve monitoring and reporting. And lastly, this budget is truly based on a very wide range of consultative process. For example, all the outputs and the outcomes have been consulted with the heads of country offices and the staff of the country offices, and we really built on information and feedback what we received from that. Just to show, and again, this is not new, but we want to make sure that we reinforce that we are building on the results framework of the GPW 14, where there are elements which are clearly within the manageable interest of the Secretariat, so of the staff of WHO, and then when it comes to outcomes and impact, it's clearly something that we need to work together with you, because we cannot reach true change without cooperation with the member states, and it's actually member states who actually enact the change at the end of the day. There's a new results framework. You're probably familiar with that. For GPW 14. And here maybe the most important lesson learned is that if you remember in GPW 13, we moved away from a very disease-specific results that were in GPW 12. So in GPW 12, we had TB, we had HIV, we had mental health, and then they were translated into outputs, and they were translated into budget centers and a director in headquarters, etc., which was easy to follow, but created a very siloed mentality. And then we moved to GPW 13, where we had these integrated outputs and outcomes, which, and the feedback was that it's good, but we can't find ourselves, and it's very difficult to follow. So maybe the pendulum went too much to the other direction. So with the GPW 14, we try to keep the integrated approach of GPW 13, but provide a little bit more granularity through the outputs so that go back towards a little bit more, that it's a little bit easier to explain, but maintaining the integrated approach. There's an annex of the program budget, which is work in progress, and which will be hopefully completely finalized by the next version of the program budget, which is in January at the Executive Board, where we will provide you more details about what it is that the Secretariat is doing, contributing to the achievement of the results, how we're going to measure the work of the Secretariat, which means that the outputs, the output strategies, and the indicators with baselines and targets will be presented. And I just want to say that we wanted to do that for GPW 13 as well, but the first time we came out with the output indicators was only the 24-25 program budget. So there was quite a large number of years or a period when we could not do that. Oops, I just need to go back. So I talked about how important it is that the program budget is based on a bottom-up prioritization. And we have done that now in 5 regions. And we've done it based on outcomes. So what are the outcomes where you member states would like to work together with the Secretariat? It's very important that these priorities don't necessarily have to reflect the priorities of the member state. These are priorities where you feel or where you would like to ask for help or joint work with WHO. So there could be other important priorities in your respective countries, but then you think maybe another agency or locally you have the skill set to work on it, so you don't need technical assistance from WHO. And it's quite interesting that their 5 outcomes came out quite strongly across the globe through this prioritization. Priority risk factors for NCDs and communicable diseases, primary health care approach for universal health coverage, equity and access to quality services improved for NCDs, mental health conditions and communicable diseases, preparedness, readiness, and resilience for health emergencies, and healthcare, health workforce. So these, if you look at the numbers, and I know it's difficult to see, but maybe when you will get a chance to see the presentation, you will see that these 5 areas are coming out quite strongly. We have data on our digital platform where you can go region by region, and then you can see also country by country. So there's a lot of additional information where you can dig in, drill in, and see the results of the prioritization. And this is just to say that we have not done this prioritization exercise in this region yet. And the reason is that we have made a commitment that you only do prioritization once, and you don't have to do prioritization once for WHO and once for PAHO. But of course, so there's a single prioritization exercise, but there's a slightly different timeline for for your prioritization. But we have commitment from the region and our colleagues that it will be done in November, and the full prioritization results will be there when we're from the Pan American region as well, when we're presenting the program budget for the next version, January, at the Executive Board. Now let me turn to the budget figures. So maybe the first headline is that we are proposing a 10 or 11% increase of the budget for the base segment. This is completely in line with the financial envelope that we presented as part of the GPW 14, and which is also the basis of the 7.1 billion ask of the investment round. So in a way, there's nothing new to that. And I just would like to give you a little bit of more detail on where this increase is going to. Just come to that. I'm sorry, here. So sorry for clicking. Yeah. So the 500 million, almost 400 of the 500 million that we're proposing is going to go to country strengthening, and this is very much the process that Ronnie has explained before, and this is where the majority also of the increased assessed contribution is going to. And some element, which is 75 million of the 550, is going into strengthening data innovation and science, and then 100 million, which is going to go to further strengthening accountability. And this is also where additional investments in prevention for sexual abuse is going, and for all the investigative work and the HR and all the relevant elements are there. When you look at the budget, there's we're presenting basically two options, and that's not based on the base budget. That's based on the emergency and operations segment. You can see that the two options present a $1 billion for the emergency and operations segment, or a $2.8 billion for the emergency operations segments. And if you remember, the emergency and operations segment's budget is not really a budget that is approved. It's more a planning figure. It's not, it doesn't limit our operations in the emergency segment, because this segment is primarily driven by the actual emergencies. The problem is that in the past couple of years, and this is what it shows, is that we have worked with that 1 billion planning figure, but the actual amounts that we had spent on emergencies were much larger, between 2.5 and 2.3 billion per biennium, which meant that when we were reporting on achievements, on how we were financed, on how the budget is being implemented, it really distorted this reporting, because it looked like, because of this artificial over-financing or over-implementation, that we're over-financed or over-implemented. But it didn't really mean that, because actually that 1 billion amount was only a sort of a planning figure. The problem is that I think it's a little bit difficult to explain. And then if we go back then to the overall budget, it looks like WHO is increasing the budget from 7 or 6.8 billion to 9.5 billion. But again, this is much more of an accounting element, and I think it would help if we could plan with a much more realistic amount for the emergencies than what this slightly artificial and it's seemingly low 1 billion. But this is one element where we ask for your guidance how to do that, because there's one is the perception and the symbolic impact. The other one is practicality and reporting. But it has in terms of budget and budget implementation and everyday work, it has very little concrete consequences. Okay, going into how the budget is going to be distributed across the regions, and of course, how much is going to go to the Americas. So you will see that from the 11% average increase, we're proposing an 18% increase, which is close to or $55 or $56 million increase to the budget of the Americas. And in the percentage terms, you can also see that this is the region that would benefit from the biggest increase of the budget. And again, going back to the discussions about what Ronnie has presented, the majority of that increase will go to strengthening country offices and some of these functions that technical functions that are so needed in the technical areas in these country offices. Monitoring and performance assessment, I just want to say that, and I already mentioned that we are proposing to roll out joint evaluation and joint assessment together with member states. There's a big question of data availability and how to bring about something that works in one region to extrapolate that to 194 countries. So probably this is going to be a gradual process. This biennium we have started already with some volunteers, and there was volunteering from the African region and the southeastern Mediterranean region. And the initial reactions were very positive. But as you know it yourself, it requires commitment, it requires additional resources, it requires efforts. So it's not something that can be just done overnight, but we are planning to do that. We also understood, and I think maybe that's one of the biggest lessons learned, is that indicators matter, and they have to be in the center of our reporting. And for that to happen, we have to have strong indicators. So we have started working on that, and I just would like to give you a little a glimpse that we are really looking at whether these indicators measure the WHO's Secretariat work in countries. Is there a direct linkage between the output indicators and the outcome? Are they measurable? And do we have metadata to have baselines and targets? And currently we have, using these criteria, we have reduced the potential 655 indicators to 76 indicators, and now we're turning to the technical colleagues before we're finalizing them for the program budget. And lastly, but not least importantly, I would like to talk about the financing, and that's quite important because, as you will see, that the program budget 26-27 is based on the assumption that we're going ahead with the decision of the 75th World Health Assembly about gradually increasing WHO's contribution, SS contributions. We understand that the decision on the SS contribution needs to be done every time we have a decision on the program budget. So the ultimate decision on the next AC increase falls in May at the World Health Assembly. What we have done is that we looked at the World Health Assembly resolution 2 years ago, and we looked at the possibilities how to arrive to how to implement that decision with the least financial burden for the countries for the next round. And if you remember, that decision leaves the question open whether we do it by 28-29 or 30-31. So here we said, let's assume we all want to do it by 30-31, so taking the longer horizon. And then we try to look at what is the least amount of percentage increase that we can do so that we can realistically finish this job by the end of the decade. And we felt that the 20% was the smallest amount of increase at this point in time to keep that roadmap realistic. So that would mean, and this is what's presented in the program budget that you have in front of you, that there would be a 20% increase of the SS contribution in 26-27, agreed at the World Health Assembly in 25, and that would mean a 229.6 million increase that would basically bring the assessed contribution portion of the base budget to 32%. So lastly, just some questions for you to guide the discussion. Are member states in agreement with the draft budget figures presented in the program budget? Which of the scenarios for the emergency operation and appeals should be considered as we move forward? And of course, how would you like to take the SS contribution discussion forward as we go towards the next World Health Assembly? Thank you very much.
Muchas gracias, señor Holo.
Thank you very much, Mr. Holo. I now invite the Directing Council to take note of this report and provide any comments it deems pertinent. I open the floor to the plenary to begin the discussion.
Bueno, voy a dar un anuncio.
Let me make an announcement. As to the length of the interventions made by delegations, I'd like to remind you
Bueno, vamos a irnos ahora a un receso.
we are now going to have a 15-minute break for coffee, and then we will come back right on time within 15 minutes, and we'll stay here until 19 o'clock.
So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal. And I think all of these accomplishments were done as teams. And I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's rights to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
En nuestra región, donde las distancias y la dificultad para el acceso a los servicios de salud se han transformado en una problemática frecuente, la telesalud se presenta como una solución innovadora y accesible. La telesalud combina la tecnología con los servicios de salud para llevar la atención a quien más lo necesita, sin importar su ubicación. Desde consultas virtuales hasta seguimiento de patologías de manera remota, estas herramientas están transformando el acceso a la salud. La Organización Panamericana de la Salud, OPS, está apoyando este cambio a través de su propuesta de telesalud. La OPS ofrece una plataforma todo en uno para el registro clínico electrónico y la realización de videoconsultas, que está disponible como bien público digital. Además, la OPS proporciona recursos educativos mediante estrategias de simulación que capacitan a los profesionales, permitiéndoles brindar atención de calidad. Esto incluye un telekit, que consiste en dispositivos médicos seleccionados para el seguimiento de patologías crónicas a distancia y una caja de herramientas con recursos para implementar programas de telesalud.
Súper buena, porque no se demoran en llamarla. Entonces la hora se la dan por el mismo teléfono. Entonces no es un tema que uno tenga que venir para acá como lo hacía uno antes, que levantarse temprano. Lo encuentro súper bueno. Me manejo mucho en este internet, así que le dije a mi hija que me enseñara cómo era el tema y es súper fácil.
Más cómodo para uno, no estar saliendo de la casa, lo puede hacer a cualquier hora, yo que trabajo todo el día.
La telemedicina acerca a los profesionales con sus pacientes, cuidándolos en tiempo real, mejorando el manejo de su salud y acercándoles cuidados de calidad.
Minha formação acadêmica está na área da telesaúde. Minha profissão é na área da telesaúde. Isso aí, para mim, é como se fosse realizar um sonho que está acontecendo.
En conclusión, la telesalud está dando acceso a muchos pacientes. Con la OPS apoyando estas implementaciones, se están reduciendo brechas, mejorando la calidad de vida y proporcionando a cada persona la atención que merece. Es hora de sumarse.
Oi, eu sou a Rafaela e eu ouvi dizer que o escritório da OPAS no Brasil está fazendo um monte de coisas legais para cuidar do meio ambiente e eu vim aqui ver de perto.
Oi, eu sou Matias. Será que a OPAS é verde mesmo? Oi, sou Liz, quero trabalhar aqui no futuro.
Oi, bem-vindos à OPAS, crianças!
Nós ainda temos containers maiores que também podem ser usados para papel, para papelão, ou seja, tudo aqui pode ser reciclado.
Tá vendo essas bicicletas aqui? Ó, isso aqui a gente isso para todo mundo.
Aqui na OPAS a gente não usa nada descartável, só copos e garrafas reutilizáveis. E olha só que legal, nosso mexedor é de bambu.
Nós também acabamos de instalar uns painéis para captar energia solar.
A OPS também tem um sistema de irrigação e só usa o necessário.
Oi, Rafa, para finalizar, vou mostrar.
So AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary health care system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child is a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So.
Personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the participants involved as much as possible. So it's not like just giving, but they are giving, receiving,
Yes.
Collaboration, yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal. And I think all of these accomplishments were done as teams. And I really congratulate the primary health care, the public health system.
This achievement is a crucial step in guaranteeing children's rights to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
En nuestra región, donde las distancias y la dificultad para el acceso a los servicios de salud se han transformado en una problemática frecuente, la telesalud se presenta como una solución innovadora y accesible. La telesalud combina la tecnología con los servicios de salud para llevar la atención a quien más lo necesita, sin importar su ubicación. Desde consultas virtuales hasta seguimiento de patologías de manera remota, estas herramientas están transformando el acceso a la salud. La Organización Panamericana de la Salud, OPS, está apoyando este cambio a través de su propuesta de telesalud. La OPS ofrece una plataforma todo en uno para el registro clínico electrónico y la realización de videoconsultas, que está disponible como bien público digital. Además, la OPS proporciona recursos educativos mediante estrategias de simulación que capacitan a los profesionales, permitiéndoles brindar atención de calidad. Esto incluye un telekit, que consiste en dispositivos médicos seleccionados para el seguimiento de patologías crónicas a distancia y una caja de herramientas con recursos para implementar programas de telesalud.
Súper buena, porque no se demoran en llamarla. Entonces la hora se la dan por el mismo teléfono. Entonces no es un tema que uno tenga que venir para acá como lo hacía uno antes, que levantarse temprano. Lo encuentro súper bueno. Pues me manejo mucho en esto internet, así que le dije a mi hija que me enseñara cómo era el tema y es súper fácil.
Más cómodo para uno, no estar saliendo de la casa, lo puede hacer a cualquier hora, yo que trabajo todo el día.
La telemedicina acerca a los profesionales con sus pacientes, cuidándolos en tiempo real, mejorando el manejo de su salud e acercándoles cuidados de calidad.
Minha formação acadêmica está na área da telesaúde. Minha profissão é na área da telesaúde. Isso aí, para mim, é como se fosse realizar um sonho que está acontecendo.
En conclusión, la telesalud está dando acceso a muchos pacientes. Con la OPS apoyando estas implementaciones, se están reduciendo brechas, mejorando la calidad de vida y proporcionando a cada persona la atención que merece. Es hora de sumarse.
Oi, eu sou a Rafaela e eu ouvi dizer que o escritório da OPAS no Brasil está fazendo um monte de coisas legais para cuidar do meio ambiente e eu vim aqui ver de perto.
Oi, eu sou Matias. Será que a OPAS é verde mesmo? Oi, sou Liz, quero trabalhar aqui no futuro. Oi, bem-vindos à OPAS, crianças!
Nós ainda temos containers maiores que também podem ser usados para papel, para papelão, ou seja, tudo aqui pode ser reciclado.
Tá vendo essas bicicletas aqui? Ó, isso aqui a gente fez para os colegas nossos aqui da OPAS que quiser pedalar, elas ficam aqui disponíveis para todo mundo.
Aqui na OPAS a gente não usa nada descartável, só copos e garrafas reutilizáveis. E olha só que legal, nosso mexedor é de bambu.
Nós também acabamos de instalar uns painéis para captar energia solar.
A OPAS também tem um sistema de irrigação e só uso necessário.
Oi, Rafa, para finalizar, vou mostrar para vocês os 120 ipês amarelos que nós plantamos e que hoje estão pequenininhas, mas no futuro vão ficar grandes igual aquela lá atrás.
Nós estamos cuidando do planeta também aqui. Estamos cuidando para vocês.
Nosotros como Oficina de País en Nicaragua nos encaminamos a una oficina verde tomando en consideración el consumo de papel para nuestras impresoras. Tenemos una estadística que desde el 2019 fue la última vez que se compraron resmas de papel en una cantidad de 180 resmas. En el 2024 tenemos un saldo de 136 resmas. Eso indica de que solamente se han utilizado 44 resmas en 5 años, a razón de un promedio de 8.8 resmas por año en consumo. Esto también implica, si hay una reducción del consumo de papel, hay una reducción también de tóner para nuestras impresoras. La representación en Nicaragua se unió a la modalidad de trabajo en casa, lo que permitió una reducción de consumo de papelería y tóner en esta oficina. Como organización debemos de ser parte activa de la ecologización de nuestras instalaciones, adoptando políticas ambientalmente sostenibles con prácticas modernas de ahorro de energía, reducción de residuos y reciclaje.
Desde el equipo de OPS en Colombia estamos comprometidos con la sostenibilidad. La sostenibilidad para proteger el medio ambiente y sobre todo para cuidar de la salud de cada uno y cada una de nosotros, los habitantes en este hermoso planeta.
Desde el 2023, la representación en Colombia aplica dentro de la evaluación de eventos competitivos criterios de sostenibilidad.
Solicitamos a nuestros proveedores el uso de empaques biodegradables o de más de un uso, la alimentación saludable y el manejo de residuos al final de los eventos.
Promovemos desde la planificación del evento el uso de la tecnología en vez de la impresión de material. Esto con el fin de ayudar al medio ambiente y a la optimización de los recursos de la organización.
Hemos tenido muy presente la sostenibilidad, no solamente en términos de lo que ha sido toda la construcción para nuestras nuevas oficinas, sino también en cada una de nuestras actividades, pensando en cuáles son los mejores materiales, el poder reducir el uso del papel y, por supuesto, velando por esa salud de cada una y cada uno de los miembros del equipo del OPS en Colombia.
Los interruptores inteligentes nos ayudan a un ahorro más eficiente de la energía. Asimismo, contamos con UPS. Esto nos ayuda a hacer un ahorro entre el 20 y el 30% de nuestro consumo de todos los equipos que tenemos en la oficina.
El compromiso con la sostenibilidad es una tarea de todos. Es por eso que
if the delegate can take their seat so we can start the last session of the day, last meeting of the day. We have many items still to go through, so we will appreciate if we can start.
Please turn off the video.
Anissa, pour nous arriver à tout le monde même chance, nous travaillons avec un pile l'hôpital. Pour nous arriver, faire promotion à l'école maternelle et soutenir maman qui a bay tété seulement pendant 6 premiers mois de la vie de Timon. Comme ça, nous gagnons l'hôpital Tour du Nord qui déjà passé 2 évaluations internes et qu'on y a capté une évaluation externe dans début mois de septembre pour nous arriver certifié comme hôpital ami des bébés. Ça veut dire un hôpital qui est ami des bébés, côté tout personnel là, depuis le directeur pour arriver joindre sécurité dans la barrière, tout le monde met ensemble pour faire toute femme qui est enceinte, qui vient accoucher, connaît que c'était seulement pour bailler Timouna pendant 6 premiers mois la ville.
L'initiative Hôpitaux Amis des bébés garantissent que les maternités dispensent des informations et du soutien continu aux mères en respectant aussi les besoins et les rythmes naturels des nouveau-nés.
Ensemble, ces actions contribuent à améliorer la santé et le bien-être des nourrissons en Haïti, offrant à chaque enfant un meilleur départ dans la vie grâce à l'allaitement maternel et contribuent à la réalisation des objectifs de développement durable.
Hoy visitamos esta sala de vacunas Padre Monchi, aquí en Foz de Iguazú, el equipo de evaluación externa, y hemos evaluado y analizado y conversado con los colegas y trabajadores de la salud del sistema del SUS.
La evaluación consiste de varias fases, la primera de las cuales es parte del país, en el cual utiliza un instrumento de autoevaluación, y posteriormente un equipo de expertos viaja al país, visita, conoce la realidad en territorio y de esa forma les permite identificar potenciales oportunidades de mejora, recomendaciones y también fortalezas que deben ser sostenidas a lo largo del tiempo y eventualmente compartidas con otros países de la región para fortalecer las capacidades no solo a nivel nacional, sino a nivel regional.
A avaliação externa voluntária ela vem num momento muito importante para o Brasil. É um momento que o Programa Nacional de Imunizações ele passa por mudanças e reajuste, ele está tendo uma reorganização, uma reestruturação.
Lo importante de las evaluaciones es que son un mecanismo que permite al país que la solicita poder tener una idea clara de cuál es su situación actual, no solo desde su propia autoevaluación que el país la hace, sino desde la visión de un evaluador externo, lo cual no solo les permite corregir aquellas situaciones en las cuales se pueden mejorar o confirmar que el camino es el correcto, que la situación está bien llevada adelante, de manera que es un ejercicio en el cual el país tiene todo para ganar.
We saw here a lot of aha moments. People, they have not seen like that with their own eyes. And so bringing these external perspectives and these opportunities for peer learning, it's great because they can actually see things with other eyes, bring fresh perspectives, and see what are the gaps that they have not thought through, and finally address those because that will put the programs in a much better position in the future.
O Programa de Imunizações ele tem um grande desafio que é o sistema de informação. Tem um sistema de informação nominal com informações importantes do indivíduo, como também garantir os estoques e garantir que a vacina que está prevista no calendário nacional de vacinação, ele chegue até a população, seja a população mais distante, como também reorganizar a estrutura interna do programa, fazer com que toda a equipe técnica consiga trabalhar de uma forma efetiva, que essa equipe consiga produzir adequadamente e propor estratégias de vacinação para o país de uma maneira efetiva.
I'm very impressed with how the Ministry of Health has adapted to low coverage after COVID-19 and the initiatives to improve routine immunization coverage as well as to restore vaccine confidence in the population.
Brazil is a very large and diverse country, and they've made tremendous progress. And one of the main recommendations is really strengthening laboratory and epidemiologic surveillance in support of the disease elimination goals. I think there's a lot of information systems that are really fantastic, but improving the linkages between those.
Bueno, muy buenas tardes.
Very well. Good afternoon again. We are now on 8.3, Regional Consultation for the Program Budget to 2026-2027 of the World Health Organization. Here, once again, I open the floor. So please let us know if you care to speak. I recognize the United States of America.
Hello, just first to confirm, we are on 8.3 still, is that correct? Just because the display up there shows 8.1. Just want to make sure that talking to Emory is the right. Yeah, okay, thank you.
Okay, estamos, sí.
Yes, that is correct. We are on 8.3.
So, thank you so much for this overall proposal and the opportunity to provide initial feedback on the WHO budget. The United States supports, in the questions provided, supports using scenario 2 for estimating the budget for emergency operations and appeals. And this should help close the gap between the budget estimate and the money actually received. So I feel that's an appropriate position. As we have stated in the past, The United States strongly supports an efficient, agile, accountable, and sustainable WHO that is able to prevent, detect, and respond to future pandemics. That is why we and other member states jointly supported the WHA 75 decision on sustainable financing. In the interest of ensuring the sustainability of financing for WHO, we have two main points of feedback on the overall program budget proposal. First, one of the main goals of that WHA 75 decision was to improve the percentage of flexible funding in the base budget. In proposing a $562 million increase to the base budget for 2026 and 2027, we are increasing the total pool of money needed, and thus potentially limiting the capacity of flexible funds to improve the key performance measures for sustainable financing. To ensure continued progress in greening the heat map and making moving forward on sustainable financing, the United States proposes pursuing a smaller total budget size. And to do that, we would propose reducing the money allocated for country strengthening. We all agree that country strengthening is a priority, and reducing the overall base budget increase like this would allow more flexible funds to go to those underfunded portions of the budget that already exist. And since most of these red and orange areas of the heat map are at the country level, taking this approach would still increase resources for those countries and at the country level. As a second point, we must all ensure that member states ourselves can sustainably finance any increase in assessed contributions. We recall that when discussing the 20% increase in the 2024-2025 program budget, some member states in our region had expressed concerns already about being able to make those increased higher payments. This situation is only more difficult now with a second large increase being proposed. Governments' budgets are currently tight all around the world, and we certainly share those concerns today. With that in mind, the United States requests that the Secretariat provide several options for the proposed member state assessment in the full program budget proposal, so member states can see the possibilities and repercussions of different funding scenarios and make informed decisions accordingly. In line with practices at other international organizations, we would suggest the currently proposed 20% increase, a traditional zero nominal growth option, and at least one other level in between those. This would help us have constructive conversations at the next PBAC and EB to ensure that WHO continues to be financed sustainably. Thank you.
Muchas gracias, Estados Unidos.
Thank you, United States. I now recognize Mexico. Thank you very much, Madam President. The Mexican delegation takes note of this document, regional consultation on the budget program of the World Health Organization. We know how important it is from WHO to have sustainable and effective funding so that it can comply with its general program of work. That will contribute to solid, transparent, accountable reporting to member states. Also, we recognize that transparency has improved and that we have been heeded. We agree with the increase foreseen in the base program's budget for the Americas. It is not all that equitable because it continues to represent the lowest level of funding when compared to other regions. We are pleased to see that we are not to work in silos and that we will be using the resources so as to accomplish best health for the population. We consider that it's substantive to clarify the differences that exist between the plans, between the verbs planning and designing. It would be essential to continue to talk to the World Health Organization about the optimal distribution of these resources towards our region with a view to addressing strategic priorities that have been identified by member states to strengthen health and the well-being of all of the people in the Americas. Also, it is important for us to analyze the gradual increase in assessed contributions that are going to have an impact on the economies of member states. And also, we need to continue to look at alternative ways to produce a sustainable funding so that we will not only have resources available, but also we will be able to assure their adequate execution so as to benefit our population. Thank you. Thank you, Mexico. I now recognize Chile. Thank you very much, Madam President. I also thank the Secretariat for presenting this information document. As was said when we introduced the budget to improve regional offices, there will be a gradual increase in assessed contributions. As a delegation, we would like to ask, does this increase refer only to WHO contributions, or is this a part of the recent increase in the OAS contributions that was reflected in the OAS? Because increasing the rates at OAS affects what is paid at PAHO, and that means an additional increase of this size is difficult if we are to have a sizable increase, not only in the OAS, but in PAHO. So I would join the United States asking that we explore alternative courses of action, and that this increase of 20% be reconsidered so as to be able to assign funds to the base programs. For us, this is vital, and of course we are interested in more funds being assigned to our region, but this should be done in a realistic fashion. Thank you. Thank you, Chile. I now recognize Canada.
WHO Secretariat for timely circulation of this draft program budget document. We will continue to review this draft and future iterations with a keen view towards enabling effective operationalization of GPW 14's ambitious agenda. In the meantime, we are sharing initial comments. We'd like to clarify the status of outcome indicators. When the GPW 14 was approved at WHA 77, the document stated outcome indicators were draft and would be finalized as part of the development of the program budget for 2026-2027. However, this budget proposal states outcome indicators were finalized in March and shared at WHA 77. Canada had additional comments to provide on outcome indicators shared at WHA and requests the Secretariat provide additional details on the status, including whether they remain under development or, if finalized, when that was done. We welcome the proposed budget increase to benefit country and regional offices, stronger focus on measurable impact at country level, and WHO's commitment to gender equality, equity, human rights, and disability inclusion throughout these efforts. We also welcome the plan to add a budget line equivalent for global outposted technical centers and recommend that future versions or the digital platform include more detailed descriptions of these centers' work, given significant resource requirements and requests for increased envelopes. Regarding content on accountability and the Secretariat implementation plan, we would recommend that in this governing body cycle, the Secretariat be prepared to report on how the AC increase in 2024-25 was used to make progress on critical issues, including redressing programmatic budget imbalances, strengthening the organization's enabling and accountability functions, addressing staff contract reform, and investing in better capacity at country level. We also recognize the U.S. request for upcoming budget and express support for WHO clarifying what a variety of financing scenarios would look like and what impacts would be. Finally, we find early information on scope of the proposed outputs very interesting and look forward to additional detail and opportunities for feedback. Thank you.
Muchas gracias.
Thank you, Canada. We have a non-state actor that is asking to speak. I recognize Movendi International.
Chance to comment on the draft proposed program budget 26-27. Movendi International welcomes how the draft program budget addresses alcohol, but we note the use of the outdated and misleading term harmful use of alcohol. We support that alcohol is mentioned in two joint outcomes and that the reduction of per capita alcohol consumption is the outcome indicator in line with the SDGs. Our analysis of the draft program budget shows that out of 15 joint outcomes, alcohol harm impedes 9 of them. This means 2 things. It's important to allocate adequate funding for the work on alcohol as a public health priority, commensurate with the burden alcohol causes and how it impedes other priority areas of global and public health. It is crucial to ensure cross-sectorial work through strengthened institutional capacity in WHO at the regional level to identify and address alcohol harm in all areas where it is a major obstacle. We call on PAHO to take steps to this effect and to champion this cross-sectorial approach at the country level using the United Nations Sustainable Development Cooperation frameworks. Movende International stands ready to partner with and support PAHO and member states in this critical endeavor. Thank you.
Muchas gracias.
Thank you. Thank you to Movende International. I recognize Mr. Oyo now for him to respond to the comments.
Thank you for these, for all these thoughtful and constructive comments by member states. So let me start by talking about the ACE increase and the resource allocation. I would like to say that the two are very much interconnected. And just would like to point out that 72 or 75% of the resources that the Americas region is receiving from headquarters is basically flexible funding, and a large portion of that is SS contribution. There's very little volunteer contributions in that because of the specificities how we are set up. So if you want, so I'm not saying that. So I'm trying to be precise. So in order to improve allocation of resources to the Americas requires that we have a bigger proportion of sustainable funding overall in WHO, because that's the best way to ensure that more resources can come to this region. And I just would like to say that this biennium, there's been a quite substantial increase of flexible funding already coming to the region. It was 120 million in 22-23, and it grew to 149 million. So that's which is 24%. And mostly this was done by, was possible because of the increased SS contributions. But we heard you and we understand that there's always that element of resource allocation, and that this is something that needs to be constantly looked at and seen. Of course, it's a zero-sum game, because in the current setup, we can only increase this region's allocation if we reduce somebody else's. So that's why it's a little bit tricky. On the issue on the US of the smaller budget increase that's requested, we will look into that. Obviously, we need to listen to all the other regional committees. This is the first regional committee where this issue has come up. In other regions, there's been a general support for the overall increase. And I just would like to say that if you remember, the 26-27 budgeting, the 24-25 budget is a flat budget compared to 22-23. The 22-23 budget was increased midway through, but all that increase went for the emergencies. So if we are going with a completely flat budget for 26-27, it means that we have not increased for other programs the allocated budget from 22-23 to 24-25 and 26-27. And you know that this would mean a very radical decrease in real terms, because just inflation alone and all cost increases have been quite substantial in the past couple of years. Having said that, we will have a look at it, but we will also hear what other member states have to say. On Mexico's intervention, point taken, and this is the efficiencies is always something that we are looking into. Again, it's always a combination of trying to find ways to cut costs and cut elements where it does not impede implementation, right? And to be quite honest, if we were honest to ourselves and we said that we want to prioritize, then we should have a discussion about not only about efficiencies, but also maybe what are the areas that should be reduced or should grow less. Because everybody agrees with prioritization until it's a general notion, but when it comes to the actual area, then it becomes very difficult. And in that sense, I really appreciate US's courage to say where maybe the increase should be smaller, but I think we need to obviously listen to others. On Chile's point, the 20% increase is about WHO. So as you know, the PAHO and the WHO part are two different legal entities and organizations, and that is why we fully understand the AC increase presents a particular challenge in this region, because you are supporting, in a way, two health organizations, and that has costs, but of course that has benefits as well. But we understand that this is a particular situation in this region. Canada's question on the outcome indicators. So I need to go back and look at Canada's comments on the indicators, and if they were not reflected, then I apologize. Just to make sure that everything that you are looking at is a draft. So this is the first reading of the program budget, then there's going to be a second reading in February, and then there's a final approval in May. So there's obviously, and you are shaping this document. So anything that is not correct or any changes that are required, there's basically time between now and May to reflect that, and that's the whole point of these discussions. I just would like to say that we are planning to have a consultation before we finalize the January version of the program budget in November, probably end November, in Geneva, and of course also virtually, where we will bring together all the elements coming from the regional committees, and where we will also give you an update on where we are with the outcome indicators and the output indicators. So you will have a lot of opportunities to further shape this work. And I also noted the NGO about the harmful use of alcohol, and then we will work with our technical colleagues to reflect the correct wording. Thank you.
Thank you, Mr. Hoyo. Madam Assistant Director, do you have any comment you would like to make?
Yes, thank you, and good afternoon, delegates. First of all, I'd like to apologize on behalf of Dr. Chapas Barbosa. He had a very urgent matter that he had to attend to quite suddenly, so he is unable to be here in the hall with us at this point in time. I want to thank Mr. Olo for the presentation, very detailed and very good explanation of the program budget 2026-2027. I want to thank the member states and the NGO who also provided comments. member states did get the opportunity and participated very well in the development of the GPW 14, and the process continues. And as Mr. Olo did say, we have the opportunity for further consultation before the draft is finalized. And I urge member states, please, to participate fully. And the PAHO Secretariat is willing to facilitate and assist member states in the consultations going forward. Thank you.
Thank you, Assistant Director, for your remarks. I would like to inform the Council that the discussions will be noted in the final report. Before moving on to the next item, I have a very special announcement I would like to make regarding the length of speakers' presentations. I would like to remind the floor that the President has the authority to limit how long people can speak. That means that when delegations want to speak or answer, the President can set a specific time limit for each presentation. Mindful of how much time we spent on the prior deliberation, now we are limiting the current interventions to 2 minutes. Now, the next item, which is 8.1, roadmap for the developing of the strategic plan of the Pan-American Health Organization 2026-3031. I would like to bring document CD 61/INF/1 to the attention of the Council, and I invite Mr. Ronnie Massa, Director of the Department of Planning, Budget and Evaluation of the Pan-American Sanitary Bureau, to come to the head table.
Muchas gracias.
Thank you. And I give the floor to the representative of the Executive Committee to report on this item. I apologize, Madam President. I was having a hard time with my device here. So, during the June session, the Executive Committee reviewed a report setting out the proposed process and timeline for the formulation of the new strategic plan of PAHO that will cover the period 2026-2031. The committee welcomed the proposed roadmap, emphasizing the need for a participatory, transparent, and robust development process in order to ensure the development of a strong strategic plan. Delegates applauded the Bureau's plans to seek input from a variety of stakeholders, including civil society, academia, the private sector, and youth groups. They also welcomed the Bureau's efforts to incorporate best practices and lessons learned from the current strategic plan and from the process of developing the WHO 14th General Program of Work. It was deemed essential that member states reach an agreement on regional and sub-regional priorities to be addressed under the new strategic plan. It was agreed that a degree of flexibility will be needed so that the new strategic plan can be adapted to reflect changes that occur during the period covered. It was suggested that a mechanism might be put in place to enable amendments to be made to the plan over time, especially as it will cover a period that extends beyond the target date for the achievement of the Sustainable Development Goals. Thank you, Madam President. This concludes my report on this item. Thank you very much, Madam Representative of the Executive Committee. Now I give the floor to Mr. Massa to present on the item.
Muchas gracias, señora.
Thank you, Madam President.
Madam President, honorable ministers, distinguished delegates, assistant director, colleagues, I have the pleasure to present to you an update on this item on behalf of the PAHO team, as this is indeed the collective effort of all of us at your Secretariat, from regional to country offices, to develop a solid strategic plan that responds to the current times, the needs and priorities of your member states, together with you, of course, and with our partners. This strategic plan, this update benefits from the consultations that we continue to engage with your member states. And I want to start by thanking the Executive Committee for the endorsement of the roadmap and also their guidance on the important steps that we need to take forward, understanding that it's a fluid process, and for a plan to be realistic and responsive, it needs to adapt as we go forward in this process. I have an overview just to remind those of you who have not been able to participate in previous sessions, is that the purpose of the strategic plan for PAHO for the next 6 years, so 2026 to 2031, is to set that medium-term strategic direction, the vision on where we should be by 2031, building, of course, on the successes, the lessons, and the best practices that we have in the region with our countries, and learning also from the global processes. I want to highlight here that this is the last strategic plan that we will have to push forward and accelerate towards the Sustainable Development Goals that will be due by 2030. The plan defines the collective priorities and results, and I think there's been a discussion here in the last 2.5 days on what that represents for PAHO, our member states, with solidarity, with equity, and with commitment going forward. The plan will focus on showing our value added, and by that is the technical cooperation that responds to you, but also showing the meaningful impact and the progress that we make in achieving results. It should reflect the driving impact in countries, and by that we mean that we can show that the interventions will result in concrete and measurable results at country level, and how we advance towards the regional and global commitments. It should also address the persistent barriers and the unacceptable levels of inequity that have been exposed even more by the pandemic. The plan responds, and I'm happy to say, that is aligned with the general program of work that your member states have approved for 2025-2028, the Sustainable Health Agenda for the Americas, the SDGs, and also important, the country cooperation strategies that we develop in each country to guide our technical cooperation for the medium term. And of course, those very important policies, strategies, plans of actions, resolutions that you will approve here and that you have approved in the recent past in this very august body, the governing bodies of PAHO. It builds on lessons that we have gathered, and I said not just documented, but building and implementing such lessons so that we can build on the success and replicate success for maximum impact. But also reminding ourselves that we need to focus on results, and that we need to also apply the external audits and external evaluations, especially those related to results, the COVID response, and other thematic areas that have been evaluated externally in the recent past, and currently ongoing, like the evaluation on gender equality. Just to highlight, and this is the detailed roadmap, what you had approved in June has the milestones. That hasn't changed, but what we did since the first consultation that we had with you in August, the informal consultation, is that we needed to develop a detailed timeline and communicate to you. We have done so, and this is not to present to you every item, but to see where we are in milestone 2. We're presenting an update to you, but also to update you on the feedback we have received so far and how we're planning to continue building on the consultations, both with member states and partners. I want to note that throughout this process, we plan to apply your feedback, your recommendations, but also enhancements to the strategic plan based on the external evaluations and audits, such as ensuring that we can show PAHO's direct contribution to improving health outcomes, the theory of change, and also looking into how do we continue to build with our best practices of engaging with your member states and beyond with partners. This timeline has been communicated to all the countries. Our director sent an invitation to the member states, inviting you to nominate focal points to engage with us directly and also to serve as the conduit for us to conduct meaningful consultations. I'm happy to report to you that 46 countries and territories have confirmed today the focal points, and we welcome you all to continue joining us in the consultation and the journey to make sure that this plan indeed responds to the needs and times. Also important, innovation and improvement is building and this alignment and streamlining of planning processes of the country strategic input, where we're looking at the country plans, the country strategies that we have, and how that also feeds into the strategic plan to date. And I want to thank also the 26 countries that through our PAHO country offices under the leadership of our PAHO WHO representatives have already sent us feedback, which is called the Country Strategic Input, the CSI. That's not a movie, by the way, that's just an acronym we use here. Here is a summary of the consultations. Happy to report that the first consultation on the 4th of September, we had a tremendous turn-up. Great participation, 40 countries and territories that joined us in that session. And as you can see here, with 91 delegates. Important, also the participation from high-level officials, experts, public health, planners, external relations, and also colleagues who are indeed following with the global and regional health agenda aspects. On the right, you have the summary of the participation from stakeholders. So we had two sessions back-to-back, one with member states, and important to highlight, this process is member states led. So with member states, it's consultation, because that input will guide, of course, the development of the plan, and with the stakeholders, partners, NGOs, civil society, is about information, input that we'll consider, that will then member states will take into consideration and decide, and therefore the different terminology we use here. Again, great turnout, over 150 stakeholders participated, and as you can see from the graphic there, we have a myriad of representation from collaborating centers in the majority, and also donors, partners, who not only participated and asked and wanted to be involved, but also already anticipating that they will be critical for the successful implementation of the strategic plan. Here are some takeaways, in summary, of that first consultation and information session. We're very happy to see that they were committed to continue supporting, and also quite enthusiastic to continue working with us, the Secretariat, and going forward with the journey ahead. General agreement on the proposal that we presented at that time, very draft, working proposals on situation analysis, strategic objectives, and outcomes. Initial, I want to highlight that as this process was just starting. The member states also appreciated our proposed approach to making the strategic plan more strategic at the level of results. High-level strategic objectives, high-level outcomes that will promote a more integrated approach. And in that regard, our director, Dr. Jarbas, has challenged us in the Secretariat to make sure that we stay at that level, and we welcome your support in that regard. The member states also highlighted the need for this Pan-Americanism, this solidarity that we have in the region, to ensure that we leave no one behind, that we translate that statement into real action and difference, that we address the needs of countries who need more support from those, and populations in vulnerability. And you will see more as we continue to develop that. We also heard, especially from the stakeholders, on specific suggestions that we have taken note, and we will continue to work on as we develop this substantive document. Equity, well-being, determinants, to make sure that concepts, terminology is also clear, so that we all have a common understanding on what is it that you are committing to, and we will continue to work together towards making a difference in the health of the region and the countries. Here is, and I'm showing this for the first time. This is, of course, our initial proposal. We also heard from member states after the consultation writing, can you show us well how do we move away from silos, from boxes to a more integrated approach? And we tried in the Secretariat, with the talent we have, with our colleagues, to bring to you a proposal that will show that also graphically. But more importantly, in the document, we will outline to you how do we work from determinants to the specific interventions that are required. What you have here is the initial proposal that was presented in the consultation of 5 strategic objectives and 12 outcomes at this time. This is what our member states welcome. In addition to that, at the bottom, you will see in this integrated approach and the vision towards impact is the importance of the cross-cutting approaches. Equity in all its dimensions to ensure that gender equity and all the socioeconomic issues that need to be addressed are indeed considered so that we can aim towards improving health outcomes in a sustainable manner. I'd also like to take the opportunity to share with you that we're working on our communication strategy to ensure that internally in the Secretariat and with member states, we have that active engagement and that we capture all the input that will make indeed this plan very realistic and responsive to the situation. Our proposed theme at this time is accelerating together for a healthier Americas with equity and resilience. You all have highlighted in the debates in the previous how important it is to address inequity, but also to build resilient health systems. And that's at the center of this strategic plan. As you will probably seen in the vision, that the impact level is to improve health and well-being with equity. Also, I want you to please join us in the upcoming events that we'll have. On the 30th of October, we'll have the second consultation with member states. At that time, we will present the more detailed proposal on the results framework, situation analysis, and also a discussion on equity in all its dimensions. At that time, our director has also asked that we continue to work with a member states expert group on defining what we mean by equity in all its dimensions. And we will be sending an invitation to the member states to nominate experts in this regard. On the 5th of November, we will have the stakeholders' second session. And again, we will hear from them and come back to you as we move forward. We have created a site that is there on the presentation where you can also visit and follow this process, but also provide us with feedback. And if you have any questions, our team, of course, will be happy to address them, or any suggestions you have. With that, we would like to say thank you for your attention, and looking forward to that enthusiasm with which we started the first session, your commitment, your collaboration, so that the current and the future generations can really enjoy healthier well-being, and also that we address inequities so that those smiling faces can continue to enjoy optimal health and well-being. Thank you very much.
Thank you, Mr. Massa, for the report you've read to us. I would ask the Directing Council to provide comments and recommendations on the proposed process for developing the strategic plan. I open the floor to the plenary for discussions.
Cedo la palabra a México.
I give the floor to Mexico. Thank you, Madam President. The delegation of Mexico would like to express thanks for the presentation of the update of the roadmap for developing the strategic plan 2026-2031. Mexico recognizes the work carried out by this organization, clearly defining what the priorities are that member states themselves have identified in their cooperation strategy, which have been included in the 5 specific objectives in response to the priorities or agenda for the world priorities of the Sustainable Development Goals on health and the 14th General Program of Work of WHO. We draw from the learnings of the strategic plan, and we prevail upon everyone to keep in mind the need for us to pledge to clear, measurable indicators that reflect the joint effort between this organization and the member states of the organization. We would ask that guidance be given on those topics around which there is a good consensus regarding the added value that member states recognize by way of technical assistance now as essential parts of this plan in a situation of strapped budget. So we continue to offer our support in hammering out this strategic plan. Thank you, Mexico. I give the floor to the U.S.
Thank you, Madam Chair, and we very much appreciate the thorough update presentation on the status of the roadmap. The United States welcomes the region's collaboration in developing the strategic plan for PAHO 2026 to 2031, and thanks PAHO for its detailed roadmap. We look forward to participating in the consultation process throughout the coming year. In addition, we also look forward to robust member state engagement to harness strategic input and drive progress on collective priorities in the region. In particular, we encourage the strategic plan to be underpinned by health equity and inclusion, shape innovative solutions for health and well-being, and address the intersections of health and megatrends, including climate change and migration. We welcome learning more about the plan's financial costs and implications during the consultation process and reviewing the outline of the 2026-2027 program and budget. Thank you.
Thank you, U.S. I give the floor to the Bahamas.
Madam President, the Bahamas commends the milestone process for and output from PAHO's results-based management framework evaluation, as well as the documentation of the pandemic lessons. These publications, along with others, memorializes our collective achievements. The disruption to health gains caused by varied public health threats, civil unrest, growing inequities, and climate-influenced events that have plagued our region during the period of the current strategic plan are all acknowledged. For the period of the new strategic plan, these and other challenges to health security and well-being will persist. Though the region-wide aggregated decline from 15.3 to 14% in NCD premature mortality is encouraging, there are far too many countries, my country included, with unacceptably high premature mortality rates. The prevalence of overweight children is also increasing in the region. Similarly, age-standardized DALYs due to depressive disorders is still too high, and the number of deaths from suicide are increasing. The Strategic Plan 2026 to 2031 must represent our moment to reset, to seize political momentum, and dare to be bolder. The plan needs to touch at the root of our persisting challenges. It needs to be realistic, ambitious, and sensitive to the member state-specific realities. The Bahamas welcomes the collaborative spirit in the development of the new plan, and have had opportunities during the first member state consultation in early September to lend our voice. More recently, our PAHO country office facilitated robust dialogue to articulate the Bahamas' strategic input and priorities. We request PAHO to bring greater transparency on the inclusion and exclusion metric against which country-submitted priorities will be filtered. The Bahamas recommends that the new plan strives for greater harmonization and implementation at country level, specifically to revise the biennial work plan evaluation for more meaningful and aligned work and accountability. The Bahamas supports the proposed process and its consultative focus. I thank you.
Muchas gracias.
Thank you, Bahamas. I give the floor to Panama. Thank you, Madam President. Panama is grateful for the roadmap on the developing the strategic plan 2026-2031 as a collaborative effort geared toward achieving the SDGs as well as the health agenda for the Americas. We reiterate that during your contribution, we need to consider the regional priorities and how this interfaces with the 14th GPW as well as other health commitment agreements that member states have signed on to. We take note of the availability of data on these indicators that ultimately are chosen for monitoring and assessment. However, at this point in the game, what's most important is that we identify important indicators to measure health, that is, the data of which needs to be looked at during the exercise of this plan that should be considered for outputs or future plans. We have to be flexible with the strategic support That is, this is something that needs to be sufficiently endowed for it to be carried out in each one of the countries and territories in an efficient and effective way as we seek out better health. The proposed process seems to meet the expectations we have set for ourselves for a realistic plan because it's based on the process of prioritizing done by the countries, and that's why we will continue actively taking part in these consultations. Thank you. Thank you, Panama. There's a non-state actor who is requesting the floor. I give the floor to the World Cardiology Association.
Thank you, Madam President, distinguished delegates. The World Heart Federation commends the World Health Organization and its member states for the roadmap. We welcome the opportunity for a new strategic plan that aligns with the Sustainable Development Goals, particularly targets 3.4 and 3.8, the Sustainable Health Agenda for the Americas 2018 to 2030, and the World Health Organization's 14th General Program of Work 2025 to 2028. We applaud WHO and its member states for the successful implementation of the Hearts in the Americas initiative and the significant progress made to date. Nonetheless, we urge all governments to maintain and strengthen their commitment to the program in the next strategic plan. In particular, we advocate for a renewed focus on addressing unmet goals, such as improving hypertension control rates, ensuring equity in care, leveraging digital health tools, strengthening the health workforce, enhancing access to medication, and raising public awareness. We also call on WHO and member states to ensure that new plans is developed through a consultative and particular progress includes all relevant stakeholders, including civil society organizations and people with lived experience, consistent with the WHO framework for engagement with non-state actors and WHO framework for meaningful engagement of people living with non-communicable disease, mental health, and neurological conditions. Thank you.
I thank the World Heart Association. Now I offer the floor to Mr. Massa to hear his response to the comments.
Thank you, Madam President, and to the 4 member states for their comments and the non-state actor again for their comments and input as we continue to build on this journey that we present to you. First of all, thanks again for your commitment to continue working with the Secretariat to ensure that this plan does respond, as you all have highlighted, to the mandates, but also to those regional and global commitments, and I would say country as well, because we are also looking at your country's, the national health plans and strategies so that we can ensure there is alignment and streamlining across the 3 levels. With regards to the prioritization, I want to highlight that we will conduct country-by-country prioritization. What you will see in the strategic plan, very transparently, will be the collective, as the strategic plan reflects the collective efforts and not country-by-country. But what we do after that is in the country cooperation strategies, we will be able to also reflect that, but also in the program budget portal where we have country pages, you will be able to see, and as you probably saw in the report we presented yesterday, we have country pages where we also represent the priorities and the indicators to which countries are working towards. So that will be available in our portal as well. With regards to the ensuring that the plan responds indeed to the situation and these priorities, these diseases and conditions, let me assure you that the Secretariat here is taking a careful look at the health situation and also the impact that the pandemic had so that we can be very clear also in setting targets going forward, how realistic they would be. But we'll also be looking at accelerators, what is needed in line with the theme to ensure that as we propose a target, how likely is it to be achieved and what needs to be done. But again, I want to highlight that this is not just about what the Secretariat does. because at the outcome and impact level is really more about what is done at country level and what that political commitment you highlight. And the technical work that is done by programs can really lead to achieve the targets from the countries, and then we can report at the regional level. We will continue to ensure that there is robust engagement. Technology allows us to do that a bit more, and that's one of the lessons and experience we took from WHO, from the WHO General Program of Work, is that they conducted global consultations reaching countries through the virtual platforms. We are doing that, and from that, in the past we used to work with a small group of member states. Now we're working with all of you, a bit more challenging, but more enriching. There's more ownership, more inclusive. So we look forward to continue seeing you in the virtual platform. And when needed, we will convene on specific topics to make sure there's clarity from concepts to implementation. With regards to also on building on the momentum and how bold we want to be, I think, yes, welcome, we want to be motivational, but we don't want to be overambitious. I think that's a lesson that we've learned. So you will see as we move in this journey on the target setting, how we define the specific results and their measurement. We will also be ensuring that data and no indicator, as we have discussed internal secretariat, should be proposed without having the data to support it and how it will be measured with proper baselines and targets as highlighted. NCDs, mental health, are a priority. It has always been prioritized by member states in strategic plans, and we continue. That's also one of the priorities already in the strategic objectives and the outcomes that's before you. And as we continue to develop, you will see also the specifics on what it means. But also I think we need to highlight the point about focusing on priorities. We cannot assume that we want to do everything under the spirit. What is it that we really will drive impact and will lead us to improving those priorities that your member states select, with the support, of course, of your secretariat. With that, I would just say that we continue to also monitor the global processes, and the alignment is important. And prioritization will be a process by which we will engage with the member state. So we will have consultations regionally, by sub-regions, so that we can also hear from the member states by sub-region, but also country by country, or country offices will be conducting that direct engagement with the ministries of health and stakeholders also. Thank you very much.
Muchas gracias, señor.
Thank you, Mr. Massa. Thank you for responding to those comments. Assistant Director, do you have any comments?
Thank you, Ronnie, and your team for the presentation of the plan. And thanks to the member states, the 4 member states that commented this afternoon, and the non-state actor for their contributions and for the many great suggestions we've had during the consultation so far. The director has been overwhelmed and really pleased with the engagement of member states and the other stakeholders so far, and he wants me to convey his gratitude to you, all of you. The reception has truly been tremendous, and to remind you that the strategic plan is your plan. It's not a plan of the Secretariat, so we really appreciate the engagement, and we would really look forward to future engagement from our member states. We have to remember that the plan will take us into the next decade as we collectively work to improve the health of everyone in the region, leaving no one behind. So it is so important that we develop the plan in a way that considers the health situation and your priorities, as difficult as that may be. With so many member states, we know that it will be a challenge to include all your priorities and make sure everyone's needs is really included in the plan, but it's something that the Secretariat is committed to. The plan must set in motion actions that will help get us back on course towards the health-related SDGs and accelerate progress in health with bold and targeted actions with equity. Equity is something that came out in every consultation we've had so far, and with resilience as overarching principles. The Secretariat remains here to facilitate collaboration and continuity in the progress of the region towards our collective health goals. We will not stop working to ensure that this organization remains steadfast for health in the regional and global arenas and continue to seek greater efficiency, transparency, and accountability. Once again, thanks to all the member states who participated in the consultations. We urge you to continue to participate and work with us, PAHO, in the development of the strategic plan and the roadmap that we proposed. Thank you.
Muchas gracias, señora Sili.
Thank you very much, Ms. Sili Thomas, for your comments. The debate will be reflected in the final report. And with that, we can go on to 4.5, policy on long-term care. I would like to bring document CD 61/8 to the attention of Council, and I invite Dr. James Fitzgerald, Director of the Department of Health Systems and Services of the Pan American Sanitary Bureau, to come to the head table. I also give the floor to the representative of the Executive Committee for her to report on this item. Thank you very much, Madam President. The Executive Committee expressed strong support for the proposed policy. The policy's focus on health financing and on a life course approach to health service delivery was welcomed, as was the integration of long-term care into primary health care services. The gender dimension of unpaid caregiving was highlighted, and one delegate noted that women in the region provide more than 80% of health care for persons with long-term needs. The importance of involving care-dependent individuals and their family members in long-term care policy making processes was stressed. It was also emphasized that populations in situations of vulnerability, including older persons and persons with disabilities, must be assured access to affordable, equitable, and adequate care and support, regardless of their socioeconomic status. Attention was drawn to the negative impact of health worker migration on health service delivery, including long-term care for older persons, and it was requested that the issue be included in the policy, with emphasis on strategies to increase collaboration between sending and receiving countries. The need to invest in the health workforce, including fair wages and training for caregivers, was underscored. The Executive Committee adopted Resolution CE 174R4, recommending that the Directing Council approve the policy on long-term care. Thank you, Madam President. This concludes my report on this item. Thank you very much. I thank the representative of the Executive Committee, and now I give the floor to Dr. Fitzgerald for him to present this item.
Madam President of the 61st Directing Council, delegates, Assistant Director Sili Thomas, major demographic and epidemiological shifts in the Americas have resulted in a significant increase in life expectancy, with corresponding increases in years lived with disability and dependency, as well as demands for long-term care. Whereas needs in long-term care are substantively more significant in older persons, long-term care may be required at any age. The prevalence of disability with severe functional limitation and need for long-term care is increasing in part because of a rise in non-communicable disease, including neurological and mental health conditions. As of 2020, at least 8 million older people require long-term care in Latin America and the Caribbean, and this figure is likely to triple, reaching 23 million by 2050. The lack of institutional capacity to respond to this need will impact human, economic, and social development across the Americas. Meeting long-term care needs constitutes a major challenge for health and social protection systems in the region of the Americas. The formal provision of such care is currently insufficient, with excessive reliance on unpaid care provided by family members, mainly women, whose health and well-being as caregivers suffer as a consequence. In some countries, long-term care is provided by health and/or social sectors, but frequently with no coordination between them. Inadequate financing results in ill-equipped health services and staffing levels, a lack of training and professional development for care workers, and the absence of a continuum in health and social care for those with long-term care needs. The policy document presented today before the Directing Council proposes priority actions for the development, strengthening and expansion of long-term care in the Americas. It proposes 5 lines of action to support the delivery of integrated and sustainable long-term care across the life course. Firstly, it calls for the strengthening of governance, accountability and stewardship through intersectoral policies to meet long-term care needs, with multiple sectors participating through structured governance mechanisms. Secondly, it urges countries to strengthen workforce capacity for long-term care, including health and social care workers and unpaid caregivers. Thirdly, it calls for the strengthening of the organisation and delivery of person-centred and integrated long-term care, responding to the differentiated needs of care recipients and caregivers, but with clear standards for quality of care. Fourthly, it notes the urgent need to increase and optimise sustainable and equitable financing for long-term care across health and social sectors. And finally, it urges Member States to strengthen information systems for long-term care, improving data collection and research, supporting the disaggregation of data and stratification by care dependency level. Madam President, the Secretariat would like to thank all Member States for their active engagement, participation and support received during the consultative process for this policy document. The document was prepared through technical discussions and meetings initiated in November 2023. Thereafter, 3 formal consultations with Member States were held in March 2023, with contributions, oral and written, being received from 22 countries. Thank you.
Muchas gracias, Dr. Fitzgerald.
Thank you very much, Dr. Fitzgerald, for your report. I now invite the Directing Council to review the information presented in this document. Also, please provide any comments that you feel pertinent and consider approving the proposed resolution presented in Annex A. I open the floor to the plenary to start the discussion of this document. The discussion on the resolution will take place once the rapporteur has read the proposed resolution. I now offer the floor to Brazil. Thank you very much, Madam President. We would like to reiterate our support to this proposed resolution and salute the fact that we are focusing on human rights. The long-term care is a vital element in a healthcare system and in social protection, guaranteeing that vulnerable populations, especially the elderly, person with chronic diseases or disabilities, receive adequate care. In the meantime, the sensitivity, the equity continues to be a challenge. Many families have significant financial difficulties in seeking long-term care, and that often leads to insufficient care or a serious financial burden. Integrating these policies into primary health care is essential. We would call on strengthening the staff assigned to this function with ongoing training, fair salaries, and also professional training for caregivers. It's important to also recognize the gender element. Women are responsible for more than 70% of the care of the elderly and more than 80% of care in general for persons requiring long-term care. This reality calls for an urgent response. Also, we would like to emphasize the importance of including the voices of users and their families as we formulate policies, using consultations and feedback mechanisms to make certain that policies will be more effective, more in keeping with the needs of the beneficiaries. We feel that PAHO can play an essential role in providing technical support for the development, implementation, and monitoring of long-term care policies, contributing to the strengthening of healthcare systems and social protection in our region. Thank you. Thank you, Brazil. I now recognize Uruguay. Thank you very much, Madam Chair. Uruguay welcomes this document CD 61/8 on policy on long-term care. Increasing life expectancy should be seen as a major accomplishment on the part of humankind, but it's also a challenge for public health because of this demand produced not only by aging of the population, but also by disability and years of life lost because of disability. It's important to remember that caregiving is a duty often on the shoulders of women, and these women in this way cannot achieve their personal goals, and this can work against their health. It is important that all sectors, all groups be involved in decision-making, especially civil society. It is essential to consider that in all public policy, the care model has to be dynamic. It has to reflect the reality of each country based on its proportion of elderly population or the proportion of the disabled. So it's important that we look at the parameters of disability so as to assure equity in distributing state funds, and especially those working at the first level of care, so as to apply this model. We hope that this challenge can be taken on if we remember the principles of primary health care and if we work to make certain that management and financing be in keeping with the needs. Thank you, Uruguay. I now call on Dominican Republic. Thank you very much, Madam President. In the formulation of the National Health Program for 2020-2030 in Dominican Republic, we find that there are people with some disability or that need long-term care. So for the Dominican Republic, this is a priority. It's a need. And it's important that we prevent disability and dependence on care amongst the population of the Dominican Republic. And this exercise is important to define responsibilities within each sector as far as care is concerned, taking into account socioeconomic realities that characterize the caregivers and those being cared for. So there have to be public policies in keeping with an adequate response on the part of the population. It is also important to emphasize the role of caregivers as such. They also present vulnerabilities because of the structural conditions that occur during the course of life. There can be negative consequences because of the care, especially for those caregivers who are unpaid and that are dealing with either their own children or other family members. So it is absolutely essential to devote funds to strengthen our staff, putting attention on the first level of care so that caregivers will receive a technical and financial support so they can provide quality and timely care, counting on the support of centers and communities. In that connection, the Dominican Republic has examined this policy and it welcomes the recommendations proposed by member states, and we support the approval of this proposed resolution. Thank you very much, Madam President. Thank you, Dominican Republic. And I now give the floor to Argentina. Thank you very much, Madam President. Argentina takes note of the information presented in this policy, and we think that this policy on long-term care should, for 2020-2024, would provide technical and strategic guidance so as to strengthen the ability to provide long-term care in the region of the Americas. Our country supports this initiative on healthy aging in the Americas, and we have taken part in some related activities. We agree that there is still a challenge of satisfying the need for long-term care for healthcare systems and social protection in the region. We are concerned that the formal delivery of these services may be deficient and that these people depend on unpaid caregivers. So Argentina has focused on some key aspects in line with this policy. They are the following: strengthening the oversight of the Ministry of Health and the health sector for the elderly, guaranteeing the delivery of health, prevention of diseases, comprehensive care, and self-care of adults and the elderly, to have care that is respectful of the rights of the elderly, making sure that care is person-centered, making certain that we promote the skills of the elderly, and also to have information circles so as to generate timely and sensitive data so as to make analyses and to make decisions about the health of the elderly. We think it is important to approve this proposed resolution. Thank you. Thank you, Argentina. I now give the floor to Bahamas.
Thank you, Madam Chair. The Bahamas strongly supports the policy on long-term care, or LTC, recognizing the growing importance of addressing the needs of our population ages, a trend mirrored across the region of the Americas. Shifts in our epidemiological landscape emphasize the urgent need for accessible, sustainable LTC services for Bahamian citizens. Projections indicate that by 2060, nearly 20% of our population will be aged, underscoring the need for immediate attention. At present, the Bahamas relies on a single tertiary healthcare facility to meet our long-term goal needs. However, as our population continues to age, this facility alone will not be sufficient to meet the rising demand. While this facility provides critical social care and medical attention to older patients requiring long-term care, the availability and accessibility of LTC services remain inadequate. We are actively working to enhance services delivery at this facility, ensuring that the healthcare needs of our aging population are met with dignity and efficiency. However, the Bahamas has made progress with Action 1, having developed intersectoral policies to address LTC needs and finalize the elder health policy in 2023 through multi-stakeholder consultations. Other lines of actions are being advanced through our ongoing health reform initiatives to strengthen workforce capacity, improve the organization and delivery of person-centered LTC, optimize sustainable and equitable financing for LTC, and enhance our information systems to support data collection. Despite these efforts, significant challenges remain. These include inadequate health funding, difficulties in achieving universal health coverage, and the need to restructure the health financing system to ensure efficient allocation and distribution of resources. The Bahamas fully supports the approval of this policy and seeks technical assistance from PAHO WHO for its successful implementation. Thank you.
Thank you, Bahamas. I recognize Canada.
Merci, Madame la Présidente.
Thank you. Canada recognizes the essential need of providing long-term care that is of good quality, and that we have people that have functional limitations. So we need to thus facilitate aging. We agree with this policy on long-term care being put forward by PAHO, and also this resolution that gives us strategic guidance regarding these efforts. The policy being proposed in this strategic line of action coincides with the priorities that Canada upholds. There is a federal investment that aims at improving long-term care, and we recognize that this care has to reflect the culture so as to respond to the needs of different geographic groups, taking into account people that have complex health needs and those that now have problems or that have had a poor result as a result of socioeconomic factors, or if they are part of underrepresented populational groups. So often there is care developed on depending on the needs of the individual. So it is important that we support these efforts, taking into account all of the racial, cultural, gender considerations. And we recognize the crucial importance of sound information systems to provide continuity of orderly information so as to respond to the need of all the populations, thus clarifying problems in policies or decisions having to do with long-term care. Thank you. Thank you, Canada. I now give the floor to Paraguay. Thank you very much, Madam President. We support the proposed resolution on the policy on long-term care, and this is document CD 61/8. We acknowledge the importance of talking about long-term care needs in the region of the Americas, given the demographic and epidemiological evolution that has taken place. It is true that right now, long-term care is insufficient in the region, and that has created a high dependency on unpaid caregiving on the part of family members, especially something provided by women. Now, as we look to the future, it is important to promote intersectoral capacity and to strengthen the capacity of ministries of health so as to optimize the functionality and prevent functional loss. In this context, Paraguay has established an interinstitutional group to produce Care 2020 so as to recognize, acknowledge the care, and also to distribute in an equitable fashion care between the family, the sector, the community. Our position is clear: to implement a national system of care that would bring together different institutions of the state so that those who need care will receive adequate protection, and so the labor rights of those providing care will be upheld. The national care policy is one of the pillars of our social protection policy, and it strengthens and expands care services. Also, we provide training for caregivers, and we set up regulatory frameworks for those carrying out these tasks, in addition to effective communication to assess and acknowledge the work done as caregivers. We support the measures contained in the proposed resolution. We recognize its importance, and we will be collaborating actively with its implementation so as to improve the quality of life of our population. Thank you. Thank you, Paraguay. I now recognize Cuba. Thank you very much, Madam President. Cuba has a demographic transition with a low level of fertility, a low child mortality, and a long life expectancy. And we have intensive internal mobility of our population. There is demographic aging that process is well along, and the group over the age of 75 is the group that is most growing. That is what is called aging of the aging. So the Cuban state has taken on a commitment not only to measure up to the challenges of demographic evolution, but also to put in place a development model that will assure social equity and sustainability. And that way we will have an instrument that will facilitate consistency, intersector coordination, and an orderly, progressive advancement so as to provide comprehensive care of life. These are the bases behind programs, actions, so as to favor access and opening up job opportunities to women, reducing the time that they spend on chores at home, and to strengthen legal protection of workers. The national health system establishes ongoing care as a care model that improves the quality of life of patients and families that are dealing with associated problems that are life-threatening. The model considers active support to the patients and their families, and that care is provided by interdisciplinary teams. If the person does not respond to curative treatment, they are given this support. It is important to provide access to pharmacological care or palliative medicine and develop a strategy of care that is person-centered. The Ministry of Public Health in Cuba guarantees the organization and access of patients to ongoing long-term care, including palliative care, through the health institutions network, and establishes a methodology to provide that care. This care model is individualized, it is patient-centered, and the patient is kept apprised of his or her own disease and its evolution. In terms of emphasizing treatment, we give necessary medicine to do pain control. We follow clinical guidelines, and physicians in Cuba at the first level of care, all the way up to the tertiary level of care, are trained so they give the correct treatment to any patient requiring long-term care, including palliative care. Thank you. Thank you, Cuba. I wanted to remind you that we only have 2 minutes per statement. And there will be a buzzer if you go over the 2 minutes. I give the floor to Chile.
Muchas gracias, señora.
Thank you, Madam President. Care has evolved over the last couple of years.
I'm trying to be as accurate as possible.
We have defined care as a fourth pillar of social protection with the purpose of tackling the challenge of reducing gaps in order to overcome poverty and to reduce social inequalities. The government has a pledge to install a national system to support caregiving and to ensure that it be fairly distributed among across society. We defined a national policy for support for caregiving, which has an intersectoral policy of national scope, sets guidelines for resolving public problems tied to offering support to caregivers, to the population of caregivers. Within the context of this policy, it's become evident that the effort aimed at caregivers is actually the supply of support given to caregivers includes governance, stewardship, strengthening the labor force of caregivers, be they paid or not, to increase and optimize the financing of the national support and care system, as well as what each sector has to offer by way of caregiving. In the biopsychosocial model of our system, this calls or seeks to avoid dependence through offering technical assistance, rehabilitation, mental health, and preventive health services. Now, from the primary health care perspective, using different strategies such as home visits and distant caregiving, bringing down barriers to access and making the system more equitable. Chile welcomes the development of a policy on long-term care as presented with stress on the respect of human rights, bringing down barriers to access to health, and making caregiving more broadly distributed as a key role of the state and as a means of preventing disability and dependency, and that their rehabilitation be the focus and not just the response. Thank you very much for this document, and I support this policy, Madam President. Thank you, Chile. I give the floor to Jamaica.
Thank you, Madam President. Jamaica is interested in this policy as we move through demographic transition. One of the features of Jamaica's transition through this process is a significant migration of the younger population. This negatively impacts and exacerbates the issues of care to tend to the elderly and urges the development of policies that ensures that this group is not left behind. Jamaica also notes the issues of NCDs that disproportionately impacts the Caribbean region. It is therefore important to note that as persons are living longer, the quality of life is significantly impacted through comorbidities from NCDs. We agree that healthcare financing and a multi-sectoral approach is needed, with responsibilities outlined for each sector. Significant costs in secondary and tertiary care, especially to the elderly, has resulted in substantial fiscal outturns for small island developing states. Jamaica is actively developing a policy on health finance and looks forward to support from PAHO as we build out our systems to achieve universal health coverage. We note that the policy addresses some areas of work already being undertaken and looks forward to the additional support in these areas. We are developing the Elderly Health Program, and this will allow for incorporation and implementation of some of the strategies. As we implement primary health care reform, we are highlighting a life-stage approach to health promotion and prevention, using the person-centered approach, and the elderly population are targeted for improving health literacy and screening. Jamaica appreciates that the policy is multi-pronged and addresses delivery of care in multiple settings by paid and unpaid workers. Our community outreach programs already see health workers providing care for the elderly in their homes and communities. Under the guidance of this policy, we will strengthen this program and will look at opportunities to provide training and support to the unpaid workers. We agree that it's essential to equip persons in a home to care for their elderly and see that this will be important in reducing the strain on hospitals. In addition, as part of our expansion of services in the primary health care reform, we are introducing rehabilitative and palliative care. We wish to highlight our collaboration with PAHO on the primary health care reform agenda and the support that is being provided in the rollout of the policy. The government and people of Jamaica are grateful for this effort by PAHO. Jamaica supports the policy, and we look forward to its contribution in the achievement of some of our goals under the primary health care reform agenda. Thank you.
Muchas gracias.
Thank you, Jamaica. I give the floor to Panama. Thank you, Madam President. Warm greeting on behalf of the delegation of Panama. We're pleased to say that Panama welcomes the document on a long-term care policy. We consider that this initiative is essential for us to tackle the challenges that aging represents in our region and offers a strategic framework for us to strengthen the integrated care system. The challenges that we face are clear. In 2023, a census says that the average age or medium age has gone from 28 to 30 years in 2023, and the life expectancy at birth is at 78.4 years. Now, this aging of the population underscores the urgent need to adopt the strategic lines as proposed in the long-term care policy, such as strengthening governance, training the labor force, and integrating care in the community. In 2024, Panama, this year has been decisive for Panama because we have adopted intersectoral policy that has given rise to the creation of a recently approved in-law care system. This effort, working with the Social Security system, ensures a comprehensive approach to meeting the needs of our elderly population. To invest in long-term care is essential to reduce the economic burden that befalls homes for care coverage and to improve the quality of lives of the elderly. Panama reasserts its commitment to the implementation of this strategy and to promote equitable and healthy aging throughout the region. Thank you, Panama. Give the floor to Colombia. The plan to strengthen long-term care is an effort in line with building equity and ensuring rights for those targeted by this care, as well as for the caregivers. We have stood up a comprehensive intersectoral system for caring for the elderly, and we are consolidating a national system for care. And the health reform process underway includes this. The vast majority of caregivers are women. Recently, President Gustavo Petro achieved the approval by Congress of the pension reform system, enabling 3 million elderly people who could not benefit from the system now can. Those who can pay into the system can be supported with the pension, and those women who receive benefits for every child they have. We pledge to build a national care system that seeks to properly combine the role of the state, the market, and families and communities in a joint effort to finance and redistribute the burden, trying to eliminate gender inequalities and violence against women, to strengthen the economy, and for there to be a care across territories. Progress has been made for care given to people who are disabled in order to ensure rights and equity within the primary health care system. With 2,000 medical teams throughout our country, we seek to bring down barriers to access and to reach the whole population and to make available rehabilitation services at the community level. We think that the resolution that will be approved here today will only strengthen our efforts to ensure equity in health, the work of the new model of a caregiving economy that we want to bolster based on solidarity and cooperation, seeking gender equality. Thank you. Thank you, Colombia. There are 3 non-state actors who would like to speak on this item. I give the floor to the International Hospice and Palliative Care Organization.
The IHPC, a CSO in consultative status with ECOSOC and official relations with WHO, emphasizes the need to educate policymakers and health practitioners on the clinical, social, and fiscal benefits of integrating palliative care into long-term care. Palliative care is the active, holistic care of individuals across all ages with serious health-related suffering due to severe illness, especially those near the end of life. It aims to improve the quality of life of patients, their families, and their caregivers. The Inter-American Convention on the Rights of Older Persons, adopted by many PAHO member states, WHA Resolution 67/19, and Human Rights Council Resolution 48/3, which calls upon all states to provide long-term support in palliative care services, constitutes the regional normative framework. The 2016 UNGAS outcome document recommends ensuring availability, accessibility, and affordability of essential palliative care medicines, which include generic morphine, midazolam, and methadone. Palliative care is also integral to ensuring care across the life course and in advancing the UN Decade of Healthy Aging. The IHPC works closely with the Latin American Palliative Care Association and is ready to assist any member state wishing to integrate evidence-based palliative care into its long-term strategy. Thank you.
Muchas gracias.
I think the National Association of Palliative and Hospice Care. I give the floor to the World Heart Association.
Thank you, Madam President. Distinguished delegates, the World Heart Federation applauds the World Health Organization and its member states for their policy on long-term care. Cardiovascular disease remains the leading cause of mortality worldwide, accounting for around 20.5 million deaths every year. Heart conditions are generally chronic in nature and can lead to severe disabilities requiring long-term or even long-life care. Conversely, people living with disabilities also face a greater risk of developing heart disease. The Hearts in the Americas initiative, which focuses on hypertension control and secondary prevention at primary health care level, can contribute to the prevention and reduction of cardiovascular morbidity, mortality, and related disabilities. World Heart Federation urges member states to adopt and implement the proposed resolution specifically. Institute the Hearts in the America initiative as the standard model of care for cardiovascular risk management in the region. Integrate person-centered long-term care across the full continuum of care, from health promotion, prevention, diagnosis, and treatment to rehabilitation and palliative care. Within primary health care, universal health coverage, and emergency preparedness plans, and strengthen the health workforce to reduce the workload and ensure the well-being of informal caregivers, especially women. Thank you.
Muchas gracias.
I thank the World Heart Association. I give the floor now to the World Organization of Family Medicine Schools. Good afternoon. I would like to start by expressing thanks for inviting WONGA to take part in this meeting. We are here for the first time, and I would like to say that our world organization will continue to take part here as long as we are given the opportunity to contribute to the attainment of the Sustainable Development Goals of 2030, as well as health, equity, and peace among our peoples beyond the operational goals or objectives. Regarding the topic at hand, I would underscore how important this policy is, as well as the role of long-term health care providers. Scientific evidence on the importance of continued care in health has grown over the last decade. What is sought are better results and promoting health, adherence to a therapeutic care. Now, recent publications, though not so new and overlooked, from 2017 and 2020 focus on what in family medicine, primary health care, we call longitudinal studies, that is, or longitudinal care, rather, over one's life through a stable connection to a professional, healthcare professional or team or healthcare service. That long-term stable relationship with a healthcare provider reduces mortality significantly. After 3 or 4 years of this longitudinal connection, and that improvement in health outcomes grows as time goes on. That to say that longitudinal care is not a focused strategy aimed at specific disabilities or problems, but rather an essential attribute of health services and health organizations that should not be overlooked if what we want is resilience, effectiveness, and efficiency. Pandemics or health emergencies, such as caregiving in different times of one's life, caring for people, families, and populations with communicable diseases, non-communicable diseases, or with a multiplicity of morbidities, can all benefit from this form of care. I should also say that family medicine and community medicine have the profile and the necessary skill set for providing this type of care to families and people. Our region has training schools, but a dearth of policies for including this specialty in healthcare services. On behalf of WONCA, WONCA Iberoamericana, and of the Americas, we would like to emphatically stress our will to continue working to effectively incorporate this specialty in the healthcare systems of our countries. I would also like to say those aspects, refer to those aspects related to care and stress on this document the importance given to the integration of the health system and caregiving systems, especially across countries, as well as there being a gender perspective in these policies, because most caregivers are women. Thank you. Wonka, I give the floor to Dr. Fitzgerald for his responses.
Thank you very much, Madam President, and thank you also to the 12 delegations, member states that have provided your comments and inputs into this important policy document. I think what we're really hearing from you is how long-term care is and will constitute a major challenge for the region of the Americas due to, as we heard from many of countries, including Bahamas, the rapid epidemiological and demographic transition that is occurring, the rapid aging of the population in the Americas, and the differences between life expectancy on one side and healthy life expectancy on the other, resulting in the generation of increased demands for long-term care as people in particularly age. And this is particularly so for vulnerable populations, as we heard from Cuba and Brazil. But the landscape is quite complex in the region, as it has developed in somewhat of a fragmented manner, I would say. We heard from a number of countries, Panama, Chile, and Colombia, how the mechanisms of governance and stewardship around long-term care are essentially attributed across multiple sectors and often are led outside of the health sector, often within social protection sectors. And so I think what this policy document really urges us all to do is to strengthen the leadership, stewardship role of the health sector in long-term care, in those multi-sectoral mechanisms, and working very closely with social protection to really increase capacities moving forward. As Argentina so well expressed, this process should be really based on strengthening the role of the Ministry of Health based on the primary healthcare strategy, focusing on really building the capacities that's required at the community level, in home-based care, in promoting care in place, aging in place, and reducing care dependency and increasing functional capacity within that environment. This just not only makes sense, but it's actually extremely and considerably more cost efficient. In terms of the financing, a number of countries expressed concern on how long-term care is going to be financed. The data on this, most of the data we have on this, I have to say, comes from higher income countries in the OECD, and those countries seem to suggest that at present long-term care is costing, in terms of public financing, approximately 1.8% of GDP in higher income countries. Now, in lower income countries, we're seeing around the allocation of about 0.3% of GDP, but it doesn't take into account the fact that that care is being principally provided by unpaid caregivers, which constitutes an additional, in the European Union, for example, in the order of about 2.5% additional of GDP. So we're looking essentially about 5% of GDP in higher income countries. So this is what we're facing in the future. So we really have to begin to look at the models of care within lower and middle income country contexts that will really shift care out of hospitals, out of specialized care centers, into the community, into homes, so that we can ensure better care, more humanized care, and in a manner that is more cost effective. I did want to address, Madam President, the issue of health workforce and unpaid care. There's a very important gender dimension in both the area of health workforce and caregiving in long-term care. We estimate that we need around 5 million formal care workers at present to meet the current LC long-term care needs. And this figure will increase to 9 million by 2035 and 14 million by 2050. Now, that is just formal caregivers. Now, recognizing the comments also from Brazil that essentially 80% of care is unpaid. which really means that much of that care, as we've heard from many of you, is being provided by women. But also there is a gender dimension in terms of the health workforce. Because if we look at, for example, nurses, 74% of nurses within the region of the Americas are also women. And so as unpaid caregiving continues, the demand for that continues to increase, what we're seeing in countries that women will be leaving the workforce and they will be leaving schooling. And we've seen in a study carried out in Brazil that essentially 25.8% of caregivers have indicated that they have stopped working or indeed have quit school to provide care in the home. Another dimension of this is associated with the issue of migration that was so well noted by Jamaica. As demands in higher income countries for long-term care increase, healthcare workers will and are being drawn from lower income and middle income countries, including many countries in the Caribbean, and indeed many countries throughout Latin America, to be recruited for the provision of long-term care in North America and in Europe. We are seeing this quite significantly occur and impacting the capacity not just of health systems to ensure access to care and coverage of health services for the whole population, but particularly also in the dimension of long-term care. So we have a particular issues in terms of workforce that we really need to be looking at. We need to be looking at forecasting, planning, and allowing for certain degrees and dimensions associated with migration that need to be addressed within the policy frameworks. We heard from Paraguay on the importance of the regulation of health services. This is a critical area in the provision of long-term care. As care is provided through multiple levels of the health system and even through social protection mechanisms, there's an enormous challenge that we face in terms of the regulation of that care, the implementation of quality standards, and the effective regulation to protect rights and to ensure the explicit guarantees in the provision and monitoring and evaluation of such care. And so one core area of this work program will be really to support the development of effective regulatory frameworks within long-term care that protects the individual, protects the person, protects the patient in that interaction in the provision of long-term care. Key to this also, coming back to the health workforce issue, will be the regulation of educational standards within the working environment. Finally, an issue around data analysis and standardization. In the development of this document, we did face considerable challenges in collecting and analyzing data from the Americas. Some of that challenge relates to the non-standardization of data, and this occurs globally, but also because of the lack of, I would say, disaggregated data by care dependency level in the Americas. And so there's an important need that we begin to look at our health information systems and begin to identify the indicators so that we can begin to monitor and evaluate the performance of long-term care provision in the Americas. We're doing this jointly with you, but also with important partners such as the World Bank Group, the IDB, the ILO, and the OECD. And we'll continue to work jointly with you moving forward. We also note that a number of countries here have requested technical support, technical cooperation, and we'll provide that after. We'll contact you and work with you afterwards, identifying your specific needs. Thank you very much, Madam President.
Muchas gracias.
Thank you very much, Dr. Fitzgerald, for your remarks. Now I'm going to give the floor to Guatemala. You have 2 minutes.
Bueno. Podemos evitarla. Bueno, dado.
Given our time limits, if everyone agrees, we can approve this resolution without reading it. Would everyone agree?
De igual manera,
I do recognize, I do offer the floor to the plenary to see if anyone has a statement to make regarding the resolution. If everyone is in agreement with the resolution, we consider that resolution to be adopted. I know that we're all tired. We have been seated for a long time, so we're going to stand up for 4 minutes and then we will resume our meeting.
Time for your Office Ergo stretch breaks. Everybody up, out of your chair, especially you in the back row. I see you hiding. Now, of course, if you have any health issues or feel discomfort at any point in time, please stop. Our exercise is for your eyes. Eye distancing. Cover your one eye, your left eye, and look far away with the other eye. Close your eye, switch hands, open up, and look far away with the left eye. That eye is a muscle and it needs to work. Switch hands again, cover the left, open up, far away, find an object on the other side of the room, close your eye again, one more time, open, look far away. Our next exercise is for your head and neck. Tuck your chin down towards your shoulder. Come up to the right. Gentle stretch. Come up. Again to the left. And up. Back to the right. And up. One more. To the left. Gentle. And back to the right. Okay, good job. Now let's do some arm swings. Gentle swings. Let's start slow. And then we'll gradually get a little bit bigger. Good for your shoulders. And let's gradually slow it down again. Small little swings. Great job. Now let's do some finger fanning. Stretch your fingers out gently, then make a fist closed. Fingers out. Make a fist closed. Stretch them out. Fingers closed. One more. Great job. Now let's work on our midsection. Let's gently slide your left arm down towards your knee. Come back up. Slide your right towards your knee. Come back up. Let's do that again. And up to the right side. Good job. Once more. Excellent. And to the right. Okay. Next, we'll do the leg out to the side. There you go. One leg. Step out to the right. 3, 2, 1. Excellent. Now let's do the left leg. Out to the side. Keep balance. There you go. 3, 2, 1. Great. Now we're going to do some squats with arm circles. So we'll do a big arm swing down and come back up. You've got it. Here we go. Down, up, down, up. 3 more. 3, 2, and up, and 1 more. Excellent. Okay, now we're going to do some step to the left, then step to the right. Step left, step right. There you go. Now, if you have heels on, you might want to take them off, but just in case, we'll also do some jump to the left, jump to the right, jump to the left, jump to the right. 3 more. 2, 1. Great job. Okay, excellent. Now, everybody back to work.
A ver si los delegados se sientan y podemos...
Please take your seats. We have interpretation services, but we do have a cutoff time with them. This is important because the interpreters need to rest, and so do we. Okay. Thank you, and that was a very good exercise break. Now we're going to go to 4.8, which is a strategy on integrated emergency critical and operative care 2025-2030. I call to the attention of the committee document CD 61/11, and I call on Dr. James Fitzgerald, who is Director of the Department of Health Systems and Services of the Pan American Sanitary Bureau, to come to the head table to present the strategy on integrated emergency critical and operative care. And here I recognize the Executive Committee for its representative to report. Thank you, Madam President. The Executive Committee expressed solid support for the proposed strategy on integrated emergency, critical, and operative care. It was noted that the COVID-19 pandemic had underscored the importance of robust and resilient health systems capable of providing emergency, critical, and operative care services. The strategy's focus on the integration of these services, in particular into primary health care, was welcomed. The need to strengthen health infrastructure, invest in health technologies, and ensure the continuous training of health workers was emphasized. Continuous training of health workers was emphasized, as well as the importance of intersectoral collaboration and sustainable financing to ensure the availability of high-quality emergency, critical, and operative care services. It was considered essential to involve patients in decision-making about their care, not only to improve the patient's experience, but also to enhance the efficiency of the health system and reduce the burden on emergency and intensive care services. The Executive Committee adopted Resolution CE 174-R6, recommending that the Directing Council approve the strategy on integrated emergency, critical, and operative care for the period 2025-2030. Thank you, Madam President. This concludes my report on this item. Thank you very much. I thank the representative of the Executive Committee. And now I call on Dr. Fitzgerald for him to present this item.
Madam President of the 61st PAHO Directing Council, delegates to the Council, Assistant Director Celie Thomas. An analysis of integrated emergency, critical, and operative care in the region reveals a context characterized by lack of access to specialized surgical and critical care services, particularly in remote and underserved areas, and a variability in quality and standards in care, including in pre-hospital and ambulatory care. As the COVID-19 pandemic so readily exposed, ensuring access and coverage in emergency, critical, and operative care is a central component of a national emergency preparedness and response strategy, including intensive care. In addition, it is central to the achievement of universal access to health and universal health coverage in the Americas, particularly in the enhanced management of chronic diseases, maternal and neonatal health, care for older persons, and management of traffic accidents. A resilient and flexible integrated emergency, critical, and operative care infrastructure supports uninterrupted service delivery and effective emergency responses, ensuring the continuity and efficiency of essential health services across the health services delivery network. The Strategy on Integrated Emergency, Critical, and Operative Care 2025-2030 highlights the pivotal role of such care within integrated health service networks, emphasizing policy-driven integration of services across care settings. It promotes coordination across hospital and pre-hospital care, including services at the first level of care, to create a comprehensive healthcare continuum. The strategy is designed to strengthen clinical management, and emergency responses and includes elements relating to financial protection. The strategy proposes 3 priority lines of action. Firstly, enhancing operational efficiency in integrated emergency, critical and operative care within integrated health services networks. This requires redefining governance structures and coordination frameworks within health services networks, ensuring effective coherence and coordination between levels of care. Secondly, it promotes integrated clinical management and quality in integrated emergency, critical and operative care. This includes the adaptation of national or international clinical guidelines for incorporation into clinical pathways, disease management programs and protocols at the national level to improve care and ensure patient safety. And finally, a specific line of action to strengthen emergency care is proposed. The objective of this strategic line is to promote the establishment of a unified, efficient emergency care response capacity that is adaptable to various emergency situations. Madam President, this strategy was developed at the request of Member States, specifically the Republic of Ecuador, during the 173rd session of the Executive Committee in September 2023. In addition, the Secretariat would like to thank all Member States for their participation and support received during the consultation process for the strategy, which was held in March 2023, and for the subsequent contributions, oral and written, received from 19 countries in this regard. Thank you, Madam President.
Muchas gracias.
Thank you very much, Dr. Fitzgerald. Thank you for your report. With that, I invite the Directing Council to review the information presented in this document, provide any comments it deems pertinent, and consider approving the proposed resolution contained in Annex A. I open the floor to the plenary to start the discussion on this document. The discussion on the resolution will take place once the rapporteur has read the proposed resolution. With that, I recognize Brazil. Thank you very much, Madam President. We support this strategy proposed, and we also support the resolution so as to assure integrated emergency, critical and emergency care that is good quality. It is important that we approve universal access and universal health coverage. The pandemic showed that it was important to strengthen our emergency and intensive care, and it is important that there be effective coordination among services, that we have evidence-based protocols, that we have digital support infrastructure to facilitate this work. One of the challenges covered by the document is the lack of equity in access to remote areas. So it is important that we expand coverage by improving infrastructure, making certain that everyone has access to surgical and emergency service of quality. The strategy that we are about to approve also emphasizes the importance of involving the patients and the communities in their care. And this would increase the efficiency of the health service. And we, in our delegation, reiterate our support for the integrated sustainable services to make certain that these services will become an integral part of the health system with effective governance to assure the resilience and the care provided by the system. Thank you. Thank you, Brazil. And with that, I recognize Honduras. She has no microphone.
Y estamos plenamente de acuerdo.
And we fully agree with the resolution. The strategy on integration is essential to improve access, quality, and safety of the emergency, critical, and operative care in the region. Honduras has been taking firm steps forward as it improves its health system. Currently, with the support of the Central American Economic Integration Bank, we are buying 32 well-equipped ambulances, which is an important step to strengthen our pre-hospital capacity. However, we do recognize the importance of continuing to receive support from the Secretariat so as to maximize the impact of this investment by having ongoing development of training for our teams. In the framework of primary health care, Honduras has done studies allowing us to identify access barriers and better understand the attributes of our service networks. These studies provide us the necessary evidence so as to be able to make significant changes and assure that communities, especially the most vulnerable, will receive adequate care. We realize that digital literacy is a key challenge. We request additional support from PAHO so as to strengthen the digital skills of our population, especially in terms of using emerging technologies. That would be an electronic medical history and telemedicine. Honduras is committed to improving the quality of care in an ongoing fashion. We are committed to infrastructure, building 8 new hospitals and remodeling operating rooms in the main health centers in the country. This investment is being made with state funds, showing that with transparency and with a firm commitment to the health of the population, it is possible to optimize the use of available resources. We thank PAHO for its ongoing support, and we request that the comprehensive and differentiated approach be maintained, giving priority to Honduras in the region. Thank you. Thank you, Honduras. With that, I recognize Jamaica.
Madam President, the design of Jamaica's healthcare system is based on a network of primary and secondary care facilities in the public system, as well as several providers in the private sector, which combined provides a broad scope of services, including emergency care, in a model that reflects available resources. This system is supported by policies that seek to ensure access to standardized and comprehensive care. When the system is under pressure, such as during disaster situations or in preparation for an anticipated event, such as a hurricane, services are scaled to safeguard access to essential emergency, operative, and critical care. Improving the quality of emergency care is a priority, and Jamaica is taking steps to renew and strengthen emergency care systems. Last year, through a collaborative process, Jamaica and PAHO conducted a national evaluation of the emergency care system using the World Health Organization tool, the Emergency and Critical Care System Assessment. This tool has as its main objective identification of areas of opportunity to strengthen emergency care and for quality improvements in emergency medical care services, thereby contributing to the reduction of mortality from emergencies. After considering the feasibility of implementation, impact, resources, and political support, 23 high-priority actions were defined to strengthen Jamaica's emergency care system. These consensus-based priorities have been categorized for feasibility and by timeframes and yielded an action plan for improvement in emergency care system. This includes the implementation of an updated injury surveillance system that allows for evaluation of impact of the interventions, such as the Jamaica Safe System for road traffic management and the Quality Management System for emergency medical care. The action plan will provide support to established EMS sites and look at expansion of this service. These actions are well aligned to the strategy that is seeking to integrate emergency, critical, and operative care. The strategy is quite comprehensive and likely to enhance the impact of the action plan for improvement in emergency care system. It is therefore quite timely for Jamaica. Jamaica therefore supports the resolution and the areas of strategic lines of actions and look forward to the continued support, especially for the implementation of the roadmap for implementation of the priorities identified in Jamaica's emergency and critical care system assessment. I thank you.
Muchas gracias. Thank you, Jamaica. I remind you that we are trying to limit each statement to 2 minutes. With that, I recognize Paraguay. Thank you. President, delegates, this document, CD, 11 gives us a careful diagnosis of the surgical capabilities, the emergency medicine capabilities of the Americas. And here we look at economic disparities, care in remote areas, neglected areas. And in this respect, it is necessary to have an urgent option in terms of policy to improve access to health care, since inadequate care commits results, or compromises results. Integration and coordination of the different components of surgical care, as well as intensive care, emergencies, are essential to assure their effectiveness. Paraguay, in keeping with these challenges, is carrying out concrete actions to improve the situation. We have worked on updating infrastructure in healthcare establishments to assure ongoing access to essential services. My delegation fully supports the proposed resolution on the integration strategy for emergency, critical, and operative care 2025-2030. We consider that this strategy is essential to have a comprehensive response to a whole gamut of emergency needs. That would be complex surgeries, emergencies. It is important to point out that surgical and intensive care, emergency services, have to be a comprehensive part of primary health care. Thank you. Thank you, Paraguay. I recognize Cuba. Thank you. Cuba supports the strategy. In Cuba, we guarantee that emergency, critical, and operative care is part of the 3 levels of care, and that's based on a national public health system that responds to the social policies of the state. We have primary health care, 122 specialized services for serious care. We also have 159 intensive therapies in the country's hospitals, organized for secondary care. And we also have intensive care units, or for emergencies. They are associated with emergency and surgical care. They have a structural design. Cuba has communities of intermediate care, 113 units where we have specialized surgical services, and that is for secondary and tertiary care. Aware of the need to strengthen the resilience of health systems to deal with natural disasters, pandemics, and non-communicable diseases, every year we have a coordination exercise to coordinate services in case of an emergency. Each health facility has an emergency plan for contingencies. Thank you. Thank you, Cuba. With that, I recognize Bahamas.
Thank you, Madam Chair. The Bahamas fully supports a strategy on integrated emergency, critical, and operative care, or IECO, recognizing the crucial need to enhance access to these services as part of our broader commitment to universal health coverage. Like many member states in the region, the Bahamas faces increasing demand for improved services, which requires focused and sustainable efforts. We recognize that this strategy will play a pivotal role in enhancing the accessibility, quality, and safety of these essential services, focusing on improving integrated care networks and expanding coverage. In response to the growing need for the IECO services, the Bahamas has made significant strides in improving the integration of emergency, critical, and operative care. Recent initiatives include infrastructure projects and service delivery improvements, such as strengthening urgent and emergency care services, establishing clinics with urgent care functions, and conducting EMT training to build workforce capacity. We have also invested in expanding our emergency medical fleets and strengthening our healthcare workforce, enhancing service delivery across all care settings from primary to tertiary care. While the Bahamas continues to advance the integration of our health system, we face challenges, particularly with the limitations in existing clinical guidelines and protocols. Additionally, as an archipelagic nation, delivering IECO services across our islands represents unique logistical challenges. Despite these obstacles, we remain steadfast in our commitment to address these issues and ensure equitable care for all Bahamians. The Bahamas fully is committed to the strategy on integrated emergency, critical, and operative care, and look forward to working closely with PAHO, WHO, and other regional partners to ensure its successful implementation. Thank you.
Muchas gracias, Bahamas.
Thank you, Bahamas. I recognize Ecuador. Thank you, Madam President. Ecuador welcomes the presentation of the strategy on integrated emergency, critical, and operative care 2025-2030. This strategy reflects the commitment of Ecuador to ongoing improvement of health services in the member states of PAHO. Our major objective in proposing the drafting of this resolution is to make certain that people in the region will have access to emergency, critical, and operative care of quality, services that are timely. We consider that the region has to strengthen several aspects: strengthening infrastructure, improving the equipment in health facilities, and also investing a significant amount of resources so as to improve the necessary technology. At the same time, we feel that the multi-level alliance is essential to strengthen this health service. Here, thinking of providing better patient care. And to that end, we need to strengthen several factors. For example, the crucial time to provide a response. Also, the care processes, the material and human resources, improving the flow of care, making sure that results are replicable, and also looking at the potential need to comply with ongoing standards. It is important that we provide training of our first respondents. We firmly believe in the importance of having professionals that are highly trained. That is why we encourage member states to strengthen the ongoing training programs at the regional level with the support of international coordination. Thank you. Cooperation. Thank you. Thank you, Ecuador. With that, I recognize Panama. Good evening, Madam President, colleagues. Panama welcomes this strategy on integrated emergency, critical, and operative care 2025-2030. Panama considers that it's very important that we implement this strategy because it helps national efforts. We are doing work with a view to including in the system operational processes that will be a rapid response to emergencies and to also assure specialized and surgical care of specialized conditions. So we are trying to assure quality of care to the patient, providing protection to health staff, and incorporating information technology, as well as doing telecommunication, telemedicine, and having the necessary ambulances and equipment so as to provide a timely response to the needs of the population, all of that based on national and international standards. Priority has been given to emergency care, incorporating telemedicine services with a view to taking specialized care to communities that have limited access, thus expanding our coverage of care. All of that, in terms of the content of the strategy, we support the approval of the proposed strategy. This will benefit our country and it will strengthen our national and regional capacity to provide an integrated response to the needs of surgical care as well as intensive care needs in the region. Thank you. Thank you. Thank you, Panama. We are going to stop here. Tomorrow we will continue, and tomorrow we will recognize the non-state actors. I do have a couple of very special announcements. I wanted to thank you for your active participation during this Directing Council. I consider that we are behind in terms of our agenda, and I would suggest the following for tomorrow. Let's limit our statements to 2 minutes so as to be able to cover our agenda, reduce the coffee breaks to 20 minutes, coming back to room A on time, and also shortening the lunch break to an hour and a half. So we would break from 12:30 to 2 for lunch. I hope that these adjustments to the agenda and by shortening our statements, we'll be able to move ahead more quickly. If we cannot, we will have to lengthen our session tomorrow, Thursday, and work into the evening. So tomorrow we will continue with 4-8, 4-9, 4-6, 4-7, 5-4, 5-5, 8-4, 8-5, 8-6, 8-7, 8-8, 8-9, and 8-10. I hope I didn't scare you. All of the 8s are short, so they shouldn't take much time. So thank you very much. I hope that you have a very good evening, and I will see you tomorrow.